First of all, welcome everybody who's here. I know we have quite a few people that are going to speak under the local state of emergency, and that'll come up in a little bit, and we'll have some comments to make before we get started at that time. Before we get started with this meeting, however, we will have our pastor coming up here in just a minute, and Commissioner Long is going to lead us in the pledge. But before we get there, Commissioner Peters had to leave and go out of town on an emergency matter with her family, health related, and was hoping to be back today. And she's not here with us in person, but she wants to participate in this meeting. And I have talked with the county attorney, and I'm comfortable that we can include her in this meeting, but it does take a vote of the commission, and I wanted to go ahead and open that up to the commission to allow Commissioner Peters to participate fully in the meeting.
Move to approve, Mr. Chair, for Commissioner Peters to participate.
Thank you, Commissioner Long. Second by Commissioner Flowers. Any comments? All in favor say aye. Aye. Any opposed? Motion carries 6-0. Commissioner Peters, you are now part of the meeting and you will participate. I will do my best to be observant when you want to speak. I know Kat's going to work with me as well to make sure that you're heard when you want to be. So just be patient with me as we go through the meeting. Thank you, commissioners. Now, Pastor Josh here, are you? Yes, he's here. And from the Living Hope Church of Largo, and he'll lead us in the invocation, followed by the pledge from Commissioner Long. Thank you.
Dear God, we just thank you for this day, Father. We just thank you so much for every single person here in this room and the blessings that you've given us. God, we thank you for our county leaders. God, we just pray that you give them wisdom, discernment, as they are tasked with dealing with different issues, God. We pray that through this meeting, that our county, our state, and our country will become more unified and stronger together. God, once again, just pray for each of these leaders and their families. God, may you bless them and give them direction. We pray these things in your name. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Pastor. All right. Well, we do have today 4 presentations and/or awards to give out, and so we're going to start first with our Donate Life Month proclamation. The folks from LifeLink Foundation, Tammy Davidson is here. She's a volunteer for the group, and she'll be accepting the proclamation. I'm going to read through that proclamation here from my seat because she'll be online here in just a minute. Nationally, April is dedicated as Donate Life Month. This designation provides a unique opportunity to heighten awareness to the miracle of transplantation of organs and tissue, and to also honor the donors. Throughout the United States, more than 108,000 men, women, and children are on the waiting list for an organ transplant. Nearly 5,000 of those folks are in the West and Southwest Florida area. It is disquieting that an average of 22 people die nationwide each day awaiting an organ transplant that does not come in time. LifeLink Foundation would like to emphasize the need for registered donors, and it continues to grow each day. Registering to be an organ tissue donor is a personal decision, and educating oneself is key. Visit www.donatelifeflorida.org to become knowledgeable about becoming a donor. If it's right for you, there are many ways to register: through your driver's license, state identification renewal, attending a local LifeLink outreach event, or online. So now, therefore, be it proclaimed by the Pinellas County Board of County Commissioners that April of 2021 be recognized as Donate Life Month. And Tammy, it's so good to have you here today and accepting this proclamation. I did want to, just before I turn the mic to you, wanted to show the proclamation that we'll be sending you and your group. So if the camera can catch that. And I think it's extremely important that we recognize your organization and the work that you do. So Tammy, the microphone is yours.
Hi, I'll just speak briefly. My name is Tammy Davison, and my son, DJ, became an organ donor 4 years ago after he passed away, and he was able to save 4 people's lives and enhance the lives of many others. Obviously, the more people that are registered, the more lives we can save. And for me, it's truly healing to be able to see the positive impact that my son's death had, regardless of the negativity of it for me. And I just ask that if you aren't, that you would really consider being an organ donor and letting your loved ones know your decision. Thank you.
Tammy, thank you for being here. I know that this obviously has special meaning to you, and just our prayers and blessings on you and your family and your son, obviously, who made a big difference on many lives. And I know it was obviously with mixed emotions, but you can certainly be proud of what he did. And we're so grateful for your efforts and what you do for our community.
Thank you.
Okay. We're going to have a second item here. It's a public service recognition, and I'll go up to the podium for that. And I'd like to ask Bill Gorman to come forward. Good to have you here. Okay, Bill is the Vice President of the Employees Advisory Council, and he'll be accepting the recognition for the public service recognition proclamation on behalf of the employees of Pinellas County. I'll read through this and then give you a minute to say a few words. The week of May 2nd through 7th of 2021 is recognized nationally as Public Service Recognition Week, and Pinellas County employees, by working together, deliver first-class services to nearly 1 million residents and more than 5 million residents annually. And Pinellas County employees serve as active participants in the county's efforts to develop innovative methods of providing new services or providing services in new and cost-effective ways. Pinellas County employees reach out to the community by volunteering their time and talents, and Pinellas County employees are working hard to be the standard for public service in America. And obviously, what our residents have gone through this past year and what our employees have done to bring services to our residents every single day has been extraordinary. Now, therefore, be it proclaimed by the Pinellas County Board of County Commissioners that the week of May 2nd through the 7th of 2021 be recognized as Public Service Recognition Week. And we encourage all Pinellas County citizens to join us in recognizing our employees who work through the county, providing dedicated service and maintaining a standard of excellence of which we can be proud. Now let me get a mask on here. We'll take a picture. Got a pic. And we'll take a picture and then turn it over to you. Thank you.
Thank you, Commission. It's a huge honor to accept this on behalf of all Pinellas County employees. Everybody went through such a strenuous year over the past year. Everyone's worked very hard. We are very thankful that you recognize the hard work that's done on the front lines. And I think that I can speak from every employee that it's nice to be recognized during the very difficult times that we've been through. We appreciate this, and I'm sure every employee will look very forward to being recognized. Thank you.
Thank you so much. Appreciate it. And we also have a partner presentation today, and I'd like to call up Dr. Martin Tadlock from he's a regional chancellor here at the University of South Florida St. Pete campus. And he's here to walk us through the proposal for a new Center of Excellence at USF St. Pete campus. The center will focus on oceanographic and environmental science and will also include new and expanded programs in STEM education, health sciences, the blue-green economy, visual and performing arts, and just great to have you here today, and welcome.
Thank you, and thank you, Commissioners, for allowing me to take a few minutes. On a personal note, before I get into the presentation, I want to thank you for supporting the proclamation on organ donation. We have a son who's been waiting now for over a year for a kidney. He was living here with us, waiting for that to happen, and I can stress the importance of any kind of support that people have for organ donation and the resulting benefit to life that has for people. So thank you. What I would like to share with you is a culmination of basically the master academic planning that we've been doing at USF St. Petersburg for the past several years, brought together recently after Senator Brandes asked us to pull together a direction for the next 5 years that we could share with our Pinellas delegation members. And we refer to them as academic clusters, which simply means we have 5 thematic areas where we are pulling programming together in a way that creates a very distinctive destination for students who come to USF St. Petersburg in Pinellas County to go to school here that they can't get anywhere else, we say, in the nation, but for sure in the state of Florida and on the East Coast. So I'm just going to share a few of those with you. You can, of course, read these things, so I'm not going to spend a lot of time on the slides. The first one is a Center of Excellence in Environmental and Oceanographic Sciences and Sustainability. Because of our location on the water, our work with the College of Marine Science, the FIO, Fish and Wildlife, and all the other entities that surround us, we have a distinct opportunity to pull programming together academically that creates a very distinctive destination in St. Petersburg, unlike anything you see on the East Coast. We're talking with Tampa about developing programs in coastal and ocean engineering. We are expanding our sustainability and environmental programming as well to the, at the undergraduate, master's, and PhD level, and bringing those opportunities together into a center of excellence that we think will set us apart from other locations in the country. And you can see some examples of that. Environmental chemistry, we plan to launch this fall. There is no environmental chemistry program in the state of Florida. That's one of those distinctive opportunities underneath this center and this academic cluster. We also are taking our College of Education and making that the core centerpiece of a center of excellence in STEM education. STEM being the focus of what we do in preparing teachers for the workforce, so that every individual coming to our campus who wants to be a teacher, an educator, will participate in our STEM inquiry lab during their experience with us over the time that they have on campus, so they understand how to use the STEM-related technologies in the classroom when they get into the schools, whether they be private or public. STEM education will be the focus. That will be different than the focus for teachers who go to the Tampa campus or the Sarasota Manatee. Visual and performing arts, we have what we consider to be an outstanding design technology program in the graphic arts, but we are wanting to expand and build upon that. And by doing that, of course, we want to bring performing arts to St. Petersburg because we have an arts community that's very strong. I'm on the board of Creative Pinellas here in North County, and we know that there's an arts focus all throughout Pinellas County that we basically aren't offering anything academically right now in the performing arts. So we're working with the College of the Arts in Tampa to bring performing arts to St. Petersburg and to Pinellas County, and that is going to fit that cluster. In our business arena, our business academic programming, we have a distinctive opportunity to tie in with the oceanographic sustainability environmental focus and create actually business programming that leaves or has within it options for students to pursue a blue-green focus in their business programming. We will be putting together a blue-green, we're not sure what we're going to call it. Senator Brandes says it sounds hippy-dippy to him to call it a blue-green MBA, so we may not call it that, but we're going to have an opportunity for students who participate in an MBA program to have a focus on sustainability and blue and green at the core of that program. And in the health sciences, we do have nursing now on our campus delivered by Tampa as a second-degree accelerated program. We are expanding that program to provide more opportunities for bringing more nursing students into the world of work in Pinellas County, because these are Pinellas students. These are Pinellas residents who come to that program on our campus. We plan to expand that, and we're also looking at cooperating with USF Health and our hospitals to bring other health-related programming to Pinellas County. One of those is a Bachelor of Medical Lab Science degree program, which is very small, housed in the chemistry department in Tampa, not growing, but yet there's a huge demand for lab scientists here in Pinellas County. We're working to bring that program here, and we have hospitals in the region working with us to get the equipment we need to put a lab in place, and we have a staff member ready to go. Once we get that equipment and lab in place, we can actually launch that program very quickly as an example of what would fit that health sciences cluster. So those are the 5 academic clusters, we're calling them, that we want to head down over the next 5-year period of time. We do not have a set calendar for this. A lot of it will depend on resources we're able to get from the community to help support it. We don't get upfront money to launch new programs. We have to internally allocate for that, and we have to find ways to get partners to engage with us. So thank you, and I'll see if there's maybe a minute or two, if there's any questions anyone has about where we're headed over the next 5 years.
Thank you, Doctor. Any questions? Yep, Commissioner Justice.
Thank you, Mr. Chairman. I don't have a question. I just wanted to thank Dr. Tadlock for his leadership. USF St. Pete has gone through a lot of happenings in the last couple of years, and Dr. Tadlock has done a remarkable job leading the organization and maintaining that focus on the students and moving them forward. So I just want to say thank you. And if you don't believe me, the National Student Affairs Administrators in Higher Ed Association nationally presented him with this year's President's Award. So congratulations on that, and thank you for all you do.
Thank you.
Commissioner Flowers?
Thank you. Thank you so much for being here today. That was a wonderful presentation to share all of the great things that are going on for our areas of higher learning. I am especially excited about your STEM programming. Pinellas County Schools partners with USF to have that huge STEM program on your campus that affords the opportunity for persons of color to actually have that hands-on experience. But I also think it will lend credence to perhaps more minority students really looking at USF as an opportunity to go to school. I love all of your areas. So glad that you all reversed your action on the School of Education.
So are we.
Yeah, because, it's a direct feeder, and the Call Me Mr. program that targets African-American males to go into the field of teaching, specifically in communities where education is a challenge for some people, is fabulous. So I'm just super excited that you all continue to be a great partner, and I look forward to anything that I can do to be of support and assistance.
Thank you, and I'm very pleased you're aware of that program. It's gotten some support locally for funding to provide scholarships. We expect that will help accelerate the Call Me Mr. program coming to life on our campus, which is where it's designated to start.
Exactly. Clemson University started that, and several male members of my church actually went to college and graduated through that program and are here teaching. So I can speak firsthand of, knowing individuals and how it helped the community. So thank you all again so much. I really appreciate it.
Excellent. Thank you.
Anybody else? Well, again, we're honored to have you here today. Thank you for sharing a little bit about what's going on at university, and look forward to more great things in the months and years ahead.
And thank you as a commission for your support. I mean, we have had a very safe environment on our campus. Our students have done extremely well. The community has been extremely well and has done a really good job supporting us as well. And I thank you for being brave and taking the action needed to help make sure our students were protected during this last academic year. So thank you.
Thank you again. Appreciate it. All right. Our last presentation, we do occasionally every other month, we do a presentation from Commissioner Justice about Pinellas County. So, Commissioner.
Thank you, Mr. Chairman. We are excited this month as we have our Pure Pinellas presentation. We talk a lot about Pinellas being a community of the arts and everything that means. And today we are very fortunate to have Christian Kashmir with us. Christian began his career as a video editor and cinematographer working on numerous features, shorts, and documentaries. He has founded Lightwave Media, a film studio and production company based in our area. He's filmed around the globe for shows like Captive, Shark Tank, National Geographic's Drain the Oceans, The Chew. He's worked with artists like AC/DC, Foreigner, The Moody Blues, and others. He's directed over 30 narrative films, and in 2021, he's opening one of the first digital LED volume studios locally. So we're excited to have Christian here and learn more about what he's up to and how film is happening in Pinellas County. Welcome, Christian.
Hi there.
Hey, thank you so much for having me. I really appreciate it. It's a great honor to be here. Thank you, Commissioner Justice and all the other commissioners for having us. So we're really excited about making films in St. Petersburg. We think it's an awesome area to be. It offers a lot to everyone that's involved in filmmaking. There's great locations here, great weather, and we've been in St. Pete for 15 years now, and we're looking to expand. We want to bring some more projects to the area. We've had the opportunity to have some really, really great projects. You mentioned a few of them, and I'm going to play a few clips for you today, just to kind of give you an idea of what we do and maybe talk about the future of what we'd like to do here in Pinellas County with Lightwave Media. We have a little clip. If they could play that, this will be a little demo reel that shows some projects we've done. If they could cue that up, please.
It's a fraction of the whole, but it's hard to control. Get this straight. You can't count on a second chance. The second chance will never be found. You can't count on a second try. The second try will never come round. You can't count on a second chance. The second chance will never be found. You can't count on a second try. The second try is such a come down. It's a fraction of the whole, but it's hard to control. Get this straight. You can't count on a second chance. The second chance will never be found. You can't count on a second try. The second try will never come round. You can't count on a second try. The second try is such a come down.
Love elephants. As you can see, we love to film in the area. We do a lot of projects here. Fort DeSoto is one of our favorite places to film, and we have found that our studio has kind of been reaching capacity, and we've been having a lot of different films and different companies that shoot commercials looking to basically have a larger facility. So this year we're opening up one of the first LED virtual production studios in the area. You might have heard about it a little bit in the news. Tampa has one that they just opened, and we want to bring that technology here. Especially now during COVID times, where a lot of production people are producing things virtually on these. Instead of green screen, you're now able to project on a wall wherever you want to be in the world. So this type of production is really timely right now, and we want to be able to bring that here this year. So wanted to present here and kind of give you a little information on what we do and show that. And in the coming months, we'd love to talk more about that. and what we'd like to do in the area. So we have a building we're purchasing in the next few months, and we'll be setting that up. And yeah, so anyway, just wanted to thank you again for having us here. I would like to maybe play one more clip if there's time of a movie. We had the pleasure of working with Quentin Aaron. He was in a film called The Blind Side with Sandra Bullock. And we filmed 90% of that movie right here in St. Pete, which is kind of odd because it's a Christmas movie and we filmed it on the beach, a lot of it. So we wanted to make it kind of like a different story, different type of Christmas movie. So I think like projects like that, which is called Elfette Saves Christmas. Have you seen it? No? Okay. I'm going to add it to your Netflix queue. So it's something that we'd love to bring more of that type of filmmaking here to the area. So if there's another couple minutes, I'd love to play just a little kind of behind the scenes of that movie for you. And like I said, we have Quentin in this movie and some other amazing actors. Everybody was local. We didn't fly anybody in from LA. There are a lot of films that shoot here, and they fly in their producers, they fly in their directors, they fly in their lighting people. Everybody on this film is local. Even Quentin was living in Florida at the time, and he lived over in Brandon while we were making this movie. So this is what we're all about, just independent, local filmmaking, but trying to bring that Hollywood quality to the area. So I'd love to play this little clip. You might see some locations that you recognize in there. So yeah, if you could cue that clip up, this is Elfette Saves Christmas.
Elfette Saves Christmas, take one.
Elfette Saves Christmas is a holiday movie in the spirit of some of our favorite 80s films. It's a family comedy with a little bit of magic and fantasy elements mixed in. When you think about a Christmas movie, you don't typically think Florida, but we wanted to make a movie that we could produce locally in St. Petersburg and the Clearwater area.
Let's welcome to Florida, Christmas in Florida.
We were able to film 90% of the movie here in St. Pete and Clearwater. One of my favorite parts about producing this movie locally was all of the great talent and actors we were able to find here. You know, a lot of people are flying in, people from LA or New York, but right in our backyard, there's some extremely talented actors.
So in this film, I play the part of Elfette. So she's an elf, she doesn't really believe in herself, she doesn't think that she matters, and through the film, she realizes how strong that she is. Florida, here I come.
So we're on the beach shooting our elf beach scene, which is my favorite scene thus far because we're on this beautiful beach. It's perfect weather. We are just enjoying ourselves while Santa is basically getting beat up by the mafia.
You know, Santa, you seem like a nice enough guy, but you're killing my business this time of year.
A really great part of this film was we were able to have Quentin Aaron, who's the star of The Blind Side, as Santa Claus in our movie. And we're excited to have that A-list talent here involved in projects like Elfette.
What's going on? My name is Quentin Aaron. I am here in beautiful St. Pete, Florida. I'm getting ready to go on set of our new Christmas movie where I play Santa in need of some saving.
A really important factor in choosing to film our movie here in St. Pete was the crew. The local crew and cast here is amazing. Amazing costume people, amazing set designers, people that brought the production value of this film up to a whole nother level. When we were putting together the crew for Elfette, we had to think about things like stunt actors and production designers, really specialized crew members. We actually have a motorcycle stunt scene, and we're able to find those types of talent here locally right in Florida.
My name's Ashley. I'm Elfette's stunt double because, you know, Elfette doesn't do her own stunts.
And we were also able to partner with some great local businesses and film in restaurants and a lot of other awesome locations that you typically wouldn't be able to get as easily. We're shooting at the Sesto's restaurant in St. Pete. We've got a beautiful Italian spread here. We've got our mob boss, Georgie, Shelly.
How you doing?
People and businesses in the St. Petersburg and Clearwater community are very supportive of film, and it made it really easy for us to film here.
Market. Hitman Diner scene, take 5. Marker.
Perfect. I love it, man. I filmed all over the place. Florida got a lot to offer, I'm telling you. The scenery out here is just amazing, and then the beaches, there's nothing like it. St. Pete Beach is one of my favorites, actually. Definitely not going to be the last project that I shoot here. Santa loves me.
You know, most people don't even realize the locations that are available here in St. Pete, Clearwater area. Amazing locations that look like they could be all around the world, but really, they're in our backyard. Great place to shoot, and so thankful that we have it here.
If If you're looking to produce a film, I can't stress enough that this is a great place to come to, and it's a really supportive area where you're going to be able to bring your vision to life. I'm so happy with how Elfette Saves Christmas came out. It started out as an episode of Film Jams, which is our YouTube channel, and it turned into so much more. So it releases November 18th, 2019. I can't wait for you to check it out and see what the team and crew was able to do right here in Florida.
We're gonna have a Christmas movie in no time.
Let's have a Christmas party. You're invited.
Yes.
Maybe.
Amen.
Whoop.
So anyway, thanks for checking that out. Sorry to taking up so much of your time here.
No problem.
But yeah, we love making movies here. All the actors, the crew, they love this area, and we think there's a great opportunity to bring more films here and more projects, and hopefully we can work with the county and the commissioners to bring some of that stuff here, some of the facilities that we're looking to do. So thank you again. I really appreciate your time. I won't take up any more, and thanks again. Take care.
Good.
If you have any questions for us, or I don't know if you do.
No, Christian, thank you very much for being here. And I think it highlights part of the industry. I mean, everyone thinks about Dolphin Tale or Cocoon or those kind of big, but there's so many jobs and so much that can happen with these other projects. And I love seeing the local spots there. But yeah, I think as we've heard from Tony and his crew, areas that maybe we can support some of this development, I think is important. So really appreciate all you're doing and appreciate you being here to share with the commission.
Thank you so much. Take care. Thank you, everybody.
Thank you, Christian.
Great.
Appreciate it. All right. Thank you, Commissioner. I really appreciate that. Okay. We are going to move into item 5, which is the local state of emergency. And of course, with so many folks that have showed up today, you've left me in a little bit of a quandary, and let me just go through a couple of things first. As most of you know, May 11th is the date that we are going to consider the ordinance and to potentially rescind some of the restrictions, if not all the restrictions, at that meeting. At that meeting, it'll be an ordinance that we're talking about, and everybody who comes will get there full time, and we'll hear everybody until we're finished. Today, we have, it looks like, close to 75 people. I'm going to have to cut that to 2 minutes. And let me just tell you, we have a public hearing that starts at 6 o'clock. We have 5 or 6 cases. I'm going to probably back that up to 6:30. We're going to take a break in there just to get some sustenance about 6 o'clock. And we have about 45 minutes of meeting after the state of emergency. So the drop dead, in my mind, is about 5:15. So it gives us about 2.5 hours after a short presentation here on the state of emergency. And if I'm going to get to everybody, I don't want to not consider people today. So I want to give everybody a chance to speak. And so with the 2 minutes, I think we can get through everybody in a timely fashion. And we'll make every effort to do that. And I'll do my best to get folks lined up so that we can get you there as quickly as possible. And so with that ground, I did want to make one other comment. And at the meeting, at our last meeting, we took a lot of input from our residents, and really I was really proud of the work that most folks did. They let us know how they felt quite passionately, sometimes a little directly. There was 1 or 2 that really did not deserve to be heard here. And quite frankly, I just want to make sure that folks understand what the ground rules are. They're on site, they're on our website, but all the remarks should be addressed to the commission as a body and not to any one member. Speakers must be respectful of other opinions and refrain from making personal attacks. And I'm going to really keep to that. And I'm going to caution you, if you get off that, to get back on target so that you can finish your thought. I don't want to have anybody having to be escorted out or stopping the meeting or any of that stuff. I know that we can get done what we need to be done. I do understand that cutting it to 2 minutes will make some of you have to really adjust your comments. I apologize for that, but I really do want to hear from everybody. And that's really all I want to say about that. But we had, again, an unfortunate situation last time, and I'm not going to allow that again. So with that said, let's talk. Barry, do you have any opening comments?
Mr. Chair, Commissioner Peters has her hand raised.
Commissioner Peters?
Hi, thank you, Mr. Chair. Since the governor didn't renew the state of emergency, before we get into it, could we have the attorney kind of explain what that means? What does that mean to us? What does that mean to reimbursements?
Yeah, Commissioner Peters, just one second. I was going to let the county administrator talk about the state of emergency as it relates to the governor, and so go ahead, Barry.
Well, the governor did sign an extension to the state of emergency for the next 60 days. So that was completed today. It actually expired. There was a confusion. Some people thought it expired at midnight last night. It was actually midnight tonight. And since that time during today, we have received an updated extension of the state of emergency.
For 60 days?
For 60 days.
Okay. All right. So Commissioner Peters, I just wanted to make sure that he got that out there. And go ahead, Barry, with your comments.
So today we're asking for an extension of the state of emergency. As you know, the state of emergency authorizes us to continue to operate, for instance, our vaccine sites, our testing sites, and be reimbursed for any and all costs associated with this through FEMA. Providing an extension until May the 7th is what we're requesting here today in accordance with the guidelines set by the state. I'm going to ask Dr. Cho to come forward, kind of give you an overview of kind of what's occurring, especially with our vaccine sites and testing, and then I'll have a few closing remarks before we ask for you to vote on the extension.
Okay. Good afternoon. Just starting with some of the numbers, some of the trends that we're seeing. We have seen an improvement since in the past week and a half. Our 7-day case count is 180, and as you recall, at the last meeting, it was rising, but it was about 259. So we have seen that improvement there. Similarly, with the percent positivity. Similarly, with the percent positivity, that has gone down from 6.8 to 4.9%. Since the last meeting, we have seen about 27 deaths. So that's something that we're continuing to monitor, but in terms of the rate and the weekly death, that has gone down as well. So some positive news and trends as we see them. In terms of the hospital capacity, it's stable at this point. We do continue to have COVID-occupied individuals hospitalized with 182 still in the hospital beds as of this morning, and we did see a slight increase over the last few days in the ICU at 46, so something we're also continuing to monitor. Now, in terms of the variants, the Florida Department of Health is looking at it at a statewide level. To date, we have over 9,200 types of variants, the majority of which is the UK variant, but certainly in the state of Florida, we do have all the variants of concern as defined by the CDC. The vaccine efforts continue. Currently, as of this morning, we have 17,796 individuals that received at least one dose. What that translates is to about 42% of the total population, 30% completing the series. For those older than the age of 18, we have about 50% that have at least received one dose, and 36% completing the series. And for the 65 older population, 73% with 62% completing those series. In terms of some of the news you may have heard as it pertains to some of the vaccines, Pfizer is currently pursuing an approval for those under the age of 12. So hopefully we'll hear that in the next two weeks. You may have also heard that the Johnson & Johnson vaccine, the FDA did resume the vaccine with a little warning for those rare blood clots. So that has restarted and has been reapproved. Now, in terms of our distribution, our efforts continue, especially at our community vaccination sites. At the state site, at the Clearwater YMCA, as well as our various pharmacies. The bigger concern and the issues that we've seen now for the past week is a huge drop in demand. We've had a lot of vaccine slots go unfilled, hundreds, and this is similar to what they're seeing at both the state site as well as the various pharmacies. As a result, just because of that decrease in demand, we are looking to consolidate sites. We're looking to shift priorities and strategies to see what the capacity of the private sector is. So we'll be working on those types of plans moving forward. That to me is actually one of the bigger concerns. Obviously, the higher the amount of vaccine or people vaccinated in the community, the better to reach that kind of herd immunity. And really the best way to get past this pandemic and to prevent future outbreaks is to get more people vaccinated. So I would encourage everyone listening here today to speak to your physician as to the benefits and the risks of the vaccine. And with 50% of adults here in Pinellas County at least receiving one dose, you certainly know somebody that's received the vaccine, a family or friend. So I encourage anyone that has any questions to ask them, as well as to their experience, how they came up with their decision, and what concerns that they had to really better inform your decisions. So with that, I'll stop there.
Questions from the commissioners, but Jewel, if you can maybe speak to, not right this minute, let me get the questions first in a minute, talk to the state of emergency, the dependence or independence of the state of emergency locally versus the state of emergency. So maybe you can speak to that in just a minute. Not that it's pertinent, because we just heard, I mean, that part of it's not pertinent because he's extended, the governor's extended for 60 days. And then, so we'll go to questions for Dr. Cho first, and then Jewel, if you can comment, and Barry, we'll let you finish up with presentations. Yes, Commissioner Flowers.
I have a question. I guess this would be for Dr. Cho and Barry. So because of the state of emergency, that's what affords us the opportunity to continue with vaccinations, the provision of vaccinations, correct?
Yes.
Okay, so once that state of emergency, whenever, if he decides, you know, that he's not going to extend that, then how do we address the continuation of the vaccinations?
So I'll let Joel, County Attorney, to speak to the issue of that. But you know, my understanding is we have the conditions to establish a local state of emergency. Okay. That in and of itself gives us the ability to be reimbursed. This is simply a reimbursement tool. Running vaccination sites or that is still a distribution issue. So if we wanted to do that indefinitely without a state of emergency, we could do that. Okay. Just the cost associated with that would not be FEMA eligible.
Okay, that's where I wanted to. So.
Okay. Any other questions for Dr. Cho? Yeah, Commissioner Justice.
Thank you, Mr. Chairman. Just as a general rule, what is the percent that we're shooting for vaccine rate to get to that herd immunity, for lack of a better term?
I think it's really dependent on what the studies show, but it's range anywhere from about 70 to 85%. In terms of getting to that immunity, it does include to some degree, which isn't as consistent, the natural infection plus the vaccines. But the concern with natural infection sometimes, especially if you do have a mild case, that you may not mount a lasting antibody response with natural infections.
Thank you.
Commissioner Long.
Thank you, Dr. Cho, for your report. And did I hear you correctly when you said that our weekly positivity rate was down to 4.9?
Mm-hmm.
That's really good. Secondly, at the rate we are vaccinating people now, when do you anticipate that we will be at that 70 to 85% of our population vaccinated? Is that I think that's the right question we need to know, right?
Well, it is, and Dr. Cho can certainly speak to this. But you know, the issue of we're watching this literally week by week, and so for the past 3 weeks we had full slots, and so the second series of shots are full for the next 3 weeks for the second series. However, as of last night on our call, we've seen a dramatic shift in people signing up for first shots. That was unexpected. I mean, we knew there would be a drop-off the longer we went into it in younger populations and things like that, but it's been pretty significant. That's going to affect the time period in which we get to a higher level of people being vaccinated. And so that's something that we're going to have to watch. We're also trying to get the numbers from the private sector because there's a lot more sites that are available with the advent of Walgreens coming online in their stores. And so we're going to have to consolidate that information to be able to tell you kind of where we're at. That's the reason that the May 11th meeting was so important. It gave us time to kind of see how this plays out over that 3-week period.
So I have a follow-up, Mr. Chair. So thank you for that, Barry, because that leads me to say, is it possible, Dr. Cho, with so many of the private folks getting into the vaccine distribution business, I guess for lack of a better word, that our numbers could be not accurate? I'm just curious.
Well, it's really dependent on the providers actually entering within the surveillance, the reporting system called Florida Shots. But as a clarification, all of the ones, the pharmacies and all the medical providers do add it into the system. The only thing lacking in that system and the sort of the tallies is some of the federal programs, whether it's the DoD, whether it's the VA program. And we have been talking to them on a regular basis to get an idea of how they're vaccinating. In terms of the VA, something that we can add as we have over 15,000 vets that got individuals in Pinellas County that have gotten vaccinated through the VA, so that we do calculate that to some degree and add it to those percentages I read off to you.
Thank you.
Commissioner Gerard, Commissioner Peters is next. Go ahead, Commissioner Gerard.
Okay, I just had one question. I know there have been some surveys talking about what percentage of the population, or the adult population at least, is likely to get a vaccine, but I can't remember what it is.
I think it's really dependent on surveys.
70%?
Yeah, I thought it was about 70%. That's why it's a little disappointing to see some of the numbers of where we're at.
Right.
If those surveys were true, then I'd love to get closer to that number. Obviously, the higher the number, the better. And the concern is just that the rate that we've seen, and we've seen a huge drop-off in the daily increases on the vaccines over the last just handful of days. And to get to that number, it's going to be that much harder. The one hurdle, obviously, we're looking at, one of the measures we're looking at least that first marker and see if we can pass the 50% completely vaccinated. And we do project that sometime at the end of May.
Commissioner Peters?
Thank you. And Dr. Cho, you kind of answered my question, but when you report again next time, can you include the veteran number so we have a better idea?
Okay.
And I know you worry about the naturally immune people that had the virus. However, they're still making memory cells and T cells, so I still think that they need to be counted. So if you add those in and the veterans in and the numbers that we have, that puts it at pretty darn close to 50%, just shy of 50%. And 20%, I think I heard you in a meeting say that 20% of our population was under 16 or under, so they're not eligible for the vaccine. I believe that's what I heard you say. And if 25%, according to our survey, said they aren't going to get the vaccine, that leaves about 5% of the population that's willing to get the vaccine. I just want to make sure I'm kind of in the right thing. So 5% is all that's left in the population to vaccinate. I know you're doing marketing things to try and convince the 25% that said they weren't going to get it to get it. To me, when I do that kind of math, it doesn't appear that we're going to hit 80% when 25% say they won't get it.
Right. It's going to be difficult just because of the demand issue, and certainly that we're going to watch from time to time. The other issue with the natural infections, and I'll have to look at to see if we can decipher it, but I don't know if we track of those infected how many have gotten the vaccine. The CDC does currently recommend, even though you have been infected with COVID, still to get the vaccine. So there could be certainly a lot of overlap for those that previously was infected. And in terms of some of the numbers that I've read, it is 18 plus or 16 plus is what the state's following just because of the eligibility.
Okay, thank you.
Anybody else for Dr. Cho right now? Jewel, could you go ahead and comment?
Sure. As you recognize, the governor did extend the state executive order just earlier today, shortly before this meeting. However, quite a number of folks had posed questions to me as to whether the county could continue with its own local state of emergency if the state declaration of emergency were to expire. The county can, in fact, continue with its own independent state of local emergency, notwithstanding whether the state has extended theirs or not. Of course, at this point, they have. I know that you all have received some communication with some, what I will call outdated legal research that talks about a law that existed in the early 1980s. That law has changed as of today. Currently, we do have those powers. In fact, we did, even as that research indicated, as of 1983, had those powers. So I would just comment that that is an outdated opinion. But yes, the counties within the state of Florida may, on their own, declare a state of emergency, and that is a power that is derived from Chapter 252 in the Florida statutes. The county administrator briefly touched on this issue previously, but as to some of the powers and duties that we get, counties are given very broad powers when you have a declared state of emergency. Among those, protecting the health and safety of your citizens. So a lot of the activities that we've been conducting over the last year, be that testing or at this point vaccinations, would fall within that category. As the county administrator mentioned, a very important aspect of your local state of emergency is the ability for Pinellas County to get reimbursed for all of those efforts, which, as you have all heard over the last year, have been undertaken at a significant cost to the citizens of Pinellas County. And Mr. Chair, I'm not sure if I've answered all the questions.
That's fine. That's fine for now. We may come back to you. Barry?
The last thing that I would comment on is we're going to watch kind of how this plays out. You know, it was always intended that as testing and vaccine distribution increased, that it would be pushed to the private sector, that as the Walgreens and the CVS's and things come on board, well, we're going to watch that, and as that ramps up, we're going to make associated decisions with our pod sites and with our testing sites. Even on our testing sites, there's a lot of people that are being tested that they have to get a test to go back to college. They have to get a test to go overseas or things like that. We want to make sure the capacity is there. At the same time, we don't want people working overtime, which, you know, is in standing around without people coming into the sites. So we're going to be skinning down the lanes. We're going to be trying to right size our sites. But over the next several weeks, we're going to be making some decisions regarding what we provide and what the private sector provides. But we're going to make sure there's capacity for everybody that wants a vaccine, they can get a vaccine, or needs a test, can get a test.
So just for clarity, I want to make sure that I understand. You're suggesting a state of emergency right now to reimburse us for the expenses associated, to be able to get reimbursed for the expenses associated with testing and vaccines from our independent sites.
Well, the state of emergency does that. It also provides the authority, as we said, to protect our residents. So, for instance, we have, not only do we have the ordinance, but I also have a requirement for safety plans for large events. And so that falls under that same authority.
Okay. Any questions for Dr. Cho, Jewel, or Barry before we start hearing from the residents? Again, today's action will just be on whether to extend the state of emergency. Staff's recommendation is that May 11th will be the date that we consider rescinding the ordinance. And I think, Jewel, you have made that available on our I think it's on our website.
We have certainly coordinated with Board Records to have the advertisement placed for the May 11th public hearing, and the ordinance is available through Board Records.
Okay. Thank you. All right, thank you, Dr. Cho, for now. Okay, well, we're going to go ahead and get started. Again, understand that when we take this up May 11th, you'll have a full 3 minutes to give us your thoughts. Today, we're going to limit it to 2 minutes. And please, if you can speak less, that'd be great, so we can make sure that we get to everybody, because we do have some critical times I'm going to have to stop it. So I'm really hoping to get through, and I'll shut up and start that process right now. So first up will be Carrie Turner. Stephanie Gray will be second. Stacy Geyer third. Carrie Turner, Stephanie Gray, and then Stacy Geyer. Hi, welcome.
Hi. My name is Carrie Turner, and you have to excuse me, but the last time I stood in front of a podium, I was arrested and assaulted by Pinellas County School police officers, so I'm a little intimidated right now. So yeah, Ms. Long, people have been arrested because of a mask issue. I was one of them. You stated in your workshop...
Please, I asked you
You stated in your workshop that nobody had been arrested because of a mask issue, and I can very well guarantee you that I was arrested and charged with felony assaulting an officer by the school board police because of a mask issue. Now, my daughter was also assaulted on that day, which brings me to my main point of being here. I got a phone call this morning. My daughter is going to be apparently put in virtual school tomorrow because she has been caught 4 times since January with this mask underneath her nose. Now, I know this isn't the school board. I get that. But the school is part of your county. And as commissioners of this county, you need to be made aware of what is going on with this school board and the way they're treating your citizens. My daughter was in my PCS online whenever all the schools were shut down. She went from B's to D's. She got her grades back up. Now they want to put her in virtual school. She's supposed to be going to Tarpon Springs High School for a vet program next year. All advanced classes. If she goes to virtual, she will fail this school year because she cannot do the online learning. She needs in-class structure. The mandates, their order, whatever, says that there will be no punishments for improperly wearing masks, yet my daughter's been punished not once, but twice now if they put her in virtual school. She was forced to write an essay about the good things that masks do for people, which she did not write, I did, because I do not feel she should be punished for something as stupid as a mask.
Thanks, Carrie. Stephanie Gray, Stacy Geyer, and Jennifer Fair.
Hi.
Welcome.
Thank you for having us speak today. My name is Stephanie. I've been in healthcare for almost 17 years. First and foremost, though, I am a mother and I am speaking today for the children. I work at a walk-in clinic and I watch every day with my own eyes the condition of our community. As I am boots on the ground, I can tell you that I see a lot of illness in our community, but it's not COVID that concerns me any longer. What I see is a huge amount of people, especially children, being affected by strep throat. Many do believe that this is attributed to the near constant mask wearing that our school children are being forced to endure every day. I see a huge amount of what would be mild colds turning into lingering and never-ending respiratory illnesses, which many believe are because of our weakened immune system, an immune system that wasn't allowed to be exposed to anything for over a year. Children are meant to, in these youth years, to grow strong bones, strong minds, and strong immune systems. Because we have put the burden on them to mask up and social distance and breathe what seems to be a constant stream of Lysol, we are robbing them of the ability to build immune systems. We need to restore normalcy to our children, and we need to allow them to breathe fresh air and to strengthen their immune systems the way that nature intended. We have long learned over this last year that masks do not equal slowing the spread. No studies have been done that prove their effectiveness, as we presented to you last meeting. That information came from the CDC. Many counties have now chosen to remove their mandates because of all this information and their experience over the last year. You guys, the commissioners, you hold the power to remove this mandate and influence the school boards and the community to stop enforcing it on children. I ask of you to please step up and do what's right for the children. Thank you.
Thank you, Stephanie. Okay, Stacy Geyer, Jennifer Fair, and then Shannon Harrison. Welcome, Stacy.
Hi, thank you. My name is Stacy Geyer. I live in Largo, and I realize that the official vote will not be until May 11th, but I'm here asking that you end this mandate today. The behavior of some of the members of this board toward our community has been disappointing. Citizens have been criticized and demeaned for providing data and scientific studies showing the ineffectiveness of masks from credible sources, with the claim from some of you that the information in these studies is questionable. This was even said by a commissioner about the roundtable that Governor DeSantis had with Stanford and Oxford-educated doctors and scientists. We were told that you all were elected to lead our county, and that's what you are trying to do with these mandates. Yet, there are pictures of you all not even following these own rules. And I have some of these pictures today that I would like to share of current commissioners not wearing face masks or social distancing during this pandemic, as you are mandating for the rest of us to do. The first one I have is Commissioner Long with former Commissioner Welch on November 7th. And you can see Commissioner Long does not have a mask on, neither are they socially distanced. On November 14th, this was posted of Commissioner Flowers, not socially distanced inside a building with 2 other people.
Ma'am, could you just leave those with the
Yes.
and speak to your point?
Yes.
I understand none of us are here perfect.
One more. Barry Burton, who was delegated authority right here in the corner in a meeting without a mask on, walking around.
So, ma'am, continue your comments, please. You
Yes.
just
So
have 15 seconds.
we just ask, when we see commissioners not even following the rules that we are expected to follow, it gets frustrating. This is why you have so many citizens being angry and some of the stuff that is being said.
Thank you, Stacy.
Thank you.
Jennifer Fair, Shannon Harrison, and Sarah Schultz.
Hi, thank you for this opportunity. My name is Jennifer Fair. I am a local Scout leader. I own 3 businesses in Pinellas County, and I'm an active member of this community. I am here today to talk about face masks. Commissioner Eggers, our paths have crossed before. I brought my son's Cub Scout den into City Hall when you were mayor of Dunedin. You made a big impression on our family, and I hope to make an impression on you here today. Face masks have become a tool of hatred. They are dividing people. It's the norm now. You don't wear a face mask, and a stranger goes out of their way to berate you. You don't wear a face mask, and people treat you as an outcast. 2020 is over. It's a year later, and have we learned anything? Here is what I hear people talking about. We know that no matter where you live, and no matter what the mask law is, there is a 99% survival rate of COVID. We know that the majority of people who have had COVID do compare it to a bad flu. We know that people who wear masks and are vaccinated still get COVID. We know that for many people, face masks are for show only. Most of them simply put them on so that they can go out and do their shopping and not get yelled at. We know that people who have to wear masks all day are being treated for respiratory problems they never had before. We know that Florida lawmakers have decided it is unconstitutional for students to wear masks and are going to make it optional in the fall for 2021, 2022. So I would think that that would mean it would translate to being unconstitutional today. We know that Pinellas County is surrounded by places that have dropped their face mask laws. We don't know what the long-term psychological effect is of this on our children. And it is between you guys and us to stop this and to allow us to breathe again.
Thank you, Jennifer.
Thank you.
Appreciate your adjusting your comments. Shannon Harrison, Sarah Schultz, and Patty Pereira. Welcome.
Well, thank you. Shannon Harrison, Largo. Randomized controlled trials, RCT, are the gold standards of effectiveness research. The CDC in May of 2020 found that 70 years' worth of 14 RCTs showed that community mask wearing had no substantial effects with preventing or transmitting influenza. The CDC, also in May 2020, shifted to aggressive mask recommendations, even though their analysis of the 14 RCTs within that same month have not been retracted since. The burden should be on the Commission and Dr. Cho to demonstrate how these May 2020 CDC findings and 72 years worth of RCTs regarding community mask ineffectiveness could have been legitimately retracted within only 1 month's time. The findings in these RCTs are confirmed by the empirical data nationwide and locally. COVID metrics upturn even with high compliance in locations with coercive mandates and downturn in locations with no mandates. This confirms that the community mask wearing or policies have no bearing on rising or falling infection rates. This March, Texas lifted mandates with a return to full capacity for all venues, and cases have been declining for 2 months since. There are peer-reviewed clinical studies demonstrating that zinc, quercetin, selenium, and vitamins C and D are effective in preventing and treating COVID, thus providing stronger evidence of prevention more so than that of community mask wearing. It is perplexing that the Department of Health and the Commission would give the speculative and coercive intervention of community mask wearing more weight than that of diet, exercise, and supplementation for better health, which could keep people from getting sick. The mask mandate should be ended from here on out. 80% of patients are vitamin D deficient, 78% hospitalized are obese, 94% deceased at underlying conditions. The Commission and Dr. Cho should consider diet, exercise, and supplementation campaigns rather than ineffective intervention based on threat, duress, and coercion.
Thank you, Shannon. Sarah Schultz, Patty Pereira, Callie Alonso.
Did you like...
Could you get in front of the microphone, please, so that we can hear you? Sorry.
See my signs.
We can see you.
Okay. But did you like not being able to know what I just said? Did you know that there are 349,000 hard of hearing deaf people in the Tampa Bay area? Did you know that? Did you know that 90% are deaf children who, in order to have total communication, they need to be able to read the lips, see how you pronounce the L's, the M's, the D's. They have to see that to have that total communication. And for a year, these children, these hard of hearing adults, have had that taken away from them. And I work with them. I have a degree in deaf communications. And it just makes me so sad that they are not able to have the communication that they so deserve. We are a free country. They deserve it. So it's time to take off the mask and to communicate. They need to see the lips. They need to see the expression. You, when you are with them, you can't just read their sign language. You need to be able to read their lips, their eyes, and know that they have anxiety. So please remove the mask.
Thanks, Sarah.
I'm Patty.
What was that? Oh. Patty Pereira. Okay, is Sarah here? No, okay. Callie, come on up. Sorry about that. David Happy and Althea Greenberg will be after this, after Callie. Thank you.
Cool. Hi, everybody.
Hi.
So, are you ready?
Yes.
So I'm Callie. I'm from Clearwater. And I just wanted to tell you just a little thing what happened to me last week, because I was here, and last time I was here, it was said that we do have this mandate, but we do have exceptions for medical exemptions. And you would think that places would be following that, but I will tell you exactly what happened. And just so you know, I am a calm person. Anyone who knows me, I don't get crazy. I don't yell. I don't scream. I don't argue with people. I will just talk to them like the way I'm talking to you now. So I was at a restaurant. It's called Our Place Dunedin, if you've ever been there. And we went in, and so some friends of mine wanted to go eat there. I told them, I can't wear a mask, because they were actually about to seat us, and then they saw I didn't have a mask on. So this is a table. To walk there, he said, no, you got to put one on. I said, well, I can't wear one. And so one would think, well, why don't you just put it on for the 5 feet? Well, why don't I just not put it on for the 5 feet? Everybody else is not wearing a mask. If this is for my safety, what science is changing the fact I'm walking here and I'm going to take it off anyway? Besides the point. So anyway, it goes on. We left. It's fine. I'm not going to spend my money there. And then I just wrote a review saying, don't come here if you can't wear a mask, because they won't follow the mandate. I did bring this up to them, that there are medical exemptions. They said, show us that. So I said, do you not know the mandate? Because if you said you're following it, you should know what it says. They said, show it to me. And anyway, they couldn't show me that. So what they wrote on their review was basically that they were going to release the surveillance footage, which they could. I was just talking to them. Then they posted this on their Facebook page, and they said, actually here they said, the attitude this woman had was so bad, I strongly think she needs counseling. I have to say I'm proud of our staff for standing up today, even after verbal assault. Yeah. So this is the stuff that we're dealing with. That's why, end this thing. People will put them on if they want to, but those of us who can't or won't, let us just live the way we should and not have this kind of stuff going on. It's really obnoxious. Thank you.
Thanks, Callie. Dave Happy, Althea Greenberg, Whitney Wogan.
Someone said that she thought you got your powers from the ordinance. Apparently we're forgetting where you get your powers from, but glad to hear you admit it's about the money, because it's about $175 million that y'all have taken in CARES money. Now the administration kept $16.4 million of that, little under half of what you sent out to the businesses. Mr. Burton's going to tell you this is all itemized on the website. Let me tell you how it gets itemized on the website. You spent $7 million from our administration on personnel. You spent $7 million on goods and services. That money could have gone to the businesses you forced closed. In fact, you only gave about half as much of the money to the businesses as you gave to the Pinellas County Health, $55.9 million. This is the guy that comes in and speaks to you every 2 weeks to tell you to keep this going. He hasn't received all this money yet. He's received about half of it. Hey, you give me $55 million and I'll come in and wear a mask every time I come to speak to you. Mr. Burton said to the Tampa Bay Times that there was another $13 million that he was going to be able to allocate to the cities at his discretion. Don't know if that happened or not. We'd just like to know where the money is. We're happy that you gave $17 million to the Pinellas County Schools in addition to the money you gave back to the people. Maybe this is the only appropriate money you gave out. We don't know. We'd like you guys to have a little bit of intellectual curiosity, since you abdicated your responsibility to an unpaid or to a paid unelected administrator, your financial responsibility. Take it back, show us where the money is, itemize it. We don't know what $7 million in personnel means. Who possibly did you guys hire that you paid a combined total of $7 million? If you spent $7 million on products and services, that's an awful lot of Krispy Kreme donuts. So we'd like you, our representatives, to tell us where our money went.
Thank you, Dave. Althea Greenberg, Whitney Wogan, and Amanati will be after that.
Hello, my name's Alethea. I guess I'd like to start off with saying, it's okay, no problem. Everybody gets my name a little off, and it's no problem. But the first thing I'd actually like to say is this is extremely nerve-wracking to have to speak like this. It's not something I would normally do, but I feel very strongly about this, and so I'm here to do it. I would like to ask that the mask mandate get removed, because it's actually giving me personal problems in that I have a sinus. One of my sinus tubes is smaller than most, and so it's hard for me to breathe on a regular basis. But with the mask, it's very hard, and it makes it so that I'm often short of breath, dizzy, and it's actually greatly affecting my quality of life. I know I'm not the only person who experiences that, but obviously I can just speak from my own experiences and what's happening with myself. I don't see that the benefits of having a mask outweigh the benefits, if you understand what I'm trying to say. I'm saying I would like to have them removed because of that. The other thing I feel is that this is actually an experiment. This is not something we've done before. It's not something that we know works. If it was something that we knew worked and we were going to actually do it for that reason, okay. But it's actually just an experiment that we've been doing for an entire year. I think it's time we end the experiment. Go back to actually having our daily lives and actually increasing our quality of life again, and being able to see each other smile, know each other's expressions, breathe. So that's what I came here to say. I really just would like to really ask that we do look at that and remove the mandate. Thank you very much.
Thanks, Alethea. Okay, Whitney Wogan, last name is Amanati, and then Karen Nazalo, or Mazalo, one of the two. Hi there. Welcome.
Hi there. Thank you. Thank you for your service in the county government. I appreciate it. My name is Whitney, and I'm here to talk about the definitive harms of long-term masking. If these mask mandates are ostensibly for our health, then that should be the measure by which we consider further masking. So in that case, we have to look at the entire array of health effects. I'm submitting a detailed list of studies detailing the deleterious health effects of this policy of long-term masking. Among these are low blood oxygen. Contrary to repeated assurances, masking does lower blood CO2 levels between 5 and 20% if worn for a prolonged period of time. Sudden cardiac arrests, increases in respiratory distress, dizziness, lightheadedness, distress, bacterial and mold buildup on masks, resulting in the same increase in lung tissue. Behavioral disorders, as you heard about earlier, delay in speech development, impaired cognitive development in children, inhalation of toxic substances from mask material, which is already being linked to early stages of pulmonary fibrosis, facial skin infections, nose, throat, and sinus infections, and increase in gum diseases and cavities. This list doesn't even begin to address the psychological and societal effects of mask wearing, which are probably even more pernicious. So while it may be comforting to hide behind CDC mask guidelines, the design of our government was not set up for you to abdicate your responsibility to an unelected federal agency. Anybody who is willing to look honestly at the data will see that mask wearing is causing our health to dramatically deteriorate. I encourage you to look at all the data. Please don't double down on masks. Thank you.
Thank you, Whitney.
Do I have someone, is there someone I can give this to?
Over there.
This is the,
Mr. Amanati, Karen Nazalo, and Melissa Nash.
Good afternoon. I'm a citizen, a simple citizen with common sense, and I have been looking at the situation with the mask, and I have looked at the efficiency of the mask and the benefit of the mask. I don't know how many people realize that masks, the virus is measured by, not by centimeters, not by inches, not by millimeters, which are 25 times smaller than inches, but by nanometers. Nanometer, it's a measure that it takes 1 million of nanometers to make 1 millimeter. And the size of a virus is between 10 to 500 nanometers, which means that it takes, that the virus is 100 times smaller to 2,000 times smaller than a millimeter. And you know how big a millimeter is, how small it is. So how can a mask stop something like that. A mask cannot stop a virus. And as far as the benefit of the mask are concerned, when we have a mask and we inhale carbon dioxide, CO2, what we are really doing, we are acidifying our system, and that opens the door for very serious diseases. Plus, we bring in with the fragments of fiber from this mask that they are chemical product along with a petroleum product. So you can imagine how good they are for our system. Along with the fact that when we do exhale and we have a mask on, the vapor that it comes from inside of our body is going to make the mask humid. So viruses and bacteria, they're going to stop there, and we are going to have on our mouth an infected bed full of viruses and bacteria.
Thank you.
We do not need the mask. We need to get rid of them.
Thank you, Mr. Amanati. Karen Nazolo, Melissa Nash, and Sue Brewster. Welcome, Karen.
Thank you. Can you hear me okay?
Yes.
I'm Karen Nasello. Thank you, Commissioners, for the opportunity for all of us citizens to attend today and speak. So my first question is, or statement actually, is respiration is one of the ways that we detoxify our bodies. Of course, I'm going to talk about the mask mandate like many people already have today. So do you know what you breathe out when you exhale? CO2, toxins, bacteria, and viruses. So how can it actually be healthy for anyone to rebreathe all of these things, especially for hours and hours and day after day? It's actually the opposite of health. It's harmful. So I guess everybody's already heard this, but there's enough proof and real science at this point in the pandemic that proves that masks do not protect someone against any virus. The viral particles are smaller than the smallest point in the mask. And thankfully, I received this today through the America's Frontline Doctors, which I recommend everyone subscribe to and support, the Stanford Mask Study, which was just published. And I have a copy of it. I'd like to present it to and I just want to read the conclusion real quick. Of this study, the existing scientific evidences challenge the safety and efficacy of wearing face masks as preventive intervention for COVID-19. The data suggests that both medical and non-medical face masks are ineffective to block human-to-human transmission of viral and infectious disease such as SARS-CoV-2 and COVID-19, supporting against the usage of face masks. Wearing face masks has been demonstrated to have substantial adverse physiological and psychological effects. These include, and there's a real long list, but the first couple: hypoxia, hypercapnia, shortness of breath, increased acidity and toxicity, which we know leads to many other adverse effects. So there's a long list here. So my opinion is that it's actually quite simple. So if the elected officials...
Sorry.
Okay. Thank you.
I know you've had to cut your thing short. Sorry about that.
Thank you.
Okay, Melissa Nash, and then Sue Brewster, followed by Megan Panic. Hello.
Hello.
Welcome.
Thank you for the ability or the opportunity to speak to you. I could speak to you as a former researcher for Big Pharma, but I'm not going to take that route today. I would rather address you as a mother of 4 and a wife of a professional who works with the special needs children in the Pinellas County School District. Sheriff Gutierrez has established a task force here in Pinellas County, and this task force is specifically identified for the increase in Baker Acts among the youth in our population. Chase Berger, or Officer Chase Berger, I believe is his name, is one of the officers who is in charge of this. And the reason that they have established this task force for the Baker Acts here among the youth is because there is an increased rate of depression in our youth in these schools. My husband comes home every day, tells me stories. If you heard these stories, you would really consider the health and safety of our youth as not just their viral safety, but actually their well-being. If they don't get through the next year because of increased suicide rates, increased depression rates, you're not going to have to worry about putting a mask on their faces. So please, when you consider this, take into account their mental wellness as well as their physical wellness, because the two go hand in hand. Thank you for your time.
Thank you, Melissa. Appreciate it.
And also, we don't have a spirit of fear.
Sue Brewster, and then Megan Panic, and then Holly Hands.
Thank you. I want to thank you all for seeing me and letting me speak this afternoon. I am here to remind you all that our Governor, Mr. Ron DeSantis, has freed us from the obligation of wearing masks, and I know that it's county by county, but as a leader in our state, and he's been a good leader, I think we should follow his direction. I'm also speaking to you as a grandmother with 2 grandchildren in the Pinellas County Elementary Schools. The youngest, who is 7, lives with me. He and his father and I live together. He comes home every day with his mask soaking wet. The children have discovered that it's a great deal of fun to suck on their masks. So at the end of the day, their mask is full of snot and phlegm and everything else that comes out of their mouth. And that's what they're wearing. So they're doing probably more damage to their immune system by breathing this in than if they were just breathing air in. And I thank you, and I pray that you will consider voting the mask mandate out of Pinellas County. Thank you all very much.
Thank you, Sue. Megan Panic, Holly Hands, and then Tabitha Siebert.
Hi, my name is Megan, and I'm from Clearwater. I know we have about 100 people here today, and I just want to say that there's thousands more who can't make it because of work or school, or they're too nervous to get up here, and I think you really need to take that into consideration. 100 is a lot of people. So at the last meeting, you guys talked about needing 50% of our parents or adults to be vaccinated before you felt comfortable taking the masks away. And I see you moving that goalpost today to 70 to 85%, which is not a realistic number when you're already saying that people who wanted to get vaccinated are done and there's nobody lining up anymore at the door. And it feels sort of like coercion. Like if you don't get vaccinated, you're not going to take the masks off. And I feel like that's wrong. You can't be doing that to your citizens. You need to start treating us like we're smart enough to make our own decisions. You can't keep treating us like we're children who need to be told how to wash our hands and how to take a shower and wear a mask all the time. The time has come to let us have our freedom of choice back. 6 of you can vote to end this now, or you can wait until May, and you can do 4 votes, whatever. But you do have the right to end it now. And if you don't end it today, you should take responsibility for the effects that you're creating on the people who can't wear the masks. The ADA laws are not being applied to mask exemptions at all. They call us murderers. They're awful. It's terrifying to go out there and try to not wear a mask if you can't. It's an atmosphere of terror, and it's being created because it's being promoted that this is a deathly illness that has a 1% mortality rate or something like that. It's crazy. So anyway, that's all. Please consider strongly.
Thank you, Megan.
Thanks.
Holly Hands, Tabitha Sieber, and Maggie Graham. Oh, come on up, Tabitha. Let's see if we can get Holly in a minute. Thank you. Welcome.
How are you doing today?
Good.
I'm sure you guys are after hearing all that. I mean, I've been crying out there. I had this whole speech made up, and after I heard these poor women with their single mothers. My name's Tabitha, and I'm a single mother of a 5-year-old, and she is going to school. She was supposed to go to school last year, but because of COVID, she couldn't go. And now she's supposed to go this year, and I was reluctant to put her in school because she had to wear a mask all day. It doesn't make sense that at a bar, you can sit down and drink a beer and not wear a mask. But at a school, she has to wear a mask all day in a classroom. I'm not doing it. She's not going to go to school. And how am I going to virtually teach her? I have to work full time. I'm a single mom. I'm like scared. I don't even know what to do. Like, I'm really upset, and I really want you guys to please consider lifting up this mask mandate because she's behind already. And I really want to let you guys know that we're watching you. We know what you guys are doing now. I'm paying attention, and I'm pissed. And you know what? If I don't get you guys to vote this shit down, I'm sorry, but I'm not making sure you guys lose your jobs.
Holly Hands, did she show? No? Maggie Graham, Beth Fox, Jessica Carroll.
Hi,
Hi, welcome.
thank you. And thank you all for being here. I appreciate your service. The world is in chaos because of a series of falsehoods. I'm speaking to that. Those falsehoods have led to this state of emergency we're in. I'm speaking to that because the falsehoods are what have led to the masks. Research modelers originally said that COVID would kill many, many millions of people unless we shut the world down. The actual death rates have turned out to be about the same as a bad flu. Authorities proposed that people with no symptoms of COVID could spread COVID. 54 studies have now shown the chances of getting COVID from a symptom-free household member is less than 1%. And getting COVID from a symptom-free person in public is virtually non-existent. Department of Public Health have changed the rules on how to report deaths so that most deaths were now required to be reported as COVID. Death rates by other causes crashed. The resulting reports of massive death rates from COVID was a falsehood. The World Health Organization recently owned up to having given false instructions on how to run the PCR COVID test, ensuring massive numbers of false positives. Based on all these false numbers, a public health emergency was declared, which authorized the use of unapproved medical products unless there is no adequate, approved alternatives. My point being, this has been the whole ball of wax is a falsehood. There is no emergency. Let's put an end to the hoax.
Thank you, Maggie. Thanks for adjusting your comments.
Okay.
Beth Fox, Jessica Carroll, and Kristen Strecker. Welcome.
Hi. In web searches, there are many articles of hepatitis cases of restaurant workers in Pinellas, and every one of the reports states along the lines of DOH Pinellas conducted an epidemiological investigation and determined an individual may have been infectious. The website for DOH Pinellas Epidemiology Branch states that their health professionals identify the source of an agent, identify the mode and time of transmission, identify other persons who may have been exposed, and institute prompt action to prevent the spread of disease. There is no evidence that the FDOH has ever performed an epidemiological investigation of any bars, restaurants, or other venues deemed non-compliant with COVID restrictions. There is a March 12th public notice published in La Gaceta reflecting that the Florida Department of Health Pinellas has done no epidemiological investigation data which demonstrates that venues non-compliant with COVID restrictions have ever been significant COVID vectors in the county. Therefore, the Commission is mandating COVID restrictions on businesses absent any basis in credentialed and authorized data, which can only be done by the FDOH. FDOH Pinellas has not traced any significant COVID cases, hospitalizations, or deaths to businesses deemed non-compliant with COVID restrictions. When Burton and Board cite venues as the cause of COVID upturns, absent any legitimate data from the FDOH, they make non-credentialed and unauthorized epidemiological determinations that venues are COVID vectors. When Burton or the Board limit venues to under 100% capacity via COVID restrictions, you're doing so in violation of Executive Order 20-244, Section 3A from Governor Ron DeSantis. And as far as the mask goes, I'm not up here asking you to drop the masks for myself because I've already made that decision. I'm asking you to do it for the people that have no choice but to wear those masks every day in the stores when they're working to support themselves and their families.
Thank you, Beth. Jessica Carroll, Kristen Strecker, Marjorie Deskovich. Hi, welcome.
I'm a little shorter than she is. Hi, Jessica
Hi.
Carroll. I live in Seminole, city of Seminole. So just first, we know that you guys aren't originally here to vote on the mask mandate today, but I just want to let you know that you're going to hear from us every meeting until it's rescinded, because it's that important to us. So we know that you're not actually voting on it today. But one data point, which I haven't heard anybody say, is do you know what % of people are hospitalized if they get COVID? If you guess anything over 5%, you're wrong. Let me reiterate. If you get COVID, you are 95 to 99% guaranteed to not have to go to the hospital. And that data can be found in the New York Times. So if you thought it was higher, why did you think that? And with the majority of people believing it's 50% chance or more that you're going to get hospitalized if you get this virus, it's no wonder people are terrified. I have an anecdote about, I've gotten kicked out of a store for not wearing a mask just this past week. My 5-year-old daughter has now been told to wear a mask in school. And Charlie Justice, I know you said that the mandate doesn't require children to wear a mask, but the school board is requiring our children to wear masks. It is unbelievable. I have other anecdotes. The people in this room have other anecdotes. I won't bore you with that, but this mandate is giving people and businesses and teachers permission to discriminate against me and my children. They cannot choose not to wear this mask. So I'd like to echo what the short lady said, my favorite little person up here. Six of you can vote to rescind this, and I highly urge you to do so. Thank you so much.
Thank you, Jessica. Kristen Strecker, Marjorie Deskovich, and Virginia Frizzle.
Hello,
Welcome.
my name is Kristen, and I was actually born here in Pinellas County. I've never left. I love this county so much, I decided to create a life here. My husband and I are small business owners, and we have 4 children that attend school in this county. I'm 35 years old, and I have never even considered leaving this county until now. I'm not going to go through the science or the studies that show masks are not only useless, but also causing harm. There's science on both sides, so that's exactly why there shouldn't be a mandate, because we can find data, and any argument can find the data to support that. I just want to remind you guys that releasing the mandate doesn't mean you're banning masks. Everybody that still wants to wear it can. It just removes the tension and the hate and the animosity between people. I will never forget the day that Governor DeSantis specifically said that dog groomers were essential and they were supposed to stay open. Then on the same day, after you guys listened to hours and hours of groomers saying, please let us open, you still voted to keep them closed. I knew that day you didn't actually care about what the people wanted, and I knew that day it was going to be really hard to get you guys to release the power that you then had, so much power. Nobody knew any of your names or what you actually did before COVID, and now everyone is awake. Everyone is really realizing, like, it's a little bit scary that how much power you guys actually have. I think there's a reason so many people are coming to Florida, and we're actually getting a new congressional seat because of it, and they're coming here because we're free. When you look at the national news, they believe that Florida is free. They don't realize that counties have the authority to have these mandates. So people are coming here thinking you guys believe in freedom, and I think that it's very misleading. I just wanted to remind you again that this doesn't mean people can't wear masks. We're not asking you to ban masks. We're just saying personal choice for our own personal health decisions.
Thank you, Kristen. Thank you, Kristen. Marjorie Deskovich, Virginia Frizzle, and Christine Kluwer. Hi, welcome.
Hi. Thank you for having me. My name is Marjorie. This is my first time ever doing something like this. And this was a subject I felt passionate about. I wanted to come and ask you to remove the mask mandate. I don't have any clinical information. I can only speak on how it's affecting myself and my family. For myself, I get anxiety when I wear it, so I avoid going places where I have to wear it. My mother is fully vaccinated but has COPD. She can't wear it at all, so she's still stuck at home and can't go anywhere. And then I have 2 kids. I have twins who are in 6th grade, and they have to wear this all day, every day. And I have kept them home from school because they've developed sores in their nose that wouldn't go away. My one son had it for at least 6 weeks, and it was just from constantly wearing that mask and allergies and that kind of thing. So I had to keep him home from school for that. My other son has it's like a medical disorder. It's sort of like an autoimmune disease that's brought on by strep bacteria, which is everywhere. So usually every year he's on antibiotics once or twice. Because of the mask being on and his inability to get rid of any strep bacteria that he might be taking in, he's been on antibiotics at least 6 times this school year. It's having a serious effect on people, on kids, and if people want to wear them, I think that's fine. But I think for those who don't need it, especially now people are getting vaccinated, the rates are so much lower that people are getting infected. I really ask you to consider lifting that mask mandate. Thank you.
Thanks, Marjorie. Virginia Frizzle, Christine Kluwer, and Andrea Tipton.
Oh, nerve-wracking.
Welcome.
Thank you. Virginia Frizzle. First, I want to say thank you because of this commission. So many people have come together to continue to investigate all of you and your tentacles. So I applaud you for that. We're awake, and we're going to keep looking. We find that Governor DeSantis likes to write ethics executive orders, so we'll have a look a little bit more in the ethics that are going on around here. I've been a member of this community for over 30 years and a business owner. I raised 3 daughters in this community, 2 that came back with their bachelor's degree and served this community as a teacher and a supervisor within the children's rec system. And again, with a mask, you have not seen the issues that you continue to present here over and over and over again. And I don't see the issues. And then we noticed today that really it's not about the health and safety and the well-being of this community any longer, really. It's about your reimbursement is why we're going to continue this executive order to make sure you get your reimbursement. And we got a good example of that by our Levity community, David. What if you're hurting people and not helping them? What if? Just what if? You're making more harm than good. I know a very large number of doctors and scientists that say you are. In 2018, Pinellas County had the highest suicide rate in any place in the whole United States. Have you seen that? And I know what your plan is for this health, for the mental health facility. Is this part of gaining money? And you're definitely going to create a lot of mental health here in Pinellas County, and I know that plan is ready to go, Janet. It's ready. You get that one, Janet, you get it. And we're just ready. We're ready. I know Governor kept it, but you guys don't have to. You'll get your money anyway. You'll get your reimbursements. It's not about health and safety. I raised my kids here because I love this county. I thought I was going to say, and like somebody else said, I'm questioning that now, of whether this plan of this gigabyte community is for me or not. Gigabyte community plan.
Thank
I know
you.
where you're going with it.
Christine Kluwer, Andrea Tipton, and Jeff Lee.
Hi.
Hi.
I'm just a regular person. I don't have any expertise in anything, except first off, I'd like to thank everybody. I live in the best state in the country, which isn't at this point saying a whole lot. But I would like you to know that I do know that carbon dioxide happens to be a waste product of our body. What other waste product would you ingest, inhale, snort, whatever? This is the same thing as poo. It's a waste product that we're supposed to get rid of. And yet we're sucking it in through a rag that's moist with the breath. And then the fact that you go back, 70% of our population would have to be vaccinated before you take the mask off. Now it's 80% off. You know how demeaning that is? That's almost like the president saying, maybe by the grace of God, by the 4th of July, you may be able to have a small amount of people over for a weenie roast. Bullshit! I'm sorry, but that's exactly what we're inhaling, only it's our own. And so I'm looking to you officials. We voted you in. I know you could do it, but you got to stand up for what you believe in. We don't belong behind masks. And I think the fact that you say 70%, 80%, you're just doing what they do. Look here, don't look there. It's not right, and I think every single one of you have the power to lift this, and I know you will, because it's the right thing to do, not just for you, not just for me, but for all of us. God bless America.
Thank you, Christine. Andrea Tipton, Jeff Lee, Linda Skimpris.
Hi, I'm Andrea Tipton of Bel Air Bluffs. I have some pictures I want you guys to see of my son. He's only been in school for a couple of weeks, and this is what his face looks like now. Also, I'm kind of surprised because I just watched, none of you guys were really watching except for you, to the last speaker, and that's pretty disheartening for me to be up here. There's a sign in the lobby right now that says, "Still hope and light in this world." I hope there's light in this room right now, and I hope that you guys are listening and hearing us today, because this is traumatic for me to be up here. I am a working mom. I've listened to your guys' meetings for the whole year. I've wanted to come here, but I am too nervous to speak. Every week, more and more people are coming to speak out against these masks, and less are fearful of wearing them, and you guys aren't even listening, so why are we even here? It's time to remove the mask. This community is being torn apart. I have asthma. I wore the mask all the way up until December when I got COVID. My little son slept in my bed with me. Both of my sons tested negative, but he has to go to school and wear a mask for 7 hours, even though he was in bed with me while I was coughing and never got COVID. How is that acceptable that he has to sit side by side with me, not get COVID, and he has to be 6 feet apart in a mask at school? I'm going to the school board meeting right after this to talk. Again, a meeting I've never been to. I'm supposed to be at a doctor's appointment for my son who has sensory processing disorder, and he chews on that mask all day. That's what this picture is of, and you guys will see. His braces get stuck to it. I've had to replace his braces, and I know you guys don't care about the children, because that is something that is 18 and under is our decision, but I have had my son wear his mask all day at school. I've taken him to stores immediately after, and they have refused our service because he did not have this mask. When you guys see this picture of his mask, you're gonna be disgusted. You're not gonna want him to be wearing this mask. And I had a whole bunch of stuff to say. Maybe I'll email it to you, but I'm too upset right now. And I just want you to remember when you're looking and listening to all these people, what this son of mine is wearing every day and what you continue to make him put on his face.
Thank you, Andrea. Jeff Lee, Linda Skimpris, Alexis Roscoe. Jeff Lee, Linda Skimpris, Alexis Roscoe. Rosie Purdon, James Lechner, and Shelley Papamichael. Are you Jeff? Huh?
With a G, Jeff with a G?
Jeff with a, well, I think it's a J, but it's Lee, last name Lee.
No, not me.
What's your name?
Caputo, last name. Jeff with a G.
I didn't call you yet, sorry.
Sorry.
Jeff Lee, Linda Skimpris, Alexis Roscoe. Hello. And your name, ma'am?
I'm Linda Skimpris. Can you tell me if this sounds abusive? My friend's husband won't let her visit any friends or family. He has made her stop all contact with them unless it's on the phone or computer. He reads and censors her comments on social media. He makes her feel like she's going crazy for thinking he's controlling and that she is being ungrateful. After all, he's only doing this because of how much he cares about her. He doesn't want her going to the gym anymore, so he doesn't go. She doesn't go. He also doesn't let her go to work anymore. He told her to rely only on him for income and that he will take care of her. She's not really allowed to go out anymore unless it's for necessities, and when she does, he makes sure to have people have a guilt trip about it and shame her for it. He wants her to have this medical procedure done and tells her, that if she does it, he will allow her more freedoms. He constantly says he's only doing it all because he cares. He is just doing it for her own good. Oh, wait, did I say husband? I meant the government, my bad. You have been conditioned to be outraged if another person did this to their spouse, but be passive and compliant when it comes to our government. Please wake up. Power corrupts, and you have let it corrupt this commission. The people don't matter. Do you know what the most dangerous words are? I'm from the government, and I'm here to help. I will take care of all of you. We are all in this together. Wear your mask, obey, comply, don't think. Watch the mainstream media. Listen to your bought doctors. I say question authority and question Big Pharma. Bought doctors like Yuli Cho. I thought the Hippocratic Oath was about do no harm. There is no money for Big Pharma in do no harm.
Thank you, Linda.
Thank you.
Come on up. If I've called your name, come on up. Just let us know who you are so I can make it in there. Hi, welcome.
Hi. My name's Rosie Purdon, and I live in Clearwater. I was here a few weeks ago, and hello again. I feel like I'm getting to know your faces a little bit now.
Hi, Rosie. Welcome.
Hi. I've just been sitting in there, and the stories that people, I get nervous because I have to write this down, but this is not scripted, what I'm about to say. What people are saying is it's heart-wrenching. I don't know if you feel it, but I mean, it almost makes me tear up. So, I mean, if I was sitting there, I'd almost want to get up and go, guys, what are we doing? You know, these are actual people, and I hope you hear what they're saying, because the stories are, you know, it's pretty sad what's happening. Okay, so anyway, up until last year, I didn't even know that citizens like myself could even stand up and speak about issues that we feel passionately about. In fact, I didn't even think we would need to do that. But now I feel a need, just like so many others, hundreds of others. And I honestly would, you know what, I'd honestly prefer to be back in my office where I'm comfortable and working, but I'm not working because I'm here. And I'm not there making money because I want to be here. I'm doing this because I'm so compelled, because I'm so concerned about this continued mask ordinance. So I'm making myself uncomfortable by coming out here. I know that you're looking at either amending or rescinding the ordinance, which I appreciate. And with that, I wanted to say that I'm absolutely in favor of rescinding it. The choice as to whether we wear a mask or not should be up to each of us. It should be a choice. Just like we each have a choice as to whether we go see the doctor or not. We're not forced to see a doctor. We make that choice. We also have a choice as to whether we take vitamins or not. You know, whether we get vitamin D or not. It's our choice whether we're healthy or not. It's ours. So please keep this idea of freedom of choice in mind. And thank you for listening to all of us today.
Thanks, Rosie.
Yep.
Okay, is there anybody? Okay, come on up. Yeah, I don't have your name here, so, well, I probably read your name, but I don't know who you are. Thank you.
I'm Shelley Papamichael. I'm from Clearwater. I've also lived in the area for 46 years, been born in Dunedin. I think it's just time to rescind the mask mandate as well. I think it's unconstitutional. I don't think that it's your place to tell me and my family what our health preferences should be. I think that I should decide whether I put a mask on or not. I have no problem with anybody else putting on a mask. I concur with many of them out there that that should be a choice, everybody's personal preference on that. I don't like being told that I have to put a mask on and I have to have confrontation in store after store, and I have to determine which stores I can go to and which stores my children can walk in. And I have children in the public school system, same thing, they're struggling. I have a 9-year-old who's in 3rd grade at Lila Davis, and he already has ADHD struggles articulating himself, and he gets very frustrated with getting his point across. And the masks, from trying to understand the teachers to trying to express himself, he's just exasperated every day. And the minute he gets in the vehicle with me, I'm like, pull that thing off. I don't like these. I think they're face diapers. I think they're ridiculous, but that's my opinion. But I think that's my right to choose whether we wear one. And like I said, I respect everybody else and whatever their choice is. And I'm asking you guys to rescind this mask mandate.
Thanks, Shelley.
Thank you.
Okay, anybody there? Okay, then I'm going to go ahead and start. David Edwards, Don Lechner, Sharon Patinod. Patinod? David Edwards, Don Lechner, and Sharon Patinod. I'm going to assume Jeff Lee's not here, Alexis Roscoe's not here, and James Lechner is not here.
He's here.
He is, okay. Well, I've called him several times. Jeff?
It's
James?
hard to hear out there.
Okay. Hello, welcome.
Hi, thank you.
Please tell us who you are. So
I'm Dawn Lechner.
Thanks, Don.
Sure. Good afternoon. I want to read and remind you today of the oath of office you all taken and exactly what you swore to with the binding words of "So help me God." May I also say that these words are not mandatory for you to include as you take your oath, but yet you all did. May I also say that the very Bible you put your hands on to give this oath says this about taking oaths. If a man vows a vow to the Lord or swears an oath to bind himself by a pledge, he shall not break his word. He shall do according to all that proceeds out of his mouth. Numbers 32. You shall not swear by my name falsely and so profane the name of your God. I am the Lord. Leviticus 19:12. So we can see how God views your use of his name in your oaths. Now let's see what you swore an oath to, so help you God, that you agreed to do. You agreed to uphold the Constitution of the United States, which reads in the preamble, "We the people, in order to form a more perfect union, establish justice, ensure domestic tranquility, provide for the common defense, promote the general welfare, and secure the blessings of liberty to ourselves and our posterity, do ordain and establish this Constitution for the United States of America." You also agreed to uphold the Constitution of the state of Florida, which in its preamble reads, "We the people of the state of Florida, being grateful to Almighty God for our constitutional liberty, in order to secure its benefits, perfect our government, ensure domestic tranquility, maintain public order, and guarantee equal civil rights to all, do ordain and establish this Constitution." And in addition, in Article 1, Sections 1 and 2 read this. Section 1 reads, "Political power. All political power is inherent in the people. The enunciation herein of certain rights shall not be construed to deny or impair others retained by the people." Basic rights. All natural persons, female and male alike, are equal before the law and have inalienable rights, among which are the right to enjoy and defend life and liberty, to pursue happiness, to be rewarded for industry, and to acquire, possess, and protect property. No person shall be deprived of any right because of race, religion, nationality, or physical disability. I would like for you to just uphold your oaths that you took and swore, so help you God.
Thank you, Don. Come on up. Dave Edwards, Sharon Patinod, Karen Brandis, and Tina Shank. Go ahead.
My name is David Edwards. I have a background in science and technology that spans half a century. Today, I would like to try and share some common sense and logic that is sorely lacking. I've lost 17 social media accounts trying to share the truth, so here I am in person. Let's see, if masks work, why the 6 feet? If 6 feet works, why the masks? If both work, why the lockdowns? Furthermore, if your vaccine works, why do I need to wear a mask? If your shot doesn't work, why do I need to get one? If masks work, why do businesses have to be closed? And if they don't work, why are we being forced to wear them? Are you aware that the WHO guidance on masks states that masks should only be worn by healthcare workers, caretakers, or by people who are sick? Why in the heck would you make the rest of us who are not sick wear them? That's just ignorant. From the CDC, 70.6% of those testing positive wore a mask always. 3.9% of those testing positive wore masks never. And by the way, your chance of survival without hydroxychloroquine is 99.9%, near 100% with HCQ. Do your research, you'll find that hospitals are seeing more staph infections and pneumonia than COVID, thanks to masks. Go on social media, you'll see all the proof. Mandating masks is nothing short of abuse, in my opinion. If someone wants to wear a mask, it's fine. America's a free nation, and my family has spilled a lot of blood to make and keep her free. Are you aware that it has now been found that disposable masks made offshore are shedding graphene nanoparticles? Children are coughing and hacking like a cat choking on a hairball. Speaking of which, have you seen the videos from third world countries showing poor people working in sweatshops sewing masks that are all lying all over the nasty floor while they are forced to work ungodly hours producing them? It's disgusting. The unmasked buried the masked in the Spanish flu pandemic because of bacterial pneumonia from wearing masks. Dr. Fauci co-authored a paper on this in 2008, saying most deaths were from bacterial pneumonia due to the mask.
Thank you, David. Thank you, David. I've got James Lechner, Sharon Patnade, Karen Brandis, Tina Schenk, and Barbara Benton, and Nicole Poulin. Hi, welcome.
Hi, thank you. My name is Karen Broadus, and I'm from Clearwater, Florida, and I am here to ask you to please, please, please remove the mask mandate. Masks are making people sick. I have 3 kids, and they have never, ever had issues with sinus infections or anything like that. And since they've been forced to wear masks for work, they have all had sinus infections. Not COVID, sinus infections from the mask. And they've never had that in their lives before. I feel like they're making people more sick, and they are germ spreaders. If you go into a restaurant, let's say, and you are looking at the waiter, they're constantly touching their masks, and the germs are going right through onto their hands, and then they're touching your glass. Then you touch your glass, and then you eat your piece of bread. Now all their germs have gone into your body, and everybody else's germs of the cups that they've touched from everybody else. So that's another reason I think they are germ spreaders. Plus you're touching door handles and things like that. Another thing that's really, I think, so important that I don't know if anyone's touched on or not yet, human trafficking is a huge, huge problem, and the numbers are going up, and I really believe that it is because people are being hidden because they're underneath masks and faces are not able to be seen. Elizabeth Smart was out there for the whole time. She was taken in and out of captivity. They'd go out in public, and nobody saw her because she had a mask that was up to here. They covered her face. So please, for the sake of human trafficking, please end this mask mandate. And if people want to wear masks, if they're scared and nervous, they can wear masks. But please, please end this. And it's also, I really believe, creating division between people. And we need to come together unified. This country is one nation under God, and we need to be unified, not divided. Thank you. Have a great day.
Thanks, Karen. Okay, James Lechner, Sharon Patnode, Barbara Benton, Nicole Poulin. Hello.
Hello, my name is Tina Schenk, and I'm here to ask you to end the mask mandate as well. I think it should be voluntary and optional if people want to wear a mask. I'm not a doctor, I'm not a politician, attorney, or medical person, but I am an average person, and I can see the harm that the masks are doing to people. I see people sick. I myself have asthma, and when I have to wear a mask, I cannot breathe. I make it 60 seconds, and then I get disoriented. I'm allergic to some of the masks, the blue masks I'm allergic to. I've had burns on my face from being forced to wear them. So I really feel like it's a violation of my rights as a human to be told that I have to wear a mask. I do think it should be optional. I do think that some people are concerned and think if you're concerned you should wear one, but if you're not, you shouldn't. I also feel that it's creating a ton of division within the community, and I see people fighting all the time. It breaks my heart. I just want people to be able to do what they think is best for their bodies, what they think is best for their health. And people are taking this mask mandate to the extreme. Like there's a dentist that called and verified an appointment for my friend, and they said you have to wear a mask, you have to stay in the parking lot, and no open-toed shoes, closed-toed shoes. So it's like people are taking these mask mandates and turning them into more than what they are, and it's really infringing, I think, on civil rights and my rights as a human. So I'm here to ask you to end the mask mandate and make it voluntary.
Thanks, Tina. James Lechner, Sharon Patnode, Barbara Benton, Nicole Poulin. Hi there.
Hi,
Welcome.
my name is James Lechner. I'm going to read from God's Word, and it says in the very beginning, Genesis 1:1, in the heavens, in the beginning of the world, God created the heavens and the earth. He says in Psalm 67, may God be gracious to us and bless us. May he make his face shine upon us, so that your way may be known on earth, your salvation among all nations. Let the peoples praise you, God. Let all the peoples praise you. Let the nations rejoice and shout for joy. For you judge the peoples with fairness and lead the nations on earth. Let the peoples praise you, God. Let all the peoples praise you. The earth has produced its harvest. God, our God, blesses us. God will bless us, and all the ends of the earth will fear him. In Ecclesiastes 12, it says at the very beginning, in addition to the teaching and the teacher being a wise man, he constantly taught the people knowledge. He weighed, explored, arranged many proverbs. The teacher sought to find delightful sayings and write words of truth accurately. The sayings of the wise are like cattle prods, and those from masters of collections are like firmly embedded nails. The sayings are given by one shepherd. But beyond these, my son, be warned. There is no end to the making of many books, and much study wearies the body. When all has been heard, the conclusion of matters is this: fear God and keep his commands, because this is for all humanity. For God will bring every act of judgment, including every hidden thing, whether good or evil. I don't know if you all know this or not, but someday we will meet our Maker, our Creator, and we will stand accountable for every decision that we make. Let that be a warning. Thank you.
Thank you, James. Sharon Patnode, Barbara Benton, Nicole Poulin, Richard Snyder, and Jessica Beck. Hi, welcome.
Hi, my name is Barbara Benton. Can you hear me?
Yes.
Excellent. Thank you very much for being here and sitting through all of this. I really appreciate it. I'm here because I very much want you to stop, drop, finish, knock off the mask mandate. I don't care what you do with any money. I don't care about the emergency order. I care about the masks. The reason I care about the masks is I care about people. I'm a mother. I'm a grandmother. I care about my children. I care about all children. According to a study by the National Center for Biotechnology Information, which is part of the NIH, the National Institute of Health, masks do not prevent the spread of the virus, and they are harmful and bring about substantial adverse physiological and psychological effects. Now, as I read this list, I'd like you to ask yourself, do you want to experience these things? Do you want the children and the grandchildren in Florida to experience these things? Here is what the National Institute of Health says masks cause: shortness of breath, increased acidity and toxicity, immunosuppression, fatigue, headaches, predisposition for viral and infectious diseases, anxiety, depression, long-term progression of chronic illnesses, and premature death. Now, is that something you want for yourselves? I doubt it. Is that something you want for the children in Florida? I doubt it. So please rescind the masks now.
Thanks, Barbara.
You're welcome.
Sharon Patnode, Nicole Poulin, Richard Snyder, Jessica Beck. Hi.
Hi, good afternoon. My name's Nicole Poulin.
Hi, Nicole.
Hi. I've been a Pinellas County resident for over 13 years now. I'm here to ask you to rescind the mask mandate, along with everyone else that you've been listening to for the past few hours. I also was at the last commissioners meeting. I didn't speak, but I was here and I listened to everyone talk. Almost 50 people asking for the same thing. They all had great stories, just like today. I'm not here to give you more statistics or any specific healthcare story. I'm just an average citizen with kids living in the county. I just want to hopefully get you to see that while there are about 75 people out there and there were 50 or so last time, there are hundreds more that couldn't be here. I personally have over 100 friends or acquaintances that I spoke to over the last couple weeks to come, and they weren't able to make it because they were busy with work. I was lucky enough to be able to take time out of my schedule to be here, but I just want you to know that for every one person that is here, there are hundreds that also would like to be here but can't because they're working or they're with their children or whatever. I'm sure you are aware of that. Basically, as you know, the United States of America was founded on freedom. Enforcing a mask mandate in a time where there's a curable virus amongst us that has an over 98% survival rate is not freedom. While your intentions were probably honorable when creating this mask mandate, it's been over a year now, and it's clear that the mandate is not necessary for our survival. Just like everything else in the United States, I think that wearing a mask should be a personal choice. If you feel you need to wear a mask, please do so. If you want to wear gloves to protect yourself, I'm all for it. If you think you need goggles, whatever you need to feel safe, you should do. But wearing a mask for us does not make us feel safe. It is restrictive. And as we all recited at the beginning of this meeting, and my son recites every week in the Cub Scouts, I just ask for liberty. We're Americans, please.
Thank you, Nicole. Sharon Patnode, Richard Snyder, Jessica Beck, Jill Gibbs, Angela Schrader. Hi, welcome.
Hi, I'm Jessica. Thanks for letting me speak today. I'm a mom of 2 wonderful boys. As it stands today, me, along with all the other parents in our community, have had our freedom and right to choose taken from us by the mask mandates. Human rights are believed to belong justifiable to every person. We have human rights. Our rights are stripped away as there is not a choice. My children are at school over 8 hours a day. I'm a working mom. One of my sons has gotten an adverse reaction to the mask. He's not able to breathe properly. He has an uncontrollable tic of constantly clearing his throat due to lack of oxygen. My father got COVID. He's 80 years old. He's recovered from it. He lives in Northern California. Their mask mandates are very strict. You have no option. You must wear one inside, outside. I'm sure you guys are all aware of that. The reason that I mention this is that he's worn this mask the entire time and got COVID. So there's zero evidence that masks work. More studies show that there's more potential harm of people wearing them for long periods of time. This virus has less than 1% mortality rate, and the children have practically 0% chance of catching COVID. We, the people of Pinellas County, voted on you to help us. We pride ourselves in being able to have a choice and not have the government overreach. I urge you to remove the mask mandate. Thank you so much.
Thanks, Jessica. Sharon Patnode, Richard Snyder, Jill Gibbs, Angela Schrader. Hi. Welcome.
Hi, I'm Angela Schrader, and I'm here because I have significant concerns with extending the mask mandate. I urge you to comply with Governor DeSantis, who said that ultimately individuals should be able to make their own decisions on mask wearing. I urge you to join the other 2/3 of Florida counties who don't have mask mandates. Masks have been shown to be ineffective and in many ways harm. Standard cloth and surgical masks offer next to no protection against virus-sized particles or small aerosols. The size of a virus particle is much too small to be stopped by a surgical mask, cloth, or bandana. A single variant of SARS-CoV-2 is about 60 to 140 nanometers. The pore size in a surgical mask is 200 to 1,000 times that size. Consider that the CDC website states surgical masks do not catch any harmful particles in smoke, and that the size of smoke particles in a wildfire are not catch at all harmful particles in smoke. The size of smoke particles in a wildfire are 0.5 microns, which is 5 times the size of the SARS-CoV-2 virus. Wearing a mask to prevent catching SARS-CoV-2 or similarly sized influenza is like throwing sand at a chain link fence. It doesn't work. There has been one large randomized controlled trial that specifically examined whether masks protect their wearers from coronavirus. This study found mask wearing did not reduce at conventional levels of statistical significance the incidence of SARS-CoV-2 infection. There have been hundreds of mask studies. The evidence shows that cloth face masks actually increase influenza-linked illness. Bacteria are also 50% larger than virus particles. As such, virus particles that was fast.
I know. Thank you. I'm sorry we cut you short today by a minute. Thanks, Angela. Sharon Patnode, Richard Snyder, Jill Gibbs, Pastor Johnson, and then Roxanne Tasker. Hi.
I think the other two.
Yeah. Oh, you've got a microphone.
Yeah.
Thank you.
Yes, I have one. Thank you. Hi. If I'm honest, I still struggle at times with how involved I want to get in governmental matters. I serve a God who is sovereign and in control of all things. I've never paid attention to politics because he has the final word in my life. But one verse I seek to live daily is this: He has shown you, O man, what is good. And what does the Lord require of you but to do justly, to love mercy, and to walk humbly with your God? When our leaders mandate health protocols on its citizens, when they were never elected to do so, that is not just. And as a citizen of this great country and great county, my voice before you today is what I do have to do justly. We are no longer in a state of emergency, period. 14 months ago, we were in a state of emergency. We didn't know what COVID was capable of. We didn't know who it targeted. We didn't know if there were any treatments for it. But after 14 months and thousands of studies, we now know what it is capable of, and that it targets mostly those with comorbidities and low vitamin D. We also know that there are treatments that are almost 100% effective. Given the science we know today, for any of you who insist that we keep mandating masks on our citizens, it must be for an agenda that is other than the well-being of our community. For Dr. Cho or any of you on this board who insist on propagating fear to our Pinellas County citizens by extending this state of emergency, that is not just. Dr. Cho, with all the medical knowledge you have, you should know better than to continue to misinform this board with statements of fear instead of hope with the wonderful treatments and survival rates of this virus. The just thing to do is to recognize the freedom that we, the people, have and the wonderful country we've built to date, and assure the people of Pinellas County that you trust them to make decisions for the good of our county. Thank you.
Jill, thank you. Appreciate you being here. Sharon Patnod, Richard Snyder, Pastor Johnson, Roxanne Tasker. Hi, welcome.
Welcome. My name is Richard Snyder. I'm a citizen of unincorporated Pinellas County in the Seminole area, right over by the high school. I think this is a great opportunity. I'm here today with over 70 people exercising their God-given right to come and tell you guys how we feel. The topic I want to talk today about is the mask mandate. You, the commission, are elected officials and thereby required to represent we, the people. Kind of an old saying, but the value should not be lost. As elected officials, you're required to act in a way and manner both becoming of your office as well as in a manner which also represents all the people that you are in your areas. Not just those that voted for you, but those that didn't. You should lift the mask mandate and stop trying to restrict us from our rights. We have the right to life, liberty, and pursuit of happiness. If you want to use science as your basis for this decision, great. By all means, use science as your base. Science is proving, and will continue to prove that it's not working. This is not February, March, or April of last year. The time of fear and lack of information is behind us. It is time to be proactive and stop preventing us from our rights to recover from this insanity. The research shows that masks are not an effective option, not positive for our psyche, not healthy, and they're definitely not profitable. You, the commission, are responsible to protect our rights, not prevent or interfere. It is time for you to remove this obstruction and return us to our rightful place of full rights. Remove the mask mandate and stop suppressing us, our kids, and our rights.
Thanks, Richard. Sharon Patnod, Pastor Johnson, Roxanne Tasker, Tracy Kepler, and Nico Papa Heracles. Hello, Pastor.
Good evening. What a joy it is again to be a citizen that can be heard. I know when I was a young guy, I so longed for truth I mean, it was unreal, but it's like, where's the truth? You get a chance to talk. You want to say something about truth. Now, I was reading a verse of scripture here, and really, I've learned the Bible to be true. I've learned that. And I like to give a verse of scripture from the Word because that's true. I mean, I can say something myself, and I can add something to the truth. I can take something away. But the truth is the truth in itself. So I stood today to say something about the pandemic and like about the masks and should we wear them? Well, you know, again, when it comes down to wearing a mask, the person ought to know he need to wear a mask. And if you need to wear a mask, you got no business walking around spreading germs. And if you're the kind of person that sprays when you talk, you ought to have a mask on, or at least respect the person enough to stay back enough to where you're not spraying that person. I mean, we're in a very beautiful country, and this county is the top of the line. The only thing we're missing is that real relationship with God that only comes through Jesus Christ. Now, Satan has brought all this other stuff into our world, but listen, the gospel message is true. Jesus died for your sins on the cross. He rose again that you might be justified. He came to earth to show each one of us that we are sinners, and the only way to God is through him. Now, that's the gospel message, and that's what all of us are called to share as children of God. Let's respect each other. You need a mask on, put it on. You spray when you talk.
Thank you.
Cover your mouth.
Thank you, Pastor. Sharon Patnode, Roxanne Tasker, Tracy Kepler, and Nico Papahericlis. Nope. If you're here and I called you, just come on up and just say who you are so I can make sure I keep track.
Tracy Kepler.
Thank you, Tracy. Welcome.
I'm here today to make my voice heard. I feel you have grossly overstepped your authority in subjecting myself and other residents to your mask mandate. I am an autism mom. Because of that, the past 10 years of my life have been absolutely dominated by every health choice that I make for my family and myself. That has meant countless nights spent on the computer researching instead of sleeping, cooking from scratch, a gluten-free, dairy-free, soy-free, artificial everything-free diet for my oldest son, the first 3 years of which I allowed absolutely no food from outside of our house for risk of cross-contamination, which also meant no traveling, vacations, etc. for 3 years while we healed my son's gut. I also spend 2 to 3 times more than the average family on our specialty and organic groceries, not to mention the 2 drawers full of daily supplements and the functional medicine doctor who we pay out of pocket for. I make very specific choices about which cleaning and toiletry products we use in our home and which we don't. Again, our choices are usually not the inexpensive ones. I could go on, but suffice it to say that our health and wellness is a top priority, and one that has literally cost me blood, sweat, tears, and tens of thousands of dollars over the last 10 years. Now you think you can come in and tell me that I have to wear a medical device with documented health consequences over my mouth and nose? Even my personal doctor can't tell me what to do with my own body. They can make recommendations on how to handle my health, but I choose what I do. What makes this board feel so empowered that you think you should have more authority over me than my own doctor? And by the way, the doctor I see does not think healthy people should wear masks. I do not and will not wear a mask, but what your tyrannical mandate has done is to divide and add tension to our community. Those who believe the propaganda about masks feel emboldened by your mandate and take it upon themselves to confront and assault those of us who do not comply. In today's crazy world, it's only a matter of time before someone kills someone else over not wearing a mask. If and when that happens, you will be partially to blame for creating this divide. Your mandate has also made businesses feel the need to force their employees to wear masks for entire shifts, something that's not been studied for safety or long-term choices. Remove the mask mandate.
Thank you, Tracy.
Thank you.
Sharon Patnode, Roxanne Tasker, Nico. Are you Nico?
I am.
I'll let you say your last name because
Papa Heracles.
Thanks, Nico.
Yeah. Thank you very much for giving me the opportunity and us to speak. Like other people have said, it's not easy to come here because we're born in a country and we're taught in schools that we live in a free country and we have a freedom of choice, the freedom of voice, freedom of thought. I've been teaching human rights for the last 15 years. And I never thought I would be in my own country talking about the infringement of rights. And I'm glad that you guys are giving me the opportunity and all of us, because Facebook doesn't think it's right for us to talk about the things we believe in. Twitter bans people for thinking about it. It almost seems like you need to be part of a cult and talking about a certain narrative to be spoken and heard. So I really thank you for the opportunity. I'm originally from Washington, D.C., and up there they're very keen on people wearing masks inside and out. My wife and I and my stepson were walking the streets from here. I thought I lived in a free country, then it came down to living in a free state. And so I said, oh, okay, this was in the beginning, 9 months ago. We were walking D.C. outside, and I thought I was very much in my right and to walk freely without a mask, even though others were wearing masks. But I saw a lovely couple. It was Christmas time. It was like, oh, wow, what a lovely couple. They're walking across the street with a Christmas tree, and an older couple and so forth. Oh, such a nice couple. They turned to me when we were probably 8 feet away, and he yelled at me to wear a mask. And I said, no, I'm outside. And he said, leave my country. I said, why? Why should I leave this country? I'm peacefully walking the streets with my family without a mask, breathing fresh air, because I think it's healthy. Well, he has a different thought, obviously, and I found out why. Because on TV and on the radio, they talk about do your part, wear a mask, do your part, get a vaccine. So those that aren't doing that are apparently doing the opposite. That's false narrative, and that's why there's such a divide. Please rescind the mask mandate. Thank you.
Thanks, Nico. Sharon Patino, Roxanne Tasker, Liliana Mastanoka, Kona, you're going to did that one too. Bonnie Martino. Desiree Lotz. Sharon Patino, Roxanne Tasker, Liliana Maskinkova, Bonnie DiMartino, Desiree Lotz. Hi. Welcome.
Hi. My name is Liliana, and I lived in Clearwater for 7 years now, and I love it here. And me and my husband, we go to DC from time to time, and I understand that Clearwater and Florida is the best place on earth right now, and I'm very happy and I'm very thankful. And when we go there, people are so depressed there, and here it's a really sunny state, and I would love you to be a first person, people who would just leave this mandate. And just imagine how many people already figured out that mask is not a solution. And just imagine how many people will be so proud of you if you would do it. That's all what I wanted to say. Thank you very much.
Thank you, Liliana. Appreciate it. Sharon Patino, Roxanne Tasker, Bonnie DiMartino, Desiree Lotz. Hi. Welcome.
My name is Bonnie DiMartino. I live in Clearwater, Florida.
Thanks, Bonnie.
I'm going to ask you guys, has everybody here done their ethics stuff this year?
We do it every year.
Great. So then you know what your job is, and you know that as a county commissioner, your job, each and every one of you, is to help and protect Pinellas County citizens. As we see it, you are not doing your job. How is this mandate helping or protecting us? Wearing masks have been proven harmful, not helpful. Breathing in toxins doesn't help anyone. Deprivation of oxygen isn't helping anyone. It actually harms brain cells and heart function, as well as lungs and other body parts. Reducing the body's immune system to fight off infection, including a flu, isn't helpful. Social distancing creates depression, causes overdosing, invites suicidal thoughts. Not helpful. So I ask you again, how are you helping us with this mandate? You are not helping. You have betrayed all of us in the name of help. Unlike every representative of our county here today, I'm not going to ask you to make mask wearing a choice. because I'm concerned for all of the people out there wearing masks, either because they are being forced to or because they're brainwashed, and they may even be brain damaged from lack of oxygen to their brain cells. And I think you should be banning masks so that people can rehabilitate. If you did that, you would actually be doing something helpful, and there would be dancing in the streets. So consider that. I'm not asking you to rescind the mask mandate. I'm asking you to ban masks.
Thank you, Bonnie. Sharon Patino, Roxanne Tasker, Desiree Lotz, Anna Smith, and Julie Halifax. Hello.
Hi, my name is Desiree Lotz. I'm a true African American. I've been helping people with their bodies for more than 40 years. I'm not a doctor, but I'm very help people with basic stuff, nutrition, help build their bodies and their immunity. And one of the key things I tell people when I'm helping them, they got to be sure they're getting enough oxygen, and they've got to not get carbon dioxide. It's a reverse thing. So I am, when I see people and I help them, if they have a doctor who is not complying with the Hippocratic Oath, because doctors and medical people swear for the Hippocratic Oath. And what I've seen here, there are a lot of good doctors, and they do, and they comply, and they look after people's basic body needs. But I also see a lot of hypocrites violating the Hippocratic Oath, and it's got to stop. It's not okay, and it's not acceptable, and we're going to have to start investigating why people are complying with the wrong side of things. And it's time to stop all this mask wearing and stuff. So that's my story, and I'm sticking to it, and I will continue to tell people to dump their doctors if they are on the wrong side of the Hippocratic Oath. Okay, thank you.
Thank you, Desiree. Sharon Patino, Roxanne Tasker, Anna Smith, Julie Halifax, David Ballard Geddes Jr.
Good afternoon. My name is Anna Smith, and I am not here to tell you how stupid the mask mandate is. Instead, I am here to tell you something that very few people know about me. And if this session has been recorded and shared at a later time, I know that the entire world will get to know a very dark secret about my past. I'm not looking for anyone to feel sorry for me or any pity, or to even understand where I'm coming from, because you were not there and you did not feel what I felt. When I was a kid, I grew up in a mid-class household in Colombia, South America. My father was an alcoholic with very unpleasant addictions besides alcohol. He raped me, not just once, but several times. Not just me, but several people around him and our family. Also, when I was a kid, I was a mischievous kid. We were playing a dare game one day, and I lost the game. They put me in a traveling suitcase, zipped it all closed, and put it under a bed so I wouldn't be able to get out. I yelled and screamed for what I thought it was an eternity until the maid found me and took me out of it. When this whole thing started over a year ago, I tried several kinds of masks and face shields. It triggered something in my brain that I cannot explain, nor was I able to control it. It immediately gave me a panic attack and anxiety. I thought I was going to pass out. I cannot wear a mask or a face shield. I tried several times, and every single time it did not work. I am now in a situation where I live in a free country, but I am not free. For something that I cannot control. Because of you, the government, and the media, you have empowered the public to gain the right to shame others like me for not wearing a face panty. That doesn't do anything for you anyways. Today, I have been shamed in public, humiliated by others, denied access to establishments, and even thrown out of those establishments for not wearing a mask. To wear a mask or not to wear a mask should be a matter of a choice. Like you eat healthy or you choose to eat garbage food.
Anna, thank you.
One more thing.
Yes.
I hope and wish that you all get shamed in public for something that you cannot control.
Thank you for sharing your story, Anna. Sharon Patino, Roxanne Tasker, Julie Halifax, David Ballard Geddes Jr., Karen Harvey, and Greg Pound.
Hello, we're Julie and Gavin Halifax, residents of Clearwater. We've been living here for 21 years, and we absolutely love it, aside from what's going on right now. My 9-year-old child, Gavin Halifax, is hard of hearing with moderate to severe hearing loss, roughly 55 to 60% for those of you who are not familiar. Reading lips accounts for approximately 50% of communication along with his hearing aids. I wear an FM system so he can hear me better. Everyone cannot wear one. Reading lips is something that he's not been able to do at school, and in public it's affected him negatively by having severe difficulty hearing teachers and classmates. Even with face shields, voices are muffled. He relies heavily on reading lips and facial expressions to understand people. Social and peripheral learning is compromised when they're wearing masks. He can't see what's going on. He can't hear what's going on the side. Being in a classroom environment is supposed to be a positive thing for children like him and for all children. I cannot tell you how many times I hear children and adults say, "Never mind," or "It wasn't important," when he asks, "What?" or "What did you say?" Please consider how invalidating this is to a person, especially a child. My son wanted me to share that he feels left out. Where is the kindness and humanity in people? Since people have been wearing masks, it's like a badge to just forget about other people's feelings. My son constantly has to turn to me and ask me what other people are saying, or just nods and pretends that he understands what was said. I'm not 100% against masks. I say that we should have a choice. The majority of people are over it, and it's been said many times it's not effective. By the way, where are the people standing here today taking the time out of their schedule to say that they're for wearing masks? After all this is over, I would like you to consider that I will wear a mask when I feel it's necessary.
Thank you. Thank you both.
Thank you.
Okay, Sharon Patnaud, Roxanne Tasker, David Ballard Geddes Jr., Karen Harvey, and Greg Pound.
Hi, thank you, sir. David Ballard Geddes Jr. I live on Georgia Avenue in Palm Harbor. I have a little different perspective on what's going on with the COVID. Oddly, I find that the COVODE resolution of 1868 and the COVID of today both involve a firing of subservient political powers followed by a failed impeachment attempt of the president. Both President Johnson and President Trump were acquitted by the Senate. The faction of disease, as referenced in the Federalist Papers, is the use of constitutions as mediums used to establish despots and tyrants, as written in the Declaration of Independence, in particular using the medium of our existing Constitution to establish despotic water jurisdictions being used to vanquish Christianity as process due, claimed in the 14th Amendment, is a disease. The use of this Constitution as a medium, this factious spirit, this disease of such, is soon to be transmitted through our sprinkler systems. The Reclaim Water variance clearly states that the applicant literally owes their health, safety, and religious convictions in giving rise to formulating factious, despotic water jurisdictions based on the symptoms of Executive Order 12803 and Executive Order 13406. The chemical and biological warfare is going to come from our sprinkler systems, giving us Ebola, cholera, and Legionnaire's disease. The liberties of such factious political powers is a disease, and I do believe that these wartime powers have been fired. Thank you.
Thank you, David. Sharon Patnaud, Roxanne Tasker, Karen Harvey, Greg Pound, Cheryl Lockhart, and Mary Shaw. Come on up. Just let us know who you are.
Hi.
Hi. Welcome.
Good afternoon. My name's Karen Harvey. Thank you, commissioners, parents, community, for allowing me to speak here today. Have y'all been listening to the heartbreaking stories of suffering by these people, our neighbors, families in our community, suffering? How can you let this continue? Why are healthy people and kids required to wear masks? We're not spreaders. Stop requiring masks for healthy residents, families, and kids. Give us back our freedom and parental rights to make our own health care decisions. Unmask our children. Let me ask you a question. Aren't we all bombarded by bacteria and viruses every day? What is the first thing you do when you walk in a bathroom stall? Seems like it's the only place you have any freedom anymore in this country. The first thing I do is pull down my mask and take a big, deep gulp of air. And I bet the rest of you are on the same page with me on that. So, aren't we worried about the person that was in there right before us, that they had the Rona? No, we want to breathe. We have a right to breathe. Every surface in that bathroom is contaminated with germs, bacteria, and viruses. Do you think wearing a mask and washing your hands is going to give you enough protection? Maybe. But our immune systems that our Heavenly Father in His intimate, ultimate wisdom created in our bodies to fight off these menaces is what ultimately protects us. Please, in the mask mandate, and in the suffering of the people in our communities, please.
Thanks, Karen. Sharon Patino, Roxanne Tasker, Greg Pound, Cheryl Lockhart, and Mary Shaw.
Greg Pound, Largo, Florida. And we just want you to see our banner in the state of Florida. This is it. And so there's a verse in Isaiah 9:16 which says, "For it is the leaders of this people that cause them to err, and they that are led of them are destroyed." It's amazing how Benjamin Franklin, the guy in the $100 bill, said rebellion to tyrants is obedience to God. The reason I ran for sheriff, and I ran against 3 attorneys from the sheriff's department, after I ran against Jim Coates, and won the sheriff's race, won it to what is called a shoe-in candidate, because you had illegal candidates, and you still do. We have an illegal sheriff. We have Jim Coates' lawyer, Robert Guattari, for 9 years, now our sheriff. And that's why we got this stuff going on in our county, because the sheriff is supposed to represent the Constitution. He's a constitutional officer and representing that office. And that's why we've got this out-of-control corruption. He's in your back pocket. You give him the money he needs to do what he wants, and that's why he can buy $1 million mansion, and we've got all this corruption out of control, along with the court system. He's working that's a conflict of interest to have an attorney. We have a separation of powers, which this county has not upheld, and this is why we've got the problems we have. And you've got this place packed out here. I had to park way down the street to get here. Then their school board's going to be packed. People are getting tired of you people not representing us. You've sold us out for money. The Bible says, buy the truth and sell it not. The truth is more important than money. And the people, at least the people are waking up. The government, we are the government in America. That's what makes us different. You're supposed to represent us, be working for us, not we working for you. And so until you guys get it, I mean, it's like, you know, I've been in this battle for over 20 years now, dealing with the corruption in the court system. Especially started with juvenile justice court, to seeing what you've done to the young people.
Thank you. Sharon Patinow, I'm not heard her come forward. Oh, she's coming? Okay, sorry. Okay. Roxanne Tasker, Cheryl Lockhart, Mary Shaw, Jackie Thorpe, Greg Pound, that was already. Kathy Swigert. Go ahead, I'm sorry, ma'am. Welcome.
Cheryl Lockhart. I live in Seminole, and I just wanted to say that we do live in America, and in case you've forgotten. When is this nonsense going to end? In the big picture, this is being done on purpose, and y'all know it. Smells like communism to me. Mass brainwashed idiots is what's happening in our country and all over the world. We all know it doesn't work. Why are we still pretending like it does? Oh, and that doctor, where's he at? How come there isn't another one that has a different opinion? Why are we only hearing his version? His version is incorrect. Oh, that's right. I think he was bought. I think they said he was bought. Let me ask you something. Can we make everyone cover their mouth when they sneeze? No, we can't make everyone do that. So why are we making people wear masks? You like wearing them? You mask your grandchildren, your children? You like doing this? When is it going to end? When is it going to end? This is going to keep going if we keep letting it. And then what's going to happen after that? We're going to march like little soldiers like China? Oops, did I say that out loud? Herd immunity? Are you kidding me? What about our immune systems? I thought we were taught to do that and take care of our own responsibilities for ourselves. That's what we're supposed to be doing. When does it end? You may be in favor of masking up, but are you aware that masks don't even work? So many people spoke before me and they stole my Stanford study, but that's okay because it still exists and it's the truth. When does it end? Do you wear a mask while you run, while you go to the gym? You still like wearing them? Well, this isn't just about us, it's about you too. When does it end? Look around and see what's happening to our country. Does that make you proud? If you need to choose a side, choose America, the land of the free, and let's keep it that way. Be a part of the solution, not the damn problem.
Thank you, Cheryl. Cheryl and Pat Note, I'm going to take you off because I have not heard from you. Roxanne Tasker, same thing. Mary Shaw, Jackie Thorpe, Kathy Swigert, Jeff Storost. Hi.
Hi. My name is Mary Shaw. I am a resident of Pinellas in Bel Air, Florida. I have just one very short, sweet, and simplistic remark, yet it's very significant. Remove the mask mandate. This is the United States of America. We are a free people. We can make our own health choices, and we deserve to be treated accordingly.
Thanks, Mary. Jackie Thorpe, Kathy Swigert, Jeff Storost. And then I've got, oh, excuse me, go ahead.
Hi, I'm Jackie Thorpe from Palm Harbor.
Hey, welcome.
I have 2 kids in high school, but I'm here for all the kids. Masks are not only ineffective, they're detrimental to the psychological, social, and emotional well-being of our children. They struggle daily. Our kids' experience during high school is now behind plexiglass. They wear masks for 6 hours a day. There's no cafeteria. They get 10 minutes once a day between class, which they're always late to the next class because there's not enough time for all those kids to get a snack. There's no working water fountains, and this is what our kids face every day, over 6 hours in a mask. My daughter has allergies and has missed many days of school because she literally can't breathe with the mask on. She's not alone. We've already been over that the masks are useless and detrimental to the physical, emotional, and social well-being of our children. The chance of fond high school memories for our kids is turning into the memory of the introduction of the tyrannical Marxist society knocking on our door today. We still have constitutional rights. Just an observation, none of you, including the well-paid doctor, has used the word experimental in front of the word vaccine today. I'm sure that's just an oversight. If there's enough of the fear-mongering, it has to stop. Remember, you work for us. People are waking up. Ask yourselves this. If it was up to the people, the citizens of this county, to vote on this instead of you people, what do you think the result would be? There are more citizens showing up for these, aren't there? We're going to continue to show up. Thank you.
Thanks, Jackie. Kathy Swigert, Jeff Storost, Jeff Caputo, Sherry Fiorenzo, Bruce Feldman. Hi, welcome.
Hi. Kathy Swigert, Clearwater. From my research on the CDC website, COVID-19 is a type A influenza, and influenza by any other name is still an influenza, a flu. Quote, CDC does not count how many people die from flu each year, end quote. Unlike flu deaths in children, another quote, flu deaths in adults are not nationally reportable. Some of the challenges include the fact that influenza-associated deaths are often a result of underlying medical problems, end quote. According to CDC estimates, and I'm not going into all the stats because we've been cut down in time, but there were actually 22,000 flu deaths in the COVID season, 22 actual flu deaths. Regarding the children, 2009 to 2010, 358 children died of flu. 2017 to 2018, 187 children died from flu. 2019 to 20, COVID flu season, 192 children died. That is 5 more children who died from the COVID pandemic than any of the non-pandemic flu seasons. 2020 to 2021, 6 months into the season, so far, 1 child has died. Yet children are mandated to wear a mask from age 2 on up and breathe their carbon dioxide for up to 7 hours a day. No fresh air, no fresh oxygen, which is mandatory for the immune system's ability to function and create disease resistance. And if masking stopped COVID, California would have better statistics. The PCR test invented by Kary Mullis, by his own words, was never intended for diagnosis. Too many false positives. Asymptomatic children are said to be carriers because they test positive on these incorrectly used PCR tests, fortifying the lie they need to be masked. Dr. Buttigieg said requiring children to wear masks does more harm than good. He said and YouTube cut out the video was removed of the DeSantis roundtable of COVID-19, and Dr. Buttigieg said, if YouTube thinks that children should wear masks, make that argument. Show us the evidence. Show us your reasoning. They want to create this aura of you shouldn't hear an idea. Florida is a no-mask state. My question to you guys is, why don't you trust the judgment of DeSantis? I don't understand that.
Thank you, Kathy. Jeff Storost, Jeff Caputo, Sheriff Fiorenzo, Bruce Feldman, Yvette Gall. Hello there. Welcome.
Hi. I found out about this just hours ago.
I'm sorry, your name?
Jeff Storost.
Sorry. Go ahead.
I found out about this just hours ago. I came here straight from work, and I don't have anything prepared other than what I just worked out here in the lobby. I'm going to be short and sweet because I could not fit what really needs to be said in the limited amount of time. I decided I should address the doctor supporting these draconian mandates rather than the council. As I sat in the lobby listening, a quote came to mind by Dr. Richard Feynman, physicist and Nobel Prize winner. He was quoted saying, "Science is the belief in the ignorance of the experts." This last year has taken that quote to a whole new level. I work as a surgical rad tech across the state of Florida, from Jacksonville Beach to Fort Myers, and what I am hearing these doctors say does not go along with what the experts are saying. I would like to address the doctors and let them know that they are losing our respect, the respect of healthcare professionals. And we are losing our trust in the healthcare system. I know too many healthcare workers that refuse to get the vaccine. I am one of them. I do not want to be a lab rat taking an experimental gene therapy. According to the CDC, the vaccine is not a vaccine. This has gone on long enough. The decisions have been made by the experts long enough. Let go of the masks and return the choice to the people. Thank you.
Okay. I have Jeff Caputo, Sherry Fiorenzo, Bruce Feldman, Yvette Gall. And just so everybody knows out there, we've got about 20 minutes, 25 minutes, and we're going to have to stop because we have a busy schedule. So go ahead, please.
Jeff Caputo, St. Pete. A commissioner on April 13th dismissed the masked Pinellas versus no mask Manatee comparison in favor of Cho's comparison of 2 schools because compliance could be more effectively gauged. So in staying consistent with that premise, it's an indisputable fact that pupils on Pinellas school grounds have been at a likely 100% compliance with mask mandates due to the threat, duress, and coercion imposed upon them. During the school year, from September to January, COVID cases jumped 84% for youth aged 0 to 18 in Pinellas. I'd like to see facts regarding how effective this likely 100% compliance on school grounds is when cases still jump just shy of 90% over 4 months for that age group. Please note that alleging cases jumped due to improper masking or dropped to proper masking without preventing any such facts as to how, what, or when in support of that position would be a baseless premise. This empirical data of Pinellas schools regarding the ineffectiveness with the high compliance has already been proven for decades with randomized control trials, or RCTs, which are the gold standard of effectiveness research. The CDC, in May 2020, studied 14 RCTs spanning over 70 years, proving community mask wearing had no substantial effects with preventing or transmitting influenza. The size difference is only 0.02 between an influenza and SARS-CoV-2 particle. Those RCTs have not been retracted, as well as many other RCTs echoing the same findings. This ineffectiveness, coupled with the proven damages masks can cause physically to people and psychologically to children, makes for both a failed and dangerous intervention, thus having no public justification, and the commission should thus end the mask mandate. I mean, we're seeing high compliance, 84%. School year started in September. Boom. How is that's 100% compliance on school grounds? Oh, it drops. Oh, so what? They weren't wearing the mask properly? Oh, now we figured out how to wear the mask with a 54. It makes no sense. It's senseless, and it confirms the science.
Thank you, Jeff.
I'd like to hand these out, too.
Give that to her, please, over there.
Yep.
Sherry Fiorenzo, Bruce Feldman, Yvette Gao, Susan Bucci. I'm just telling everybody we're running out of time, so just some of you may not have an opportunity. Go ahead.
Hi, Sherry Fiorenzo. I recently hired a company to do work inside my home. When the employees arrived, they showed up in masks, and after introductions, she immediately told me that they prefer to not wear masks while doing the work and asked if that would be okay with me. I said, of course. I told them I'm active in Pinellas Watch and Mask Freedoms Group, and I asked how many of their clients say yes. He told me that they are in multiple homes throughout this entire time, and that 98% of people say sure, go ahead, including many of our community's elderly citizens. What this tells me is that, in general, people do not believe in the mask. They see the signs, they think they or the business owner will get in trouble, and they do not want the horrible confrontation of someone shaming them for not wearing a mask. You do realize that the majority of people are out living their lives mask-free. I look forward to the day that Mommy and Daddy commissioners are not forcing businesses to tell me to cover my face when I walk in, or that I must be seated, be served food and drink, as if I'm a sick child that doesn't know how to behave in public. Please consider the mental and physical challenges this has placed on those of us with exemptions you accounted for, but so many do not know about or respect. Every single business and every single person must have the right to choose return to them now. When you close the beaches, the parks, and outdoor public spaces and force these masks on us, when the hardworking citizens of this county were deemed non-essential and you continued to collect your paycheck and then raise the property taxes during a pandemic, I woke up and realized that there's much more that you will take if we let you, and I knew I had to start fighting. I do not enjoy this, and I don't want to be here trying to hold you accountable. I do not want to use my vacation time telling you to never do these things to us again. I also fight for the children. Your decision will influence the school board. You allow the general public to sit at tables in restaurants and strangers mask-free, but the school children are not allowed to sit at their desk mask-free.
Thank you, Sherry. Bruce Feldman, Yvette Gao, Susan Bucci, Kevin Smith.
Good afternoon. I'm Bruce from Dunedin. I would come before you in opposition to extension of the state of emergency. I would like to please have somebody explain to me that is with facts, that with evidence, with data, that is not platitudes of the new religion of scientism, because there is no emergency, I believe. I mean, we already know that there's no lockdowns. There's plenty of jobs here where I go in the county. There's hiring all over the place. There's the experimental gene therapy is available for anybody who wants it over the age of 16. This virus that is supposedly created, this emergency, is 100% treatable with hydroxychloroquine, ivermectin, budesonide, remdesivir, Regeneron plasma, and multi-other treatments, so there's no reason that people should die. Hospitals are not overrun. The staffing issues are likely because of furloughs and lack of people being in the hospital. Death and hospitalizations, we already said today, are down dramatically from where we were last year. Cases and positivities are going down, and I believe that's just a really wrong metric to be able to base removal of this situation, because sick people are the only ones being tested If we're looking for cases, we don't know that these tests show that these people are infectious or not infectious. It could be picking up a remnant of some old disease. And then the herd immunity number, is there calculations being taken into effect? The thousands, potentially tens of thousands of people who have had the virus, who'd had no testing, who had no medical treatment and recovered without any issues. So let's just be really honest, and it's been said here more than one time, that this state of emergency is not about our health and safety. It is about a state and federal money grab. You always talk about reimbursement for this, reimbursement for that. I have a novel idea. How about the government get out of medical administration and let the hospitals and doctors and all the private sector deal with vaccination? Because obviously the number of people getting vaccinated is plummeting. So that's my case, and I'm sticking to it.
Thanks, Bruce. Yvette Gao, Susan Bucci, Kevin Smith, and yes,
Hey,
go ahead.
guys.
Hi.
So some of you guys have received my emails. It's been 308 days. The pandemic is over. Okay? Did y'all hear that? It's over. So we have taken time out of our busy schedules. You guys are sitting here. Some people have jobs that have to go to work every day, and we're taking our time to come out here to talk to you about wearing a face diaper, okay? We're out here unafraid around everyone out there. We're all sitting there next to each other, hugging each other, unafraid. So some of you guys are still sitting here with masks on, and we're over 6 feet apart. I don't know what that is. Is that a game? Are we doing that for what are we doing that for, okay? Doesn't this seem ridiculous to you? Come on. The majority of us have just been living our lives. I will tell you, I don't wear a mask. I live my life, and I am not asymptomatic, and I am not going to give you a deadly virus. I'm healthy. I'm not sick. I'm not coughing on you. We don't patronize the stores that demand we wear a face diaper, but we do let them know, I trust you. When I go into a store and they want to make it a problem for me to go in there and shop and spend my money, I let them know what's going on, okay? They are not doctors. They're not authorized to tell me to put a medical device over my mouth to prevent the flow of oxygen. I remind them that the Constitution is not thrown out of the window under the guise of a pandemic. So I thought Mr. Cho was going to be here because guess what? He's not my doctor. However, as a doctor, he takes a Hippocratic oath. First, do no harm. That's what he does, right? That's the studies. So I think he needs to produce the studies showing wearing masks for the mass population will do no harm. And until he can produce this, this is ridiculous, dangerous, divisive, political, and ineffective. Mask mandates need to be rescinded. And by the way, I'm not getting the vaccine because it's under emergency use authorization, and it is experimental. So God bless you guys, and please rescind the mask mandate and get rid of this.
Thank you. Susan Bucci, Kevin Smith, and then we're going to, I got a couple others here. Joanne Marshall and Cynthia Smith, I guess. Go ahead. Sorry.
Hi, my name is Susan Bucci. I live in Tarpon Springs, and I was hoping Dr. Cho was going to be here, but I heard he left a long time ago. So I'm going to ask you to ask him a question. Ask him if people can exist pain-free with RA without medication. Okay, ask him that question. Or lupus. Okay? And I'm going to guess that he's going to say absolutely not. It's going to be medication. It's going to be a combination of medications. And I can tell you from firsthand experience that I have met many, many people, thousands of people who are living pain-free without being on medication. It's possible. There's a whole other world out there. And I'm not sure if Dr. Choi knows about it or not, Dr. Cho. So he needs to educate himself as to that other world that is there. You're listening to him. You're not listening to, somebody mentioned before, how come he's the only voice you're listening to? You know, I mentioned before, because I've been here, the highwire.com is an excellent resource to listen to. They interview people, experts from all over the world that have just as many credentials or more than Dr. Cho. So that's all I'm going to say. And then also, building your immune system. Viruses always have been here. They're always going to be here. I heard Biden say that another pandemic is going to be coming. So are we going to lock down again and socially distance and wear masks and wait for another vaccine? We have to take responsibility and take care of our own bodies. I had COVID. It was really not a big deal for me because I take care of myself. The only reason I got it, I think, is because I was really stressed. But that's besides the point. I mean, it was a week that I was tired and I had a little bit of a temperature. So that could be everybody, you know? So anyway, okay, that's it. Thank you.
Thank you, Susan. Kevin Smith, Joanne Marshall, and Cynthia Smith, and Alicia Smith. And that should be all of the folks in the House. And then I don't know how much time we're going to have for a couple online, but we'll see. So I've got Kevin Smith, Joanne Marshall, Cynthia Smith, and Alicia Smith. Hello, welcome.
Hello, my name is Alicia Smith. I believe that it should be up to my parents and I if I should wear a mask at school or anywhere that I go. I've been physically attacked at school 6 times since March 8th. I was physically attacked on March 11th by a student at school. The school staff, our SRO, and myself have not been able to identify my attacker because he was wearing a mask. If he was not wearing a mask, we could have been able to identify my attacker. On April 22nd, a student at my school approached me and informed me that she had heard other students saying that they want to kill me. After an investigation done by the SRO, the girl is unable to identify the children that said that they want to kill me because of them wearing a mask. I'm afraid to go to school because we can't identify these children that have physically attacked me and threatened my life because of them wearing a mask. I know for the fact that these masks are giving the bullies
I don't know where we are. I don't know any of them.
that the masks are giving bullies a free pass to bully and physically attack other students at school. This is criminal, and I should not have to feel unsafe at school because of everyone having to wear masks. This has already been going on for 7 weeks with me. How much longer am I going to have to live in fear with these bullies wearing a mask? Please have the courage to stand up and stop the mask mandate, if not for medical reasons, please for the safety of me and all the other students' safety in Pinellas County.
Thank you for sharing your story, Alicia, and I'm sorry you've had that experience at school.
Please stop the mask mandate.
Okay, I have Kevin Smith, Joanne Marshall, Cynthia Smith. Hi.
Good afternoon. I'll be brief. My name is Kevin Smith, Dunedin native, Dunedin resident, Dunedin business owner. The business focuses on children. We have over 250 children in our facility. I beg all of you, you guys have all heard science and numbers and stuff. You guys get given science and numbers and stuff from people that are bought and paid for. I highly, highly beg any of you, go to a school, go to a child care facility while they're loaded with kids and ask the kids, pull them aside. How is this going for you guys? Are you okay? Do you guys miss smiles and faces? These kids don't learn, they don't understand. Again, they'll look right there, I can see, not even interested because you're not paying attention. Those types of things. Kids can notice and pick up on it because they haven't fully developed their brains, so they look for physical things to see amongst people. Please unmask, just lift the mask mandate, make it optional in our facility. The parents and the children that would like to wear it, that have any sort of compromised immune systems or any of their other issues, they can wear it, and they wear it happily, and we promote them wearing it. It is their choice, just like everything else in this life. Did you choose what outfits you wear today? Did you choose what car you bought? Did you choose what food you eat, where you live? Everything else. Thank you for your time. I yield the rest of my time.
Thanks, Kevin. Joanne Marshall and Cynthia Smith. Hi.
Hi, I'm Joanne Marshall. I live in Pinellas Park. After the last meeting, I heard the numbers, and I used to crunch numbers for a living. So I went and looked at the 11 counties within the Tampa Bay area, and I was just curious as to what their 7-day average totals were as compared to Pinellas and Hillsborough, which are the only 2 counties that have mask mandates. I took those numbers, divided them by the total population. And basically what we're talking about here is 0.02% of every county, their population, they're the same numbers. So it's not making any difference out of 11 counties whether you have a mask mandate or not. And I did look at the all-time numbers for corona cases within Pinellas County, and it's 8% of the total population. I don't think those numbers are bad considering we don't have flu anymore. The other thing, I could repeat the same thing with allergies. It's very difficult in the heat with allergies and with red tide coming to be forced to wear a mask. But my bigger issue is this mask mandate has been in for 10 months. Have you looked around Pinellas? Have you looked at the Gulf, the intercoastal, other waterways, parking lots, sidewalks, streets, and seen used dirty masks littered everywhere? And no one has done anything about that. That won't happen anymore if we stop the mask mandate. And please, please, work on something to clean up our county. The other point I wanted to make is the organization chart for Pinellas County has citizens at the top. We're asking you respectfully to please stop the mask mandate. Let us make our own decisions. The numbers are not that bad. Thank you.
Thank you, Joanne. Cynthia Smith. And that's the last person I have in here. And we have a few minutes to get a couple people on Zoom, but we'll not be able to get to all of them. Cynthia Smith, go ahead, please.
Hi, my name is Cynthia Smith, and my daughter is Alicia. You just heard her story. On March 11th, she was physically assaulted by a student at school, and the school staff, SRO and Alicia, have not been able to identify him, and it has been several weeks now. Why? Because he was wearing a mask. On April 22nd, a student came up to Alicia and informed her that several students said that they want to kill her. There was an investigation done, and because of the students wearing a mask, the student was unable to identify the students that threatened to kill my daughter. It's time to stop hiding behind COVID. It's time to stop this mask mandate. I am frightened for my daughter's safety and life at school. Please stop giving the bullies a free pass to bully and attack our students in Pinellas County, but by not mandating masks in our country, our county. Commissioners, Stanford studies masks don't work. In fact, it's proven they do many harms. MIT studies state social distancing makes no difference. All of the doctors in these studies outrank your medical experts in education and accolade. Yet you simply live in a vacuum with your own out-of-touch bodies. We have reached a precipice as citizens. In the last year, you have overstepped your boundaries way too far, and you have not listened to anything we have presented for you to consider. What started off as some concerned citizens meeting up after work has now grown into a solid group of more than 6,000 actively engaged citizens and a network of about 80,000 Pinellas County citizens in our affiliated groups. We can push information out there faster than you can now. Have you checked the Tampa Bay Times online subscription numbers lately? Not good. So if you happen to have friends or relatives that are no longer RN, we have friends with more followers than the Tampa Bay Times. Way more among the engaged citizens. We have doctors, lawyers, military intelligence, PLS, former CII, and even some former BCC employees who have been very candid. So for a year now, we've been investigating all of you and your dealings, and I want you to know we will know all of it. We know every committee you sit on and who you sit on them with. We know all your pals that keep circulating as so-called experts and influencers of this board's decisions.
Thank you.
Thank you.
All right. We're going to take a couple of online, and I'm going to unfortunately ask you to limit it to 1 minute. I've got probably 12 people here, and we really need to stop now, so I'm going to take Linda Bablin. Oh, you go ahead. Who you've got, Kat? Go ahead.
Linda Bablin, if you could raise your hand in the Zoom application if you joined us by Zoom. And I do not believe she's on the call.
Okay.
The next name is Tracy Sanders. If you could raise your hand if you've joined us by Zoom. And it does not appear that Tracy is there. The next person is Karen Mullins. If you please raise your hand if you've joined us by Zoom. And she is not there either. So the next person on my list is Holly Fleming. Holly Fleming, if you could raise your hand, and then we're going to unmute you and ask you to speak. You'll have 1 minute.
Can you hear me?
Yes. Go ahead, Holly.
Okay. Hi, my name is Holly Fleming. I live in Seminole, and I've been a Pinellas County resident for 16 years. I'm against the state of emergency. The document with the references for what I'm about to state and more were handed in hard copy to the Commission on April 13th, 2021 by Jeff Caputo. Pinellas area hospitals are not exceeding nor ever did exceed normally expected hospital capacities warranting a state of emergency. Common target utilization for hospitals is 80 to 90% capacity. Peak Pinellas County COVID hospitalizations were at a census of 481 on July 20th of 2020, and the total census was at 82% for regular facilities and ICU at 83%, thus still within the target utilization parameters, even at a peak COVID census that has never exceeded 400 since. The need for hiring the 287 nurses around the late July peak was due to staffing shortages from the furloughing of nurses in May 2020 due to elective surgeries being canceled. So hospital capacity problems were not due to...
Holly, that's a minute. Sorry about that, but we just got to move on. Sorry.
The next individual is Aiden Barnes. Aiden Barnes, if you could please raise your hand. Perfect, and we'll unmute you then. Thank you. You'll have 1 minute.
Hello, this is Aiden Barnes, 10240 127th Ave. The truth is a heavy weight to bear, but we must each face and confront reality. The battle for our constitutional rights is the battle for our very lives. Our country has been infiltrated, but it hasn't been taken over yet. How do I know? Because of the Pinellas County residents speaking out today. We have power. We cannot be controlled, and we will not be silenced. Not by your masks, your intimidation. We will not be silenced. Why are citizens in this county being harassed? Trauma victims, those with severe skin disorders, anxiety disorders, it goes on and on. People in this county are so sick of the mask mandate. We're over it. Employees in the service industry have been forced to mask for months. Many cannot speak out for fear of retaliation from their jobs, but I will speak for them. They want freedom from this mask mandate. We recognize our God-given freedoms enshrined in the Constitution. No ordinance by county government overrules our right to life and liberty. Freedom must be fought for and preserved for future generations. We will not be silenced.
Thanks, Aiden. Go ahead.
I only have 3 more left, so the next is Sharon Culvert. If you could raise your hand in the Zoom application, and then you'll be unmuted. You'll have 1 minute. Thank you.
You there, Sharon?
Hey, Dave.
Hi, Sharon. Go ahead.
Can you hear me?
Yes, go
Okay.
ahead.
Thank you for the opportunity. I hope you were really listening to all who spoke before me, because your power is only justified when consented to by the people. So I will keep this short. I would also like to see your mask mandate rescinded. Governor DeSantis's extension of the state's COVID state of emergency today included, for the first time, that the state should prepare to resume to non-emergency operations. It's time for Pinellas to end the mask mandate, make it optional, trust your constituents to make the right decisions for them and their families. Please trust your constituents who now, with lots of information, numerous therapeutics, and vaccines, can make decisions for themselves and their families. Please end the mask mandate. Thank you.
Thanks, Sharon.
The next individual is Isaiah Neal. Mr. Neal, if you could raise your hand, and then you'll be unmuted. You'll have 1 minute.
Thank you. What we have going on here is an issue of maskification without representation. The broad powers you think you guys hold are derived only from the consent of the governed, and we, the governed, don't consent. You can turn a blind eye to the science that contradicts the mandate. You can turn a deaf ear to the constituents who email and who take time off work and come out meeting after meeting. However, as an individual, as a commissioner who has been given a God-given position of leadership, there will be a day in this lifetime or the next where you'll stand before God and give an accounting of the authority you've been given and the decisions that you made with it. Did those decisions hurt or help others? Did those decisions bring life and build up others? Or did those decisions and votes that you're voting on perpetuating anxiety, depression, suicide, substance abuse, domestic abuse, child abuse over the citizens that God allowed you to lead?
Thank you, Isaiah.
And then the last individual is Daniel Swanson. Mr. Swanson, if you're on the Zoom call, if you could raise your hand. And I don't believe Mr. Swanson has joined us.
Okay, the only other thing, the person I had, Dawn Lechner, she's not on.
Don Lechner and David Happy both spoke in person.
Okay, that's right. Thank you. Okay, that gets us through all of the speakers, and we are here to staff's recommendation. Please, Barry, again. Thank you.
The staff recommendation is to approve the state of extending the state of emergency until May the 7th.
I have a motion by Commissioner Flower, second by Commissioner Long. All in favor, say aye. Aye. Any opposed? Aye. No.
She has unmuted, I believe, if she had wanted to.
Did you want to speak, Commissioner Peters?
No, I was just voting yes.
Okay.
As long as you've got me on, Dave, I do have a question. After the vote, I have a question.
Okay. So that was a yes, so that was a unanimous vote to extend to May 7th. And again, everybody will be back here on May 11th to discuss the ordinance, and I will not cut people off short of their 3 minutes at that meeting. Okay, we are moving quickly through. I have a few citizens to be heard, and then, but I'm going to cut that to 2 minutes. Sorry, guys, but we have other business to take care of as well. So under our citizens to be heard, I have Holly Hands, David Ballard Geddes Jr., Greg Pound. Oh, right over here.
Here, okay, thank you.
Hi, go ahead.
Hi, hello, and I'm sure you're all sick of the COVID.
Yeah.
And I know you're all tired, and I'll try to make this sort of quick.
We only have 2 minutes. I'm so sorry.
Oh, I'm sorry.
Go
Okay,
ahead.
2 minutes. Okay, I want to just say.
Say your name again.
My name is Holly.
Okay,
and
go
my
ahead.
last name is Hans, H-A-N-S. I've been the victim of severe identity theft. And right here, I am being sold in Asia and Shanghai. I have an iPhone, okay? These hackers went through 5 of my, I had to change them, iClouds. Now, can you imagine how horrible it would be if you got hacked, let alone having the hackers who are brilliant in the computer field go through every iCloud. They gleaned my photo license ID and my social security number. So that's why I'm being sold. They have event listeners, and there's a lady within the group that has gotten a hold of my Macy's card, and they've gotten hold of all of just about everything you can think of. They took all my Facebook friends. They have gotten a hold of them. They have gotten a hold of everything you can possibly think of. I hear these cries from the community, Pinellas Sheriff and all that. There is at least 8 that I know of, 8. The last break-in I had was Friday night. What they're doing is they're trying to gain access through your router, okay? and they can do it. All they have to do is access remotely into your router. It's very easy. I have pictures that my router has been jailbroken, and then they start with Darwin tunneling and all sorts of other things that I have pictures of.
Thank you, Holly. I'm sorry that we don't have any more time.
I am asking for your help, please, in identifying these people. I do have their names.
Okay.
Thank you.
David Ballard Geddes Jr., Greg Pound.
Thank you again. David Ballard Geddes Jr. I live on Georgia Avenue in Palm Harbor. Unfortunately, the speech I have prepared is 3 minutes. I'll defer till next meeting to
that'd be great.
give this if possible. Thank you. And I appreciate you allowing me to talk on the COVID. Thank you.
Thanks. Greg Pound, David Lee, Larry Polnicki. Greg Pound, David Lee, Larry Polnicki. Okay, do we have anybody online? I'm showing a couple, but
Yes, Mr. Chair, I do have 5 individuals who registered to speak online. Some of them were on the mask mandate, but they registered under citizens to be heard, it looks like.
yeah, we're not going to hear from the mask mandates today anymore. We've already done that, and they'll be able to speak 3 minutes next time.
Okay.
We're plumb out of time.
That's fine. The only other person I had, I believe David Lee had also indicated that he would call by phone, and I do not have a phone call or an individual by phone who's appearing, so I do not have anybody.
So can
then.
you tell me the people that that wanted to talk about masks?
At the topic areas indicated masks for Nina Cruz, Renetta Cruz, Patricia Cox, and Patricia Jenkins.
I don't have Patricia Jenkins on here, but you three, we'll have your names here, and we'll try to get you on at the beginning of the Zoom call on the mask issue on on May 11th. Anybody else?
No, thank you.
That's all online. And, okay, that's all we have for citizens to be heard. We're moving on to our consent agenda. And do I have a motion for consideration of the consent?
Second.
Commissioner Flowers on the motion, Commissioner Seal on the second. Anything to be taken off? And I will dispense with the normal dollar amounts that are reflected in this consent. All in favor say aye.
Aye.
Any opposed? The motion carries unanimously. Okay, on to the regular agenda. Mr. County Administrator.
Agenda item number 25 is a recommendation from the Tourist Development Council to approve amended Tourism Development Council bylaws. They were unanimously recommended.
Move approval. Second.
I have a motion by Commissioner Long, second by Commissioner Seal. Are there any questions? No questions? Okay. All in favor say aye.
Aye.
Any opposed? Motion carries unanimously. Item 26, Barry.
It's a resolution approving the State Housing Initiative Partnership Local Assistance Plan for years 21 through 24 with the Florida Housing Finance Corporation.
Move approval. Second.
Commissioner Long on the motion, Commissioner Seal on the second. Are there any questions on item 26? All in favor say aye.
Aye.
Any opposed? Motion carries unanimously. Item 27 under utilities.
This is an
Oh, hold on. Sorry. Go ahead, Barry. Introduce it, please.
This is an agreement for laboratory testing equipment and supplies with Hack Company, and this applies for utilities and other county departments.
Thank you. Commissioner Long, did you make the motion?
Yes.
Sorry. Second by Commissioner Gerard. Any questions? All in favor say aye.
Aye.
Any opposed? Motion carries unanimously. County Attorney's report.
Under item number 28, I recommend that you approve the resolution recognizing charter authority for the county attorney to defend lawsuits.
Move approval.
Who was the maker? Did you make the motion? Okay, sorry. Commissioner Long and then Commissioner Steele on the second, or Commissioner Gerard on the second. Any questions? All in favor say aye.
Aye.
Any opposed? Motion carries unanimously. Item 29.
Really nothing further to report. The only thing I did want to note is that the data that was released yesterday was apportionment data, not the data that we need to undertake our process. So further updates to come in the future.
Okay, that was on redistricting, just.
Correct, on item 29, redistricting.
Okay, thank you, appreciate that. County Administrator, report.
Today, we were planning to have a update on the spring break activity by Steve Hayes. We can defer that considering how long the meeting. It's up to you whether you want to take that now or not.
It's the will of the.
Defer.
Defer, okay. Anything of an emergency status that we need to know about?
No.
Okay, all right. Sorry, Steve. We'll get that from you
He'll
the next
understand.
meeting. Not that the next meeting is going to be any shorter, but, you know. All right, so do I need anything? Oh, no, I don't need anything. Anything else, Barry? Is that it?
Really, that's it.
Okay. All right, item 31.
This is approval of the federal legislative program. This covers areas of National Flood Insurance Program, beach nourishment, transportation and infrastructure, a ban on offshore drilling, and COVID-19 federal support for local governments.
Move approval.
Commissioner Long on the motion. Second by Commissioner Gerard. We've had our legislative group in. We've had discussion about it. We've developed it. I'm not hearing any changes. All in favor say aye.
Aye.
Any opposed? Motion carries unanimously. Item 32, we are not going to take up today. That's the appointment of our redistricting board will be done at a later date. And now we come to the County Commission new business. Any board updates, anything that anybody would like to bring up? Commissioner Seal.
Yes, just briefly on Forward Pinellas, we had a presentation at the last meeting, and we will be updating target employment and job access as a emphasis going forward, which it will include updating the employment study from 2008, looking at tourist-oriented design, keeping a focus on the Gateway Master Plan, regional multimodal access, and so on. So that was probably, we talked about the budget coming up, and there may be a millage increase proposed, and then we talked for a while about the draft multimodal priorities, and I already shared with Barry the concerns about some of the Duke Energy overpasses. So we had a meeting last week, and he and I discussed that.
Okay.
So that is it from me. Thank you.
Okay, thank you. Anybody else? Okay. It's 5:33. We are going to take a half-hour break. And we'll start back at 6 o'clock on schedule for our public hearings. Thank you, guys. we have several public hearings tonight. We did have Commissioner Peters, who is out of town on an emergency family, who participated in the first part of the meeting tonight, will not be here for this meeting. So we only have 6 folks, 6 commissioners listening to the cases tonight. So just be aware of that tie votes do not make sure that the item that's made a motion on will not pass on a tie vote. So just wanted to let everybody be aware of that, that we'll only have 6 hearing the cases tonight, and we're going to start with item 34. Kat.
Mr. Chair, agenda item number 34 is a proposed resolution approving a second substantial amendment to the fiscal year 2019-2020 annual action plan for the purpose of receiving a second allocation of the Community Development Block Grant Coronavirus Response Funds. No correspondence has been received and the item has been properly noticed. The matter is properly before the board to be heard.
Thank you, Kat. Barry, did you have anything?
Just that the county will receive $2.4 million for additional CDBG money from the COVID relief funds for low and moderate income residents.
There's an eligibility there for things that can be included. You mentioned. Could you just mention those real quickly?
Sure. So the activities that are included, and it's not. This is not an exhaustive list, but job training, providing testing, diagnosis services, increasing the capacity and availability for health services, providing food, equipment, supplies for public services, delivered home delivered meals, and other types of assistance like that.
Okay. Thank you. Are there any questions for Barry from the commission? And I don't have any. I don't have any cards, and I'm assuming nobody online. So.
No, we do not have anybody on this item.
Okay. Move approval from Commissioner Long and Commissioner Gerard on the second. All in favor, say aye. Aye. Any opposed? Motion carries 6-0. Moving item 35.
Agenda item number 35 is a quasi-judicial hearing on case ZON-21-02. This is an application of Valentin Markov for a zoning change from RMH, residential mobile manufactured home, to R4, 1, 2, and 3-bedroom family residential. Since this is a quasi-judicial hearing, all those individuals who plan to speak on this item must be sworn in. So for those of you wishing to speak, whether you are attending in person or virtually, if able, please raise your right hand. And do you swear or affirm that the testimony you are about to give is the truth, the whole truth, and nothing but the truth? If so, signify by saying, I do. All right, the public hearing was properly advertised. An affidavit of publication has been received for filing. 1 letter in support of the application has been received. The matter is properly before the board to be heard.
Okay, thank you. Item 35, does anybody want to get a presentation on this item? I don't see anybody raising their hands. I don't have anybody that's given any cards on item 35. Do I have a motion, please?
Second.
Commissioner Long on the motion and Commissioner Seal on the second. I saw people standing up. I'm assuming they don't want to be heard. All in favor say aye. Aye. Any opposed? Motion carries 6-0. Item 36.
Mr. Chair, agenda item number 36 is also a quasi-judicial hearing on case number DMP-21-01. This is the application of Synchronous Media Group Incorporated for the establishment of a development master plan for a residential plan development zoned property. Since this is a quasi-judicial hearing, all those individuals who plan to speak on this item must be sworn in. For those wishing to speak, whether you are attending in person or virtually, if able, please raise your right hand. Do you swear or affirm that the testimony you are about to give is the truth, the whole truth, and nothing but the truth? Signify by saying, I do. All right. The public hearing was properly advertised. An affidavit of publication has been received for filing. No correspondence has been received, and the matter is properly before the board to be heard.
Thank you. I do have 3 folks that would like to speak, 2 for and 1 against, so I will ask planning to come forward and give us a presentation.
Hi. Good evening, Commissioners. Michael Schoderbach, Principal Planner, Housing Community Development Department. Advanced. I'm waiting for control to be able to advance. All right, this is a request. The property is approximately little over 4 acres in size, located at 2625 County Road 95 in Palm Harbor. It's a former radio tower site. There's currently a vacant utility building on the site. Its future land use is residential urban. There's no change to that. The zoning is RPD, residential plan development, no change. Proposal is to establish a development master plan for a 30-unit, single-family attached townhouse subdivision, which is a requirement in the RPD zoning district. Next slide. The development master plan is a requirement in the RPD zoning district. RPD is a highly flexible zoning category, allows for a wide range of housing types. This DMP will establish the housing type that they're looking to build, setbacks, building height, lot size and dimensions, and transportation layout, which is access points, internal drives, and open space areas. You can see the property here outlined in red on the map. Again, it's located on the north side of County Road 95. It's east of US Highway 19. Give you a general area. It's about halfway between Curlew on the south and Tampa Road on the north. It's currently in vacant. Down in the southeast corner is the old utility building that was part of the tower that was there. The property directly west is a county-owned property, which is vacant. To the north and northeast is a large multifamily development. That's their pond, and then the development kind of wraps around there to the northeast. Directly east is a single-family home. To the south, from across County Road 95, from east to west, you have a church, an assisted living facility. Directly south of them is an apartment complex, and then you have commercial and office uses along US Highway 19. And here is the property, RU, which allows 7.5 units an acre, which is the predominant land use there directly adjacent to it. Further off to the east is RL, and along US 19, that's all commercial, residential, office, retail. And most of the zoning of the residential in the area is RPD, residential plan development. Here's just a closer aerial shot of the site. And some site photos. First one on the left is looking north at the site from County Road 95. One is of that vacant building. And then looking east and west across the street, east towards the church assisted living facility, and then west towards US 19. This is a copy of the master plan. On the south side of it is County Road 95. You can see the units on there. They're clustered in units of 4 and units of 6. The dwelling is single-family attached townhouses. They're asking for 30 units, which comes out to the 7.5 units an acre. Maximum building height's 35 feet, with setbacks of 20 feet on the front, 10 feet on the rear, 0 feet on the side because they're attached, and 10 feet in between the buildings. And they're proposing a large open space off on the north side. That dashed line is a wetland area. So they're proposing the stormwater ponds between that and leaving a large area open. Directly adjacent to County Road 95 is a Duke Energy easement. So there is a large open space there as well. We find that the proposed master plan is consistent with the future land use category in the RPD zoning district. It's keeping with the traditional development patterns of the RPD zoning district. There's a mixture of single family and multifamily in the area, and we find it's consistent with the comp plan. Staff recommends approval, and the LPA recommended approval as well.
Okay, thank you. Any questions for staff? Okay, thank you. I have a couple folks for it. John Want to say Skitsavage? Are you here? Thank you, John. Come on up. I saw your sign on the property, so obviously you're the broker. Hi there, welcome.
Thank you, and thank you for that excellent pronunciation of my last name. I am a commercial real estate broker. I'm here on behalf of the owner. I'm here to answer any questions. We've been working on this, the sale and development of this property for a very long time. It was used for commercial purposes for multiple decades. It was an AM radio station tower with a broadcast studio. That little building in the corner was a broadcast studio for an AM radio station. We changed the zoning years ago to the current zoning, and this is the first development project that we've had that actually makes sense of the physical aspects of this property and is consistent with the land use and zoning plans. I'm here to answer any questions if you have
Okay.
any.
Thanks, John. Any questions for John? Yes, Commissioner Flowers.
Good evening. Thank you so much for coming on today. For the 30 units, are any of these affordable units? Or do you have any idea of what your market rate would be for these, or you're not
I would
sure?
have to defer to Reed Hayden, who represents the developer on the deal, and he's here.
And he wanted to speak anyway, so come on up, Reed, and answer that question. Did you? Hey, Reed Hayden, he was, wanted to speak in favor. Go ahead, Reed.
Reed Hayden, 105 Bayside Drive, Clearwater, Florida. I'm actually the applicant and the developer for the site. As far as affordability goes, it's a townhome project. There aren't units that are specifically earmarked as affordable, but it is a more affordable product relative to its size. The units themselves are around 1,800 square feet, and they're going to sell for a lot less than a home would of that size. So I think in that right, it does provide an alternative that's a little more affordable than single-family homes.
Do you already have a number of them already pre-sold, or just?
No, do not. I actually sell the lots to a builder. The builder is D.R. Horton. D.R. Horton will be builds a very nice home, very nice affordable home, and their product here, I imagine, will start in the 200s.
Okay. Thank you, sir.
Did you have anything else? I mean, you were to speak second. Did you have
Not
anything
really.
else?
I think Michael did a fine job. There's not really, it's very self-explanatory. I don't think there's anything I need to add. So I'd probably just do damage if I did. So thank you very much.
Reed, thank you. You have plenty of time if you need to come back. So, and I do have one other speaker speaking against. It's Alan Crandall. Alan, come on up. You have 3 minutes.
So I guess I got the case number wrong.
Oh, which one did you didn't want
I'm
to?
the one, I would like to be opposed to the development between Stonehenge Way and Arbor Lane off County Road 1.
Okay.
Apologize for that.
County Road 1. I don't think that.
That's not being heard tonight?
No, I think that's been, let me just make sure. Which one was that? That was, Kim, which one was that? Do you know?
It was a very narrow strip of land.
Yeah, that's been withdrawn. That's been withdrawn.
Okay. All right, appreciate it.
Yeah.
Thank you.
So he is not, for the record, speaking against this development. The one we just heard from. So anybody else that I didn't get a card from that wanted to speak on this item? Okay, I see none. Any other questions? Yes? Okay. Chad Whaley does not need to speak? Correct. Okay. He was speaking in favor of the item. Okay. Any other questions? Okay, all in favor, say aye. Aye. Any opposed? Motion carries unanimously, or excuse me, it carries 6-0. All right, we're moving on to item 37.
Mr. Chair, who was the first and the second for the last case for agenda item?
Well, I obviously jumped the gun. So let's, thank you, Commissioner Flowers. Commissioner Long, and the second. All right, now we'll try again. All in favor, say aye. Aye. Any opposed? Well, you almost got it turned down just out of a goof up on my part. Thank you for catching that. Appreciate it. Motion carries 6-0. Item 37. Thanks for catching that, Kat.
Absolutely. Agenda item number 37 is another quasi-judicial hearing. This is case number Z-LU-20-12. This is the application of Dushwant Gulati for a zoning change from RR, rural residential, to R3, single-family residential, and a land use change from residential suburban to residential low. Since this is a quasi-judicial hearing, all those individuals who plan to speak on this item must be sworn in. For those of you who are wishing to speak, whether you are attending in person in this room or in the overflow space or virtually, if able, please raise your right hand. And do you swear or affirm that the testimony you are about to give is the truth, the whole truth, and nothing but the truth? Signify by saying, I do. The public hearing was properly advertised. An affidavit of publication has been received for filing. 92 letters, 19 emails, 14 voicemail messages, and 1 petition with a total of 92 signatures in opposition have been received. The matter is properly before the board to be heard.
All right. Thank you. Let's go ahead and get a presentation from staff.
Good evening. Glenn Bailey, Zoning Manager, Housing and Community Development Department. This is, if you might remember, the board continued this case a couple of months ago at the applicant's request, and no changes have been made since that time. The subject property is approximately 2.18 acres. That's 1736 Winchester Road in unincorporated Largo. It's currently vacant except for a barn and a couple of sheds. Request a future land use map amendment from residential suburban, which allows 2.5 units per acre, to residential low, which will allow 5 units per acre. And along with that, a zoning atlas amendment from rural residential, which is 16,000 square foot minimum lots, to R3 single family residential, with a 6,000 square foot minimum lots. The proposed use is a single family subdivision where the maximum number of units would be 11. You can see an aerial subject property. Get your bearings, Belcher Road, you see it's to the west, to the north is Bel Air Road, and some smaller local streets between those two. And you see it's a mixture of residential development types. There's a mobile home park to the northeast, various size single-family residential lots scattered throughout. The large, basically institutional use to the southwest is Belcher Elementary, just to give you an idea of where this is. You see the future land use request. The lighter yellow is residential suburban, which allows 2.5 units per acre. It's hard to see. It's very light gradation there of difference. Slightly darker color would be the residential low, the 5 units per acre. That's what's currently existing directly to the east across Winchester Road. And the area that does not have color is the city of Largo, and the area of green is the preservation to the south. Just basically a mixture of residential densities, residential uses in this location. Here we see the zoning. The lighter color is the residential rural zoning. On the left, on the right is what they're proposing, the R3 single-family residential. You see that R3 currently surrounds the subject property on 3 sides. Only to the west is the rural residential zoning. So it's basically they're asking for the same zoning that's surrounding them most of the way around the property. See the aerial, closer aerial site property. It's heavily treed. Again, it's been just has a barn on the property. It's not been used for any residential uses in a long time. But you can see the various sizes of lots. Smaller lots are to the east or to the left of the property. Across Winchester, that's your R3 areas, and the other parts around the other sides to the south, slightly larger single-family homes. There's a large lot, single-family home to the west, and again, it's varying lot sizes in this location. Here we're looking at the subject property from Winchester Road, and you can see it's heavily treed area. It's a large lot. And looking north and south down Winchester Road, you see Winchester Road is a substandard condition. If they are approved and build a subdivision, site plan review, through that process, they would have to upgrade Winchester Road up to their entrance and also in front of their property. So it would have to be upgraded at the applicant's or developer's expense. Again, the intended use, single-family detached subdivision with 11 units maximum based on the acreage of the property. The final number of units, however, could be potentially smaller than that because you got to have space for drainage, access roads, and things like that. So it's just a matter of how you can fit, 11 6,000 square foot lots on this property. There's no concept plan that was submitted or anything like that. Potential traffic impacts approval could generate up to 58 additional daily trips. It will not change the level of service on the surrounding roadways. The closest road that's regulated for level service is Belcher Road. And again, Winchester Road will need improvements, and the developers are responsible for those. The recommendations of proposed land use and zoning amendments are appropriate because the surrounding area is a mix of RS and RS land use categories. And RL is directly to the east of the subject property. And the R3 zone is contiguous on 3 sides. And we feel it's consistent with the comprehensive plan and also consistent with the countywide plan map. It would not require a change at the countywide level. Staff recommends approval, and the local planning agency recommended approval with 4-2 votes. If you have any questions, I'd be happy to answer.
Okay. I'm just trying to orient myself based on the pictures that you gave us and the zoning map. So just want to make sure I'm clear that that dirt road that we saw is the Winchester Road that separates the subject property from the R3 zoned areas.
That's correct.
Or is that zoned or land use?
That picture on the right, you can see the R3 homes on the left side of the road, when it's looking south.
Oh, okay, all right. And that's a public road?
Correct.
And that's the one that would have to be brought up to?
Correct.
Brought up to standard, okay. Any question? Commissioner Seal?
So either way, would the developer have to do the entire road? Because, not all the road fronts their property. It's several properties.
Most likely, it would be the closest other street is Kelsey to the north. Let me see if I can bring this map up again. Kersey, sorry. You can see it there in front of that row of houses. It's in City of Largo, so you got this almost not townhouses, but there is Kersey. He would have to upgrade that road from Kersey all the way down to the entrance of his subdivision and beyond up to the southern property line. Maybe this is a better.
And actually, there's a sign on the road that says private property, do not use the road, basically.
It's a public road, yeah. Just it's not upgraded. So, but he would have to, upgrade the road to the corner of the red, his property right there, southeast corner. And it would include sidewalks, things like that.
Okay.
Yeah, that seems to be problematic. When you have, you're putting, I guess it's a little bit like sidewalks, but the roads are a little different. And you're putting new homes in there and you're not requiring, our code doesn't require all the way to the next main roads to be done when you have a substandard road.
That is my understanding. That's not my area of expertise, but it's my understanding.
Okay. Any, yes, Commissioner Justice.
Thank you, Mr. Chairman. So from current to proposed, we're basically going from 5 to potentially 11 units?
Correct. And if he built the 5 units that he's allowed to now, he would also still have to, improve that road. So either way, he would have to improve the road.
All right, any other questions? Okay, thank you for now. We may have you come back up here in a little bit. I have people speaking for. I'm assuming Robert Resch is here and is speaking for the property. Did you have any presentation you want to make, or Anthony Woods? I can't hear you, sir.
My client will present first, and I'll follow up with any other questions.
Okay, well, who's your, okay, come on up. I don't know, I don't have a, come on up. I don't have a card, so I need you to identify yourself.
Dushant Gulati.
And you are the owner?
Yes, sir.
Of the property? Okay.
Yes, sir.
Go ahead, you have a presentation, or?
Yes.
Okay.
You'll put the first page, and if you guys can pull this handout with the two flags, the blue and the, I will be speaking about that. Staff has done a wonderful job presenting the information about the property, and I have been speaking to the neighbors and collecting some of the information about what their concerns are. One neighbor had some issue with the drainage, and some neighbors who are adjoining to the lot are concerned about the proximity of the homes close to their property. But at the end of the day, the two issues, number 5 and 6, are the most important for today's meeting. And many other issues are personal. And if you can pull this handout, the first page, what are neighbors saying about this application? The number one is they are saying that this case is about lot sizes, not about home sizes. People purposely move to this area for lot sizes and tranquility. Number 3, 95% of existing neighborhood lots are larger lots of 12,000 to 20,000 square feet. That's their concern. The other one, these are some of the big ones which are relevant to my application. Nearly every past board of county commissioners, without exception, approved lots that were in excess of 12,000, with the majority of lots in excess of 16,000 square feet in our neighborhood. And I believe some of the form letters which have been received by you also say the same thing. The question for me was how to do a reality check of what they are saying. So what I did was I did an inventory of every lot in our neighborhood. I checked the zoning, the land use, the width, the depth, and the area for each lot. The 8 pages of that inventory are attached with the purple flag. I'm not going to go through them, but I will give the summary to you guys. My presentation will be about 5 to 6 minutes. It won't be that long. The next page, if you flip the next page, it will show the neighborhood map. As was mentioned by the staff, there is a mobile home park which has 129 lots. And the neighborhood area has a total of 256 lots. These lots are of varying size, and then there's a district school. So I made an inventory of every lot, which is for the single-family homes, as was platted at the time the lots were registered. These 256 lots, let's look at them from the zoning point of view, the lots which are in the unincorporated Pinellas County. So out of 256 lots, 61 of them are City of Largo. So remaining 195 lots, 2 of them is RR, and mine is the third one. So there's only 3 lots which are RR. There are 6 lots which are R1. There are 3 lots which are R2. And my request is from RR to R3, and 184 lots, that is 94% of the lots in this neighborhood are R3. So you can see that my request is very consistent with the zoning which is already in the neighborhood. Now let's look at the land use designation which is what most people are speaking about. Out of 256 lots, once again, 61 lots in the city of Largo, and there are 2 land use designations in this neighborhood, residential suburban and residential low, which is what I'm requesting. There are only 42 lots in this neighborhood which are residential suburban. The remaining 153 lots are all residential low. So majority of the lots in this neighborhood are already residential low, and that is in total conformity with my request. So my request, once again, is residential suburban to residential low in conformity with 78% of the lots in this neighborhood. And that's what, similar to what the countywide future land use map is, residential low and medium. And I believe there is right next to our property in this neighborhood is a condo, number of condos, 122 condos, and I did not include that as part of this one. Now let's look at all different types of lot sizes. What neighbors are saying that 95% of the lots are greater than 12 to 16,000 square feet. So on the next page, if you will see that's how many lots were platted on each one of those streets. And for your convenience, I divided them into 5 different categories. 6,000 to 9,000 square feet, 9,000 to 10,500 square feet. Then I cut off at 12,000 because neighbors were saying 95% of lots are more than 12,000 square feet. Then 12,000 to 15 and 15,000 plus. As you will see, consistent with the land use designation, 58% of the lots out of 256, now this one includes all the Largo lots as well. 58% of the lots, that is 148 lots out of 256, are between 6,000 and 9,000 square feet. 25 lots, 9,000 and 10,000 and a half. And what they are saying, when they are saying 95% of the lots are greater than 12 to as high as 20,000, that actual number when you do the inventory is 24%. Only 44 lots are greater than 15,500 square feet or more. And when you analyze this same situation based on number of homes, because there are 256 lots, some are vacant, there are 5 lots which are not part of this analysis, or where there is ponds or marshes, because we are next to the Allen Creek. And when you add 129 lots for the mobile home park, which are part of our neighborhood, the number of lots which are less than 9,000 square feet is almost 72% of the total lots. So this is what will show that my request is in total conformity of the application of our neighborhood. And I have further analyzed this. I'm not going to go through it to be able to show these our neighbors that on each street, all of these streets on the next page, how many lots are on different categories. So yes, there is a street, Doncaster Road has 16 lots, which are bigger, but majority of the lots, once again, are in the same range what I am requesting. And another thing which will come, the last thing I want to mention, another thing which will come before you today is because there's a 4.5 acre parcel right next to the parcel I am applying for. And neighbors are concerned they will be bringing that this, if you approve my application today, it will set a precedent for the next door, the lot which is next door, 4.5 acres. Even if you approve that later on, it does not change the percentages. Majority of conformity is still the same, and neighbors raised some questions about the next door lot, and I contacted an architect, who's a local architect. His office is about a mile from us, and he has in the last 10 days, in a short period of time, analyzed what the density would be, possible density would be in these 2 lots. So I'm going to introduce Robert Resch for the next presentation.
Can I speak here, or do I need to move over?
You're
or-
fine right there.
Okay. Good evening. The developer, my client, has invited me to come tonight and speak on his behalf. I think the staff has summarized a lot of their findings very well. He's presented more information than I could possibly in the short time I've been involved in the project. But I just wanted to basically point out a couple different items, just sticking points. Our lot size will indeed emulate what's across the street on Winchester. There's several, if not a half a dozen or so, within the short space across from our right-of-way, 60-foot lots on the east side of Winchester. So as far as consistency, in keeping with the neighborhood, I don't think we're trying to deviate from that. Actually, I think we're trying to fit with that. Also, another item that hasn't been discussed, my client will be performing a real estate analysis as far as trying to pinpoint the most marketable, the nicest opportunity for us to do homes in this area because it is heavily treed. So we will be utilizing a real estate analysis, a feasibility study, to demonstrate the larger versus medium-sized homes that we want to place on this property. My client will also be engaging a local civil engineer. We're going to insist on somebody here locally that's familiar with the area to do all of the site plan submission to Pinellas County moving forward to get our final approved site plan. Based on the minimum proposed lot dimensions, we're allowed to have a lot as wide as 60 feet. From east to west across this site, it's 290 feet total. If you're to divide that 60 into that, you can basically do 4 lots in width from running east-west along the south and the north, and that's without any setback, buffers, roadways, the heavily treed items, as we've discussed already. Just a quick look at it, quick glance was we could get as many possibly as 8 homes on this site before we look at doing larger homes and fewer of them. So there's no possible way that we can get 11 homes to meet the criteria as established by Pinellas County on this site. Although I know the density will allow for up to 11 homes, we're looking at somewhere approximately 8 homes total on that site. I'm not really representing the Summerford property that's to the west of us. I know that there's been opposition, a lot of resistance about this as a precedent for that property. We're not speaking for or against that property this evening, but because that property has an on-site retention area, which I would say is a saltwater brackish pond or lake, just at a first glance, again, the multiple issues, it's in a flood zone, so we have a base flood elevation we have to comply with, or the future person, whoever develops that property, will have to address that. The soils issues, there's so much bay bottom. We've done other projects in the immediate area. The soil is not going to be that fantastic anywhere near that water edge, so we're going to have to look at really reducing potential for development on that site away from the water location. And that's not even to say that we have mitigation to do in the Swiftmud area of that other parcel, which is not ours, as well as there's no secondary access for that number of homes. I'm sure Pinellas County Fire is going to want to have another way out of that property instead of just another long, deep cul-de-sac. So I don't know if that property really deserves as much attention when you look at my client's development this evening. This is a smaller site. It's just over 2 acres. It's a beautiful site. I figured I would go as a courtesy to one of my other clients and go meet with him last week. And when I went out to the site, I insisted that we be involved somehow at some level to do a beautiful job in this neighborhood. And I'm going to be available for any questions after the rebuttal.
Okay, thank you.
Any other questions for commissioners?
Any questions? Okay, thank you, Robert.
Oh, thank you. Thank you for your time.
Yep, and you'll have about 6 minutes left, you and the owner, if you have any other things you want to bring forward. 6 minutes and 44 seconds. We do have, could you just repeat real quickly what we had that came in? I just want to make sure I have that information.
Yeah, so in person, I had a Lori Nelson, and then I had 2 individuals by Zoom.
Yeah, okay. And then you also had people that called in or wrote in, or? there
Oh,
was-
for the numbers,
Yeah.
I apologize. I
Yeah. No, that's
misheard you.
okay. I wasn't clear.
I have 92 letters, 19 emails, 14 voicemail messages, and 1 petition with a total of 92 signatures in opposition.
Okay, thank you. And so then we have Leo Torres, and then Carrie Meeks, and then Lori Nelson. Is Leo Torres here?
I believe Mr. Torres is in the other room. I think he's speaking on behalf of a group.
Oh, yes, you're right. We have 4 other people, so I guess that gives him up to 10 minutes. I guess the second speaker, Carrie Meeks, also is speaking for a few people as well. Leo, welcome.
Thank you.
You'll have 10 minutes.
Okay, I'm obviously going to contradict everything that I think I understood. Everyone's been telling us that we're not going to win this case. Everyone's told us no way the commissioners are going to change or overturn a lower board's decision. We've been told the commissioners' hands are tied, and it's some state law that's written the commissioners can't overturn a board decision. I and the neighbors don't believe any of that. We've not been able to find any such law in the statutes or the Pinellas County Charter or any other public document. We operate under sunshine law, and we all, if all these statements were true, then what are we doing here tonight? The reason we lost 4-2 at the LPA hearing is we weren't prepared. We provided no evidence to support our cause. The LPA, we had a handful of citizens show up, and we simply vocalized our 3 minutes, and that was not enough to overturn the evidence submitted by the developer and the county staff. The developer had 3 months to correspond, coordinate, and organize and develop with the Department of Housing and Community Development, Pinellas County Planning and Zoning, Development Review Services, et cetera. The neighborhood got a letter in the mail about 2 weeks before the hearing, and so we just didn't present anything. The process did not allow for a commensurate response, and we were voted down. So tonight you're going to hear evidence that it's all documented and it's all in the public record. The first slide here just states that everything you're going to see in the next 20-something slides is public record. There's no opinion, no subjective. It's fact, and you can look it up. It can be verified. I'm going to blow through these because time is very limited. We're not trying to deny any property owner citizen their inherent and legal right to properly develop their purchased land. We all know that at one time this whole area was once nothing but pasture land and citrus groves. We all know that, we all know that over time developers and citizens requested from past Board of County Commissioners the right to properly develop, and were granted the right to properly develop in order to build all of our beautiful homes. We request that the BOC remain as consistent as past commissions in their assessment and in upholding the current laws to continue to recognize that successful neighborhoods are central to the quality of life in Pinellas County, and that infill development should be compatible with and support the integrity and viability of existing residential neighborhoods in the area. This is taken directly from the Pinellas County Comprehensive Plan. This is not a couple of neighbors, grouchy, filled with hate, which I saw Mr. Galati's presentation had about me. I don't know Mr. Galati. He doesn't know me. This is not even close. It's not 51-49, 60-40. This is 100% of every property owner in the area is opposed to this. Up there you see 90-something signatures. Could have had more. We only went out one weekend. We only went in a 3-block radius. People weren't home. We didn't take anybody who was a renter signature. So this case is about a solidarity and passion of the whole neighborhood to oppose changing the zoning. Today you'll hear many citizens' concerns about the diminished quality of life and safety issues. I'm going to kind of skip ahead here. Their concerns are in context with this case in which the developer is requesting to build double the amount of homes already approved. It's about lot sizes, not home sizes. He wants to plat 10 lots when he's already approved to plat 5 lots. If this case is approved, and I'll show you this in the next few slides, it would set a precedent that would defy 50 years of consistent BOC assessments regarding compatible lot sizes in this area. This is not a NIMBY issue. The guy can already develop. It's a intensity of density, I guess you want to call it. There we go. Intensity of density, compatibility, and is there going to be a precedent set tonight? I could have done 5 pages of this stuff in the public record regarding compatibility, land use in surrounding areas, compatible with adjacent land uses. The underlying part is recognizing that successful neighborhoods are central to the quality of life in Pinellas County. Redevelopment and urban landfill development should be compatible with and support the integrity and viability of existing residential neighborhoods. This is just a aerial photo, 51, obviously nothing. If you zoom back, there's nothing for miles, just. The next available photo is 1957. The reason I'm doing these photos is because these 2 neighborhoods now are the ones in question in this case specifically. The 2 oldest neighborhoods for miles around are the neighborhood, Lawton Drive is that street in the middle there, and then the perpendicular streets are the other side, which the developer kept comparing his proposed change compatible with. I'm going to show he's comparing 5 or 10% of the whole area to be compatible with what he's trying to develop, and in reality, he's not going to be compatible with probably 85 or 90%. Next available photo is 1965. You can see a started infill. By 1975, these 2 neighborhoods were pretty much, 80% filled. And the next slide is going to be a map. And these are maps provided by the county. This is the map that was attached to our notice. And you'll see that in 1965, before there was any development, significant development, there's odd sheds and homes here and there, but basically, if you zoom back from the previous picture, there's nothing for a mile in every direction outside this neighborhood. Everything north of East Bay, south of Nursery, east of Keene, west of US 19, there existed 2 basic prototype residential lot density models, for lack of a better term. I call them A and B in this case. A being the neighborhood I live in and where the lot parcel in question is surrounded by. B being the neighborhood he keeps comparing to in all his application and what he just stated. And the architect also. Both were located, let me skip around. Okay, let me go back. The point is, 50, 60 years ago, all prior commissions had 2 models to choose by. What were we going to develop this part of the county at? This next photo is 2021. As you can see, I'm just going to read this. This map provides empirical evidence of lot density, documenting consistent application of property development assessments over the past 50 to 60 years. This map notes that every past Pinellas Board of County Commission, Planning Zoning Department, Development Review Services, as well as citizens and developers nearly without exception, consistently requested and were approved to develop lots that were in excess of 12,000 square feet, with a majority in excess of 16,000 square feet. To his point, some lots in here, yeah, they're 8 or 10, but there's also lots that are 20, 30, and 40. So the 16,000 square feet is what he's already approved to build on the lot in question. It's a nice round number. That's why I use 16,000 square feet. Because if you look at this map, all the A's basically represent what's been approved the past 50 years. And that's why I'm saying it would be a precedent to, I'm just going to jump to the next. Okay. The previous slides you could see are kind of a macro view of why you'd be setting a precedent allowing this high density development in this low density neighborhood. You could call this slide more of a micro view. Winchester Boulevard is pretty much splits those 2 maps right down the middle, north and south. And he can already, if you look at the map to the left, I'm including the adjacent lot too, because that owner's 85 years old. He said he could sell any week. So the precedent said here, we will not be able to stop a next developer from doing the same thing. So that's why this precedent is so important to preserve the much bigger, twice as big lot that could be sold tomorrow, for all we know. And the owner has told me he gets calls, 30, 40 calls a week from developers all over the country that are waiting to see how this case turns out so they can change the zoning, so they can cram 17 homes in that lot, which right now he can already build 7 or 8, whatever. The example on the right is me drawing in. If you just look, okay, let's just take Winchester Boulevard. Forget the surrounding area. Everything west of Winchester Boulevard is large lot size, anywhere from 12 to 30,000. Everything east of Winchester is what he's using to compare all his presentation. The architect mentioned several times, we're just going to build lots commensurate with the existing neighborhood. Well, he's comparing 10%. And if you just take the neighborhood directly surrounding the lot in question, it's really 85% is the larger lots, and maybe what's actually touching his east end of the property is maybe 10%. So the point is, As far as the R3 stuff, from what I've been told, and I don't want to be held to this because I got this information, I have an email somewhere, you can change the zoning to R3 as long as the land use does not change and you keep it R suburban. So if you change, and don't hold me to this because I'm relying on an email I have from one of the planners. If you change the zoning to R3, then, okay, everything's R3. It's a beautiful thing. If you leave the land use change R suburban, then he's still limited to the 16,000 square foot lots that's already approved. So if there's any kind of compromise to be involved, and please don't hold me to this because I'm relying on an email, because I asked that specific question. I'm relying on an email from one of the planners saying that if they change to R3 but do not change the land use to residential low, then he's still limited to maybe 5 16,000 foot lots on that parcel. Okay, I know I skipped a lot. I'm available if you have any questions. My time is up, and I appreciate your time, and I thank you very much. Any questions before I go?
So your comments are mostly, it seems like R3 and the request is pretty normal in the area, but you're saying that what's existing there is different than what is allowed for.
What I'm saying is all through his presentation, his application, he conveniently leaves out facts like everything around him is R3, but it's R3 residential suburban. He's trying to compare with that one anomaly outlying neighborhood that's R3 residential low. The architect brought it up several times too. They're kind of misrepresenting the facts because everything from a half a mile to a mile out and including surrounding the 3 sides of his property west of Winchester is R3, but it's residential suburban. It's not residential low. And please don't hold me to that because I'm relying on an email. I mean, if there's any, we're just trying to keep our neighborhood, the viability and integrity of large lot homes, and that's basically it. A lot of people live there for 30, 40, 50 years.
Well, we'll have staff come back up and clarify. It just looks like on the zoning and land use information that we have that it's predominantly land use currently R3.
Right.
And it's currently zoned. Most of it on both underneath it and both sides are R3 as well.
Well, yeah, the zoning is not so critical as the land use. The land use is R3, but it's residential suburban, not residential low.
Okay.
I don't know. I mean, his
Okay.
slides did show that.
All right. Well, we'll get staff up here to clarify that. Okay.
All right.
Any questions? Okay. Thank you, Leo.
Thank you.
Appreciate it. And I've got Carrie Meeks, who's also speaking for four people, so she'll have 10 minutes as well. Yes.
Good evening. How are you guys doing today?
Hold on one second, please.
Yep.
Yes, did you have a question?
Might we have one of the staff come up and give us the definition of residential suburban?
Yeah, hold on one second.
Versus residential low,
Yeah.
so we're all operating off the same page.
Yeah, Glenn, there were some questions there about, anyway, Commissioner Long had a question for you.
Well, just a clarification, if you don't mind. Just a clarification, if you don't mind.
On land use,
Just so
where we
we're all
are-
on the same page, like, I keep hearing residential suburban versus
Right.
residential low, and for purposes of being able to determine which one we're talking about, I'd like to know from you what the definition of that is.
Residential suburban allows 2.5 units per acre. That's what he is now. Residential low allows 5 units per acre. That's what he's requesting. In the general area, residential low exists on the east side of Winchester Road, and on the north, west, and south side of the subject property right now is residential suburban. R3 is on 3 sides of the property and allows 6,000 square foot minimum lot sizes. And the RR is on the west and I think the northwest of the subject property. So basically changing the zoning to R3 and leaving the RS would give him no more development rights than he has now, because the RS would limit it to 5 units.
I think I'm looking at the maps here, and you've got the same map twice, or at least that's what I'm seeing.
It looks very similar because the colors of zoning and land use are very similar.
No, it doesn't say anything about residential suburban, residential low.
Right.
It just says RR and R3.
Right. If you could bring up the map.
Yeah, please. Thank you. Just want to make sure we're...
Okay. It's hard to see the difference because we have so many land uses, you know, on our land use map that they're small changes, gradations in color. You see the lighter color? This is a little darker, and that's a little lighter. This little lighter here is residential suburban. The slightly darker is residential low. So what corresponds with these colors here is the land use.
Okay, all right.
So again, it's residential low, or low over here, and there's some residential low up here as well, and down here. The residential suburban is a lighter color here, there's some here, and there's some up here. And
So there's
this.
a lot more homes.
And the darker one there is residential multifamily, or residential medium, which allows 15 units per acre. That's an apartment complex.
Okay.
And of course, the white is the city of Largo, so we don't have zoning information or land use information on this map.
Got it. Thank you.
Okay, thanks. Did you have anything else?
No,
Okay.
I just wanted to see it yeah, that's great. Thank you very much.
You're welcome.
Okay, Carrie, come on back up. And that wasn't any of your time, I promise.
Okay. I'm Carrie Meeks. I'm actually next door to the property that is in question. I'm going to continue the presentation that Leo has started, but I also want to mention that in the neighborhood, a lot of concerns are brought up. You know, besides the zoning, when he talked about we didn't really have time to prepare, one thing that kind of questioned our mind was the proper studies done around there. Proper studies done for traffic and, you know, the environmental, the stuff that was completely, you know, we've got a lot of environmental from coyotes to Allen's Creek to the birds and hawks. So there's just some of those things that we were questioning if it was properly done before this. If you can bring up the presentation. Yes. While she brings that up, one of my main concerns too for me that I was going to throw in at the end is the environmental. Allen's Creek runs into the Tampa Bay. The more houses, the more people you add in that area, the more likely we could see pollution and sewer. I just want to make sure it's done properly. It's something I always consider, especially with it being on the news lately, you know, all that stuff that's draining out there. So that's something that's one of my concerns with the nature that we have. You know, a lot of families are working remote. So I'm going to go back one. Another thing that is happening, this area is being developed all over from 19 to all the townhomes to the apartment complex. So Belcher Elementary School is right down the street from that, and it's approaching the full capacity. There are currently 111 more students living in the Belcher school zone. That's 793 than the allotted school capacity of 682. So it's something we need to take into consideration as we can continue to develop it. What is it going to look like for the school system there as well? Next. Off of Doncaster Road, there is a rehab little center, Creek Under the Sun. So if you drove down, if anybody visit and saw Winchester Road, the little horse and buggy sign that we make fun of, they do go through some therapy and take people for rides under there. Some of these are the misstatements we want to clarify as a community. That was said under the application of that. So the next couple of slides are just some misstatements we want to correct on the behalf of some of the residentials. First of all, this is a huge one for some of the people who live on Dorchester and Winchester. The applicant did say that residents do not use Winchester Road for access. As you can see, there are driveways and garages. So there's 3 main driveways off of Winchester right near that property. If we have to widen the road and block it, it would block their interest from parking, access to their garage. I'm actually one of the homes, I don't own that nice boat, but I'm one of the homes that it would, traffic would impact. We kind of already went over this, so I'm not going to harp on this. This is the local versus suburban, the zoning coloring. So I'm just going to pass that for you all. and more back on the low density versus the suburban area. So there, I'll just save you guys time for that. Something else that was misstated, they were concerned about the safety of the Winchester Road. It looks like an alleyway. So these vehicles were presented to the plan of local boards, but these are actually not true. These aren't abandoned cars. The truck is maintained on a property itself. It's not even in the alleyway or on Winchester Road. It is in somebody's property. It is registered and licensed along with the other antique cars you see here. Other information is we don't think a proper traffic study was done of any of the road closed. Lancaster and Winchester Road, I believe Lancaster is the main one, or the main ones, but there are, Lawton Road is a private road, so we can't consider Lawton Road to be it. The residents own that. Is not a public road. That's why there was a private sign on there. And then you have Bel Air and Belcher, so we just are concerned that for the traffic studies that weren't, are they performed properly to get that number of, 58 additional traffics. Like I said, the neighborhood's not denying Mr. Galletti to build those 5 houses that he can currently do. We're just trying to prevent the more capacity and that, like he said, the precedents, we're just trying to prevent it to keep it a lot lower. I think I got that one. Okay. The property owner purchased the lot for $225K in 2019. And the property owner estimated to receive a profit. We know other people have asked to buy this off of him. He is actually looking, to increase his funds, and I'm not, against anybody making money or anything, but he wants to come up with compromises. He has met with the neighborhood to say, how can we compromise? We keep telling him just build as is. Here's our concerns. I know that's more for the developmental of the environment, but we have met with him. We have tried. I don't think he has any, he wants to address some of them, but I think, the compromise to the whole thing is let's stay where we're at with the 4 to 5 houses. This one I think is a very important slide too. So here is kind of like a view of the area. So the houses on the left are what you would you'll see in the neighborhood. If you drive down that suburban area, those are the houses you're going to see. It's got property, you got trees, and the property that was developed in Largo, not by Mr. Galletti, the property in Largo, they're so close to each other. There's no, the vibe is completely different, and it's just a block away, and we're trying to prevent that from coming in and ruining that resident and family home vibe. Another concerns, but like I said, I mentioned was, are we doing the proper studies? A lot of people take their kids out. We walk the neighborhoods. We're a very good neighborhood. Light traffic is another concern. It's a nice, quiet area to do telescoping and some of the fun activities that we do as a family. There's people's concerns that he might build 2-story houses in there. That has been brought up. Dorchester's road face, all their back of the houses. I don't know if you want somebody on the front road looking into the back of your houses. So those are some of the concerns. Again, I understand that is more of a developmental concern, but this is some of the reasons we're trying not to impact that area with multiple, over the 4 to 5 houses he can have now. The more you put in there, the less you have to work with. But I thank you for your time. I know this is a lot of us, but I really appreciate listening to us. So thank you.
Thank you. Appreciate that. Carrie, and I have Lori Nelson is the only other speaker that I have. Lori Nelson.
Excuse me, I just want to make sure I'm a speaker as well, but I'm not Lori.
What's that?
I'm a speaker as well, but I'm not Lori, so
Oh.
I just want to make sure you have me.
Apparently I don't, so come on up and introduce yourself. And
I don't want to, I just want to make sure you don't.
well, I don't see Lori Nelson's not here, so you come up and then you can fill out a card. I don't have. Oh, you brought me the card. That's right. Right here.
I just wanted to come see you.
Yeah. Well, thank you, Jessica, right?
Yes, that's me.
Yes, everybody, they brought all the other cards to me. You're the only one that brought it directly, so go ahead. Go ahead.
I'm Jessica Jurek. I live at 2232 Lawton Drive, so my home basically backs up to the southeast corner of the property,
In other words, when I go into my backyard, whatever's built back there is what I'm going to see. It's the neighboring homes that are being built. So my home and then the two next to me are backing up to this property. I'm not against a build, but as a realtor and as a neighborhood person, I'm not used to seeing multiple homes built in a backyard. So my lot and the two neighboring lots are 92 feet wide. So if we build homes that are 60 feet, we're going to have basically two neighbors backing up to our backyard. So it's just not something you normally see. It's not conforming to what we typically would see. So it's just a little bit concerning knowing that I might have two homes facing. So I might, instead of having just one normal neighbor, I would have two. That's one of my main concerns. And speaking with an architect, it sounded like if you kept those same lot sizes, you could only really get 5, possibly 6 homes in there anyway. So I'm against the land use change simply because I feel like what he can already build in there is conforming to what's already backing up to the property. Another concern that I have, drainage, which I've already talked to Mr. Galati. He's been very nice listening to my concerns. He's been very good listening to me and everything. And right now we have some puddling already, and we know that impact is supposed to be taken into consideration when they do the build. We're just concerned if there's already flooding not approaching our property. It's on the line and in the yard. It's not affecting our home now. But down the road, once the build is done, if we see a difference, what would we do at that point? We're just kind of concerned. Would we come to the county? Do we go to the developer? I don't know if that's something you can answer for me or if that's something we just have to play out.
Well, we'll have staff answer that for you.
All right. But those are my main concerns. I just want to make sure that if I do have a back neighbor, it's just one back neighbor and I'm not looking at multiple homes in my yard, and
Yeah.
just want to make it feel like a conforming neighborhood.
Okay, thank you.
Thank you.
I don't have anybody else. I don't think anybody else brought me one. Glenn, could you come back up just a minute, please? Okay, so you heard some of the questions. Just if maybe you could address those after the fact issues. This is a development that, well, purportedly could be up to 11, but the architects testified probably no more than 8. Is that large enough to require on-site retention?
Yes.
Okay.
Yes.
So, so that in theory keeps all of the runoff.
He would have to put retention in place with the current 5 that he could get, or, of course, with more than that as well. And he'd have to maintain any historic drainage going over the property would have to still be maintained on that property. So if anything, it would get better, because it's definitely going to be reviewed at site plan.
Okay. This is where I get myself in trouble about doing site plan stuff, because I'm so used to it from my former world. But so the request is for up to 11 sites with the...
That's possible per the acreage he has.
Per the acreage. Right. The architect testified probably only 8. What they currently are allowed is 5.
Correct.
Right? So there's no way to limit to 8, period.
Not unless he changed the application to include a conditional overlay or a development agreement.
That would definitively limit it to 8.
You could limit it to 8 that way, correct. So between the residential suburban, which is 2.5, and a residential low, which is 5, there's nothing in between those two.
I got you. Okay. So does anybody else have any questions for Glenn? Yes, Commissioner Flowers.
Was there a traffic impact study done?
Staff looks at that for all land use cases, so the applicant is not required to do so per code, and this is such a small impact, it's just not seen as necessary.
So it's considered negligible, even though there is a school, which I appreciate the comments that the young lady was making regarding a school, but whenever, just for FYI, whenever there's an overflow and a school exceeds its capacity, then rezoning takes place because the state statute requires that schools have a certain ratio of students to teachers. So I do appreciate her sharing that, but that wouldn't have a direct effect on the traffic patterns, increasing traffic for the community. That's why I was asking you if a traffic study had been done for this particular community.
No, it's just a staff level research, little numbers we crunch, and it came up to 58, and that's with a maximum 11. If we did 8, it'd be less, basically half of that.
Okay. And Commissioner Seal talked about the sign that she saw that said private property. One of the presenters, you stated that that was not a private road, that it was a public road. One of the presenters countered with, this is a private road and it belongs to, so are we talking about two different?
It's two different streets. There's a private road to the south that connects Belcher to Winchester called Lawton.
Okay.
It's not even labeled there. It's right here. And you can't see it because the individual lots go to the center line of that road because it is a private road. But you can't even hardly see it. It's right here.
Would there, if there's going to be a requirement for on-site retention, wouldn't that significantly reduce the number of units you could construct in order to accommodate room for the retention?
That's one of the main reasons why they can't get 11, probably can't get 11 on that property, because you have to have space for retention ponds that would take up a lot or two. Also, the driveways and access ways, things like that, takes up space. So
Right.
that's why 11 is probably not feasible.
So 5 is what they would be zoned for right now.
Correct.
The change in the future land use will allow them up to potentially 8, 3 more housing units than what they currently have the ability.
Right. On paper, it would raise it to 11. However, in reality, because of the drainage and the access ways, the architect has testified that 8 would be it.
Well, you know they could build up and not out. That's what a lot of people are doing. In order to get the density that they want, they're building up and
Right.
3-story homes instead of
And
out.
the maximum height is the same in RR and
The maximum
R3.
height
Would not change,
Okay.
which is 35 feet.
Is there anything related to conforming neighborhood descriptions? What I mean by that is some communities, and forgive me because I'm learning more about the county, and how it does, but some communities have those conforming neighborhood descriptions, not like a gated community or anything where you have to get permission to paint your house and all of that, but there's the expectation that the lots would be conforming and contiguous in size. I guess what I'm hearing from the opposition is these are homes on a little larger scale. What the developer would be presenting would get to building additional homes on a smaller scale based on what's currently there. Is
Right.
there anything for this community that you may have seen in your documents or whatever that would lend to limiting the size of homes that could be built there, other than to change this land use?
Right. No, there's nothing like that, other than the development agreement.
Okay. And then I just want to make this comment, Mr. Chair, and then I'll be done. I did hear the comments about, and I understand how you all feel about the amount that the lots may have been purchased for versus the amount that the person would gain, but that's not something that I know I could use or should use when determining whether or not I'm going to support or not support what's being recommended. Unfortunately, that's what capitalism is. There's a way for you to make a gain on something that you purchase. So I just wanted to share that. I'm aware of that. It happens all over, and prices of lots and land and houses is just through the roof in some instances. But that's not something that I would utilize as how I would make my decision today based on whether or not the gentleman would receive a nominal or sub amount of return on investment. Thank you, Mr. Chair.
Commissioner Seal?
When we get through, I'd like to be recognized first, if I may, but a picture is worth 1,000 words in this particular case, and the neighborhood is not necessarily developed as the land use and the zoning. It's an entire mixture. And so across the street from this property, it's not really developed as R3 for the most part, even though it's zoned that way. So it's not what was built there. So I'll expound on that more later, but I did want to point that out. Thank you.
Okay. Any other questions? Yes, Commissioner Justice.
Thank you, Mr. Chairman. And maybe this is for our attorney, but we had talked about bifurcating the land use and the zoning on these issues. Where are we at in that decision process?
You do have a case coming up about 1 month from now where you will see that for the first time, really, here at this board. It's a case that involves land use, zoning, development master plan, development agreement, quite a number of things. What you'll be seeing initially is the land use, because it's a large, the land involved is large enough that there would be 2 hearings. So you'll be seeing just the first hearing. Staff has not moved forward on doing that bifurcation on anything other than that one project. And really, I will say that part of the reason why we moved forward on that particular case is because of COVID and concerns about the room being packed with a number of people, because keep in mind, we set up this schedule many months ago on the one case in particular. But aside from that one and the concerns over an overwhelming number of people in the room, we have not moved forward with bifurcating these two, the land use from the zoning.
Okay. Any other questions for Glenn? Yes, Commissioner Gerard.
Looking at the applicant's package here with the list of all the addresses and the streets and all that, where would I find those street names? Obviously, they're not on there. They're not on his map. Where on earth are these streets? Because I don't see them. I mean, are there streets there? Obviously, there are streets there that don't appear on a map, on your land use map. But do we have something that shows where all these lots are? No?
Not prepared, no.
Okay.
Not based on the applicant's submittal.
Well, I mean, understandably, but I'm struggling with this.
Okay. Did you have anything else?
No.
I can ask the applicant has how much time, Commissioner? 6:44, okay. Did you have anything you wanted to add? The applicant, you still have 6 minutes, 6 minutes and 44 seconds if you want to add anything.
So about the roads, they are within this, if they can bring the slide back, I can show you the roads.
Yeah, could you bring that slide back that was just up there? You said just 1 minute.
Sure. So if we start where the red lot, my lot is, the street next to that is Winchester Road. If we're move east, the street, after that, the next street is Dorchester Road. Then in between is Albemarle, and then there's the Lancaster Road. And then on the Lawton Drive is just going a little bit down the street which he was talking about. I don't know if there's a way to show this here or not. So Lawton Drive is the next street because it's owned by the residents. That's why their lot size actually includes the road. And the next to the Lawton Drive is the Lancaster Drive, where the school goes. And in between, there are 2 or 3 small yellows. That's Juanita and Lawrence Court. And then above, there's a Barbara and Beverly are the yellow above in the R low area. And then the white with the loop is the Belcherico Drive where I live. Just below that, another loop, the cul-de-sac, is the Alice Lane. So all these streets are within 400 yards of the property. So I did not go expand way outside so then we are crossed by the Belcher Road on one side and Bel Air and Belcher Road you can see. So these are all the streets with our neighborhood streets. And they were clear on my copy, but maybe when copying time, there was some loss there.
Can you leave that map up? Can we leave that up for just a second?
Sure.
So he will go first, and I'll answer some questions.
Yeah, and just briefly, and thank you for your time again this evening. I know this is getting a timely review. As far as a precedent, the neighborhood speakers had talked about setting a precedent. There's only 3 lots that are remaining that are the RR zoning. If you look on that map, we're only the 3 remaining properties that even have that designation. There's so many surrounding properties of that darker yellow. We're going to be one of the few that are remaining. So I just wanted to clarify that the precedent's already been set. We're just trying to find a good fit for this neighborhood, and so we can do a nice project and pay for a brand-new roadway and all the other stormwater and other concerns and difficulties that are currently in that location. Secondly, traffic. One thing that we really haven't stressed, and that is coming into a centralized, call it a cul-de-sac with one arterial entrance in off of Winchester. We're looking to not have 5 or so, we can do 5 currently. We could back out onto Winchester and have 4 or 5 driveways that would constantly be backing in and out of that smaller road. What we're trying to do is we're trying to centralize the traffic so there's only one point in and one point out, so we don't adversely affect all of the adjacent neighbors. We're trying to do something nice. It's going to be a little more expensive to build the road within our property with lighting and everything else. But we acknowledge that, and we're trying to do that to improve that neighborhood traffic. Lastly, as staff did point out, we are allowed to construct up to 35 feet currently. Our proposal is the same. We're going to be respectful of the neighbors that are already there. We've already met with one group of neighbors on Friday, and I was involved in that briefly. But our goal is to really make this an attractive development and not try to, push our weight around in the neighborhood at all. We want to fit in as much as possible. Thank you.
Thank you. Did you all have anything else?
Most of the issues brought by the neighbors are personal issues in terms of location or proximity. The traffic, I actually offered the neighborhood that if you want to do a full traffic study of whether it be 58 additional trips, or they declined it because it really is a small number. And that 58 trips are divided into three roads: Lawton Drive, Kersey Road, and Lancaster Road. And their road will be the minimum use because the right turn is Kersey Road, left turn is on Lancaster Road, which has the light.
The 58 traffic, that's for 11 units?
That would be if the 11 units, yes.
Right. So the 5 are allowed.
Right.
Under
Yeah,
the current
5 are
zoning.
allowed.
So there's only about probably half that.
Half
is the
that.
incremental additional.
And then there is no way to fit 11 homes there.
Yeah, I
No,
understand.
no
So my question, I guess, was on the conditional overlay of limiting it to 8, you guys wouldn't have a problem with that? Doesn't sound like.
No.
Yeah. Okay. Anything else? Because you have a minute left on your presentation. Anything? And anybody else have any questions for the owner?
I just want to reemphasize that the conformity as presented by the staff is really in the math. I presented to you the math, which shows that majority of the homes within the 400 yards of that property, which is not extending it too far, and then the area, the map I use is a map the neighbors have been using. It's 94% in terms of R3, 72% in terms of residential low.
Okay, thank you.
Thank you.
I don't see any other questions.
Thank you.
Yep. Commissioner Seal?
Again, I just want to point out, in the presentation when, I don't have any questions for the developer.
Okay, we're finished. Thank you.
Thank you for your time.
So Winchester Road is kind of the dividing piece. So on the left side is more the residential suburban and the bigger lots. And so on the east side where it's zoned R3, like I said, not everything is developed as an R3. So there's some bigger lots there too, even though it's zoned in a different manner. So I just don't think it's compatible, given looking at the property and looking at the surrounding other properties, to grant this rezoning and land use change. So again, going out there and really seeing the property, seeing Winchester Road and how it, works within the neighborhood. I mean, you would really have to develop the entire road, build it as a regular road, and it just doesn't, it's not really, again, it's a very interesting neighborhood surrounding it, and that's what's kind of dictating why I would recommend denial, and that is my motion.
Okay, so, but incrementally, some of the comments you made will exist whether we go 5 units or 8 units
Correct.
or 11 units. So,
Correct.
I mean, just want to make sure that.
But the 5 units would be more compatible with the surrounding lot sizes to the west of it.
Okay, thank you. So there's a motion for denial by Commissioner Seal and a second by Commissioner Flowers. Are there any other questions? No other questions? So all in favor of the motion to deny, say aye.
Aye.
Anybody opposed to the motion? Aye. So one is opposed. I wanted to do an overlay to compromise between it, but I understand. And I think we have 5 supporting the motion to deny. So that's the vote, 5-1. The motion is denied. Thank you. All right, moving on to item 38.
Thank you, Mr. Chair. Just to clarify the record for agenda item number 37, I did have 2 people had pre-registered online by Zoom, but they were not here, so I did not interject during that portion, but they did not appear by Zoom. So it was Pete Farrington and Doug Lardnier.
Thank you.
So agenda item number 38 is another quasi-judicial hearing. This is case number Z-LU-21-01. This is the first of 2 public hearings. It is an application of the Noel Family LLC for a zoning change from RA Residential Agriculture and R3 Single Family Residential to R5 CO, which is Urban Residential Conditional Overlay, and PC, which is Preservation Conservation. And then there's also a land use change from residential suburban and preservation to residential low and preservation with a conditional overlay. It limits the number of residential units to either 70 one-story villas or 78 two-story townhomes. Since this is a quasi-judicial hearing, any member of the public who wishes to speak on this item must be sworn in. So for those of you who are wishing to speak, whether you are attending, well, I guess we only have people who are attending in person, so if you're attending in person, no matter which room you're in, if able, please raise your right hand. And do you swear or affirm that the testimony you are about to give is the truth, the whole truth, and nothing but the truth? If so, say, I do. So the public hearing was properly advertised. An affidavit of publication has been received for filing. 2 letters, 11 emails, and 2 petitions with a total of 2,373 signatures in opposition have been received. The matter is properly before the board to be heard.
Okay, thank you. I guess, come on up and we'll get a presentation.
Mr. Chairman?
Yes.
Before we get into the meat of the, can someone, whether it's Michael or attorney, explain the 2-step process, that this is the first hearing? Just explain that process for us.
I can't hear him.
Can't hear. For some reason it's not on.
Can you hear me?
Go ahead.
Yep, Michael Schoderbach with Housing Community Development Department. This is a request for a rezoning and a land use, and because of the acreage, the land use would require, this would be, if approved, the transmittal hearing to the state. It's considered a large-scale amendment. So if the land use was approved tonight, the ordinance would get transmitted to the state. The state agencies would review it, provide comments back, and then it would be scheduled for a second public hearing.
So all would, go ahead.
Yeah, so it would come back to the commission for, if we vote in favor of it tonight, goes through the state process you described, and then comes back to this commission for a final vote to review the state comments?
Yes.
Okay, thank you.
So are we just addressing the land use then tonight?
No, this has both the land use and zoning. The zoning has the resolution.
Okay.
And if approved, the resolution would be contingent upon the land use approval.
Okay.
The ordinance. Correct, Jewel?
All right,
That's correct.
okay, thank you. Go ahead.
So this property is approximately 21 and a half acres. It consists of 4 vacant parcels in Palm Harbor. It's a future land use amendment request from residential suburban, which allows 2.5 units an acre in preservation, to residential low, which allows 5 units an acre and preservation, and a zoning atlas amendment from RA residential agriculture and R3 single-family residential to R5 CO, which is urban residential with a conditional overlay, and preservation conservation. Proposed use is a single-family attached subdivision with the conditional overlay limiting the density and the use to either a 70-unit, 1-story villas or 78-unit, 2-story townhomes. You can see the property here outlined in red. There's actually 2 boxes. The smaller one on the north, that's zoned R3. The remainder, the 3 parcels, the larger piece are zoned RA, with the entire property has the RS land use. It is located southeast of the intersection of Alternate 19 and Klosterman Road. It's at the southern terminus of Pleasant Avenue. Property is vacant. Surrounding the property on the north side is varying single-family residences, is up in this kind of triangle spot. Pleasant Avenue runs in with Valley Street and Roberts Road. This is all developed with various single-family lots in here. To the east and south is the Innisbrook Golf Course. To the southwest is a small vacant residential parcel. Running along the west side of the property is the Pinellas Trail, which runs north to south. And then west of the Pinellas Trail, fronting US Alternate 19, is the Suncoast Primate Sanctuary. And directly north of that, a small little L-shaped building consists of automotive uses. If you look at the surrounding area, if you go around the larger area, there is, again, mostly single-family adjacent to the property. There's some multifamily residential in the Innisbrook development. Across Alternate 19, there's apartment complexes, townhouses, condos, and single-family detached. And then along the corridor of Alternate 19, a mixture of commercial, office, and industrial uses. So on the left is the current zoning and future land use, and on the right is the proposed. I'll start off with the land use. So the whole property is residential suburban. The adjacent properties to the north in that neighborhood are all residential suburban. Across the street, that of Alternate 19 to the west is mostly residential low, and then there's some residential medium, residential low, medium, so higher densities over there, and then higher density further to the northeast. The green on the property is the preservation. Currently, it's kind of in the middle there with that block-shaped. The applicant has done a wetland jurisdictional survey, so it looks a whole lot different on the proposed map, and that is representative of the wetland jurisdictional line of where actual preservation areas are on the property. So the proposal includes land use and zoning. So the land use of the preservation, They're also proposing a zoning preservation conservation, further conserve that area. The adjacent properties, as you can see on three sides, are rec open space with the golf course and the Pinellas Trail. Here's just a closer aerial view of the property, which is vacant. And just another angle looking at that. This is looking south at the subject site from Pleasant Avenue, and it terminates here at the property. Other picture is another view of the subject site. It's heavily wooded. The picture on the left is looking west towards alternate 19 from the intersection of Valley Road and Pleasant Avenue. The subject property would be to the left. And then the picture on the right is looking north from the subject site, right there at the terminus of Pleasant Avenue. Since this involves multiple land uses and zonings, I provided this table to give you an idea of the acreage. So the first three rows are the land use change showing the existing acreage and the proposed. With the proposal, the preservation's acreage would increase by a little over an acre. Upland acres would decrease by an acre as well. And then the zoning, showing the zoning categories on the bottom, with the upland acreage of the R5 conforming with the RL, and the preservation, conservation with the preservation. The R5 district promotes flexible site design, allows for smaller minimum lot sizes and required setbacks, which is ideal for a flexible subdivision development. The conditional overlay that they're proposing will limit this to either 71-story villas or 78 two-story townhomes. Without the conditional overlay, 82 residential units would be the maximum permitted. There are potential traffic impacts on this. Alternate 19 is a deficient roadway. The two roads that have level of service that this site would impact are alternate 19 and Klosterman Road. Klosterman is operating at an acceptable level of service. Based on the change from residential suburban to residential low, could generate up to 49 additional daily trips with the proposed density. Not a traffic study has been submitted by the applicant there. It's a traffic count. This didn't trip the requirement for a formal traffic study. That's something that's looked at the site plan level, that if it was to trip 50 or more peak hour trips, they would have to do a transportation management plan, which would then look at the surrounding area, improvements to roads, decrease in density, further access to bicycle, sidewalk facilities. There's a whole list of things they could do. Staff finds proposed amendments appropriate. Surrounding areas, a mix of residential, commercial, and recreation.
A question?
Yeah, a question, hold on,
Sure.
question.
I'm sorry, back on that previous, just so
Sure.
I understand, the 82 residential units, that's under the current?
No, that would be under the proposed without the conditional overlay limiting the density.
And what's the current allowable?
Current allowable is, grab that here, I think it is 42, but let me make sure I give you the correct number. With the current land use is 47 units. It would require a rezoning to hit that maximum number. With the current land use and zoning, 12 units as it sits today.
Thank you.
You're welcome. So we find that it's appropriate surrounding areas, mix of residential, commercial, and recreation. This property is bordered on three sides by rec open space, the Pinellas Trail, and the Innisbrook Golf Course. We find the Pinellas Trail, which is 120 feet wide, at this edge of this property is a significant buffer that's adjacent to the non-residential uses to the west. And we find this is consistent with the comp plan and the countywide plan. This would not require a countywide plan amendment. The entire area is already designated RLM on the countywide plan, which allows up to 10 units an acre. So staff recommends approval. The LPA recommended approval 5-1. Again, this is a large-scale amendment, so this is the first of possibly 2 required public hearings. And I'll answer any questions you have.
Any questions on the property? So this 70 units or 82 units with the change?
70 or 78 with the conditional overlay.
Right, without it, 82.
82 without.
And then just with the land use as it's currently asked for, but a new zoning would get you to 47 units, and then current land use and zoning would allow for 12.
That's correct.
And the neighborhood that this would go through,
Yes.
describe that a little bit. I mean, I drove through that today through the neighborhood to get a feel for the lot sizes there and the types of homes and
Sure.
I would consider substandard roads, but go ahead.
Yeah, Pleasant Avenue is a substandard road, so I'll put this slide up, kind of gives you can see most of the homes there. There's the zoning in the neighborhood directly north. I came up with there's 34 units out there, so 34 houses in that kind of triangle area. And R3 zoning, RR zoning, and RA zoning are in that area. Majority of them are R3. They're anywhere from 5,000 square foot platted lots up to almost 2 acres in size.
How many units did you say? 40?
34.
34 units.
Yes, the property just kind of to the northeast, you saw that a few months ago rezoned from RA to RR. So there's a few properties in there that are RR, some of them are RA, some of them are R3. They're all single-family developments, with the exception of the property right next to it. I believe there's this multi-units on that property.
So again, it comes out, just the exit points would be Alt 19, which is rated F.
Yes, sir.
And Klosterman, how close to the intersection is that? I didn't go out that way.
So let me back up, see if I can get another. So Pleasant Avenue, where the property comes out, up to Valley Road to alternate 19 is about a third of a mile or less, or actually less than that. Up to Klosterman, it's about a quarter mile. If you go straight up Pleasant, it intersects with Roberts Road and exits out on the Klosterman. Or you could come up and take a left to Valley, and you'd come out to alternate 19.
So you're going to put 200% more homes in that area than they currently have now?
It would be double, yeah.
Yeah, 200% more. And that, how close to the intersection of Alt 19 are you when you come out on Klosterman?
The distance from here to here, I'm not sure what that.
No, up at Klosterman.
Up at Klosterman?
Yeah.
It's right up here. And it would be it's a right in, right out. There's raised median in that area.
Okay.
So
you can only go out to the right. People can come in? From the
west.
And the
or
east?
Exit out to the east.
What about coming in from the east?
Coming in the east, they could not turn onto Roberts Road.
So you're talking U-turns?
So you would either, if you could U-turn at that intersection or turn down alternate 19 and come in Valley.
And then turn left across the traffic there to come in? Okay. Okay. Any other questions? Okay, thank you.
Thank you.
I'm sure we'll be back to you in a little bit.
Sure.
And the applicant, yep, come on up. Robert, good to see you.
Good to see you, Commissioners. Good evening. My name's Robert Pergolizzi. I'm an AICP planner with Gulf Coast Consulting, 13825 Icott Boulevard, Suite 605 in Clearwater. With me tonight are representatives from D.R. Horton, Michael Yates, a traffic engineer with Palm Traffic, Carrie Kelly with Flatwoods Consulting, environmental consultants, my partner Sean Cashin, professional engineer, and the Knoll family attorney, Matt Marquardt. Michael did a great job in explaining our proposal. The land use plan amendment from RSNP to RLNP with rezoning from RA and R3 to R5 with a conditional overlay. We feel that the conditional overlay for fee simple owned attached dwellings, either villas or townhomes, will upgrade the area. Through discussions with staff, we understand that the preservation area is designated inaccurately mapped on the future land use map, and we would be correcting through a map change with this application based on a verified wetland survey. As Michael explained, to the north are single-family homes with R3 zoning on Valley Road and Pleasant Avenue. Commissioner Eggers, as you noted, those are small lots. They contain modest homes. To our south and east is the Innisbrook Golf Course, which is RPD. And to the west, immediately west of the site, is the Fred Marquis Pinellas Trail. It is a 120-foot wide right-of-way, which serves as a buffer for the properties to the west. There are several businesses between the trail and Alternate 19, which include the Suncoast Primate Sanctuary, storage, auto repair, and contractors' offices. On the west side of Alternate 19 are mixed uses, including Cove Springs condominiums, Harbor Ridge townhomes, and medical offices, and those uses have RM, RLM, and CG land use, respectively. In our opinion, the rezoning to R5 for single-family villas or townhomes is compatible with the large majority of properties in the immediate area, which include many townhomes. We believe it would serve as a transition from the E2 zoning that is on our west between the trail and Alternate 19 and the RPD golf course that is Innisbrook. As Michael stated, a countywide land use plan, the subject site has RLM land use, which allows up to 10 units per acre, and therefore this plan amendment from RS to RL is compatible with the countywide plan, and a countywide plan amendment would not be necessary. I believe that's a tier 1 with Forward Pinellas. Regarding the future land use map change, as Michael noted, based on the wetland survey, the actual preservation area is being increased from 4.9 acres to 6.3. Wetlands exist on the southwestern and southeastern and eastern portions of the site. Field evaluation by Flatwoods Consulting and SwiftMud in December of 2020 confirmed the preservation area. Therefore, the P designation should be modified to be fully consistent with the actual wetland limits shown on the wetland survey approved by SwiftMud. As Michael stated, with the proposed land use plan amendment, the theoretical maximum is 82 dwelling units. The zoning with the conditional overlay, R5 for one-story attached villas or two-story attached townhomes. The wetland portion of the site would be rezoned preservation conservation as recommended by your staff. Proposing a conditional overlay places some additional regulations on the property. Specifically, the conditional overlay limits the density to 70 villas or 78 townhomes. You've seen the concept plans we've provided, and we're showing avoidance of the wetlands, introduction of upland buffers, conceptual drainage retention areas, and an internal public roadway system that meets Pinellas County local road standards. The dwelling units are substantially buffered from the adjacent development by wetland areas and buffers and the Fred Marquis Pinellas Trail and proposed retention ponds. Regarding utilities, water and sewer are available to this property and are provided by Pinellas County Utilities. We would need to extend water and sewer lines from Valley Road down Pleasant Avenue into the site. The transportation impacts, Michael Yates has prepared a transportation assessment, 549 daily trips, 47 peak hour trips, and Michael will speak to any transportation questions you have. Regarding flood zone and wetlands, the site lies primarily within flood zone X. The south and eastern portions of the site are within flood zone AE, base flood elevation of 10. Therefore, we need to elevate the homes up to 11, any homes that are actually in that area. And the existing wetlands within the site will be avoided and upland buffers will be provided. So in conclusion, we feel that the land use plan amendment and the rezoning are consistent with the countywide land use plan, compatible with adjacent development, and the development of the property with single-family attached homes, twin villas or townhomes, would not adversely affect nearby properties, which are also developed primarily with residential homes. In summary, your staff recommended approval, the LPA recommended approval, and we ask for your approval to transmit this tonight. Thank you. I'll have Chad Whaley with D.R. Horton say a few words next.
Okay.
And we're here to answer any questions you have.
Commissioners, my name is Chad Whaley. I am an employee of D.R. Horton. I handle D.R. Horton's land acquisition in Pinellas County. I'm also a resident of Pinellas County. I live pretty much a mile due east as the crow flies in the Tarpon Ridge Townhomes. So very, very familiar with the area. Want to just make a quick intro about what I'm doing when I come into a community and looking for a site. When a site's introduced to me, especially here in Pinellas, obviously the first thing I do is look around surrounding homes and see, is what we're building going to be compatible with what's already around in the surrounding community. Once I've answered that question, I feel like we are compatible. I then go to the Forward Pinellas Plan, which is what you all have put out to us as the general public, and says, this is what we want to see here in a particular location. And so we use that as a heavy guide as to where we start looking for property to develop. And this property, obviously, when we looked at the Forward Pinellas Plan, showed us a 10 per acre desire on the county. Now, obviously, we're not looking to develop it at that intense level. We're looking at about half of that level of development here. Once we went under contract, we did immediately go and meet with the Lawless family, which are the folks that are most impacted by this. If you look at, I believe it's Pleasant Road there, heading north and south, they own all of the property up to Valley Road at that intersection there. And I believe it was 3 separate meetings with them in discussing what our plans would be, how it might impact them, how it might impact their property, what concerns they had, and was there anything that we could address in their concerns during that time. Once we got further along and had applied for zoning, I had received information that the Suncoast Primate Sanctuary had some concerns about our development. At that time, I reached out personally by phone to the Primate Sanctuary and asked to speak with the director and explained who I was, what we were doing, and wanted to see if there were any questions, concerns that I could address for them prior to any hearings or anything of that nature. I was told they wanted to see all of our plans prior to speaking with me. I said, certainly, we would be happy to show you everything. I then, at that moment, emailed them a copy of everything that we submitted to the county, the exact same package that we submitted to you all, they received. I did not receive any further communication from them after that, even though my email did make it perfectly clear we were willing to sit down and talk with them and address any concerns that they had at that time. Subsequent to that, at the LPA hearing after that, after the hearing, went out and spoke with the gentleman who had represented himself as, I think it was the CEO of the Primate Sanctuary, and I offered at that time, I said, I understand that you all have concerns about our development, and we would like to sit down and talk with you and see if, maybe there's a way that we can mitigate some of your concerns. Maybe there's something that we can do in our design. We don't know. I'm not a primate expert, not in our job description at D.R. Horton. But I said, maybe there's something that we can do. Maybe there's some compromise. I'm not sure about that. And I was told at that time that it was all up to the attorneys at this point. And he said something to the effect that the only way that there's a compromise is if we didn't develop the property. Unfortunately, I feel like that that's not a valid option for us. But, I want to make that clear that we did make very concerted effort to reach out to them and address any concerns that they had at that point. D.R. Horton has a very strong history of working with localities and municipalities across the Tampa Bay area. We are very friendly to our neighbors and very friendly with the communities with whom we work. So we're going to be working very closely with staff if you all choose to approve our application through the design process to make sure that all safety requirements are met. We want to have this to be a quality development in the end that not only we'll be proud of, but that the county can be proud of for having approved it. So I'm very confident that through that design process, all that will happen. And we do also have experience as a company in developing next to wildlife sanctuaries. To one of the counties to the south, we are currently developing down there and have worked closely with those folks and have not had any issues there. So anyway, we are open here for questions after the folks come and give their input. And we thank you for your time and look forward to your questions.
Any questions? Yes, Commissioner Flowers, go ahead.
I just want to ask a question for clarity on the map, if it's okay. We can use either the one that's up there, or we could use the map that is 6 of 11. But the property, I guess that's the industrial or warehouse little site. On that map there, it's to the right, up where it kind of makes the L notch. You see what I'm talking about?
West of the trail?
Yes.
And east of alternate 19?
Yeah, yes.
Yes.
The line, the red line, I guess that shows the boundary of where it is that you all would like to construct. It appears as though it's coming over on their property, and then it looks like there's a road there. So is that the accurate depiction of where it is that you also would be constructing?
At the very northern end of the subject property, it's multiple parcels. There is a 15-foot right-of-way that is in the middle there that runs east-west between the trail and Pleasant Avenue. We would be looking to vacate that right-of-way as it serves no purpose, and we're going through the right-of-way vacation process with your staff now.
Okay.
Okay.
Okay, thank you. Thank you, Mr. Chair.
Thank you. And on that same vein, when you go up that street, there's a home there in the end, and where you turn around to come out of there. Is showing on this property as opposed to
the home to the east of there is a home to the east of our property. I believe it's 4708 Pleasant Avenue.
Yeah, and it looks like your property includes that cul-de-sac at the end of the street.
That lot is not part of our property that we're seeking to rezone.
The one to the
east,
right.
where the notch is.
No, I understand. I'm saying where your property comes into connection with the road there.
Oh, yeah. There's a little round turnaround area there. That's
in front of another house. That house on to the east.
Yes.
So is that your property?
That what looks like a cul-de-sac is actually on our property. Yes, sir.
So accessing that property to the east, is that the way that seemed to be the way they accessed it?
It comes through there right now. Yes.
Huh?
What would they do?
Yeah.
What?
Houses have.
Where you're talking.
That cul-de-sac is part of what we're buying, but then.
Well, that's not a good map.
The
Well,
new road will service
6?
them and give them access to their property.
6. Oh.
Any of the existing homes out there would have access to their property from public roads.
that big property to the east
Yes.
has access.
Yes. Our plan, our concept plans do show them taking access from Pleasant Avenue as it comes into our project.
So there would be an easement there for them to get to their property?
Actually, it would be a public roadway, so they'd be able to get right to Pleasant Avenue, public roadway. Any roadways within our project are going to be public, dedicated to the public, built to Pinellas County standards, Commissioner.
Okay. I drove out there today, and it seemed like that
Is
home
that
had
a-
access at the top of the cul-de-sac, so.
Is
and
that a
it-
through road now?
Yeah, well, I thought it was right-of-way road, but where the circle, the turnaround is not. That's on your property.
Right.
And how you access that house is on that area.
Right,
So I didn't
and-
know if there was another way to access that property.
We would make their access part of, to our portion of Pleasant Avenue that is within our property, but that would be dedicated public right-of-way.
Okay.
So they would have access to a public road.
Okay. All right. Any other questions? Yes, Commissioner Gerard.
So wrong slide. So the buildings that you see on the Innisbrook property, those are two-story condos and clubhouses, if I recall correctly?
I believe so, yes.
Okay, so there are like 6 or 8 or 10 condos?
Yes. And then mostly where we abut, it's mostly the golf course itself.
Any requirements from the codes, our code standpoint that requires upgrading that road, the main road into the development out to Klosterman?
Pleasant
Yeah.
Avenue right now is only a 40-foot right-of-way,
Yeah.
so we are planning to dedicate 10 feet to make it a 50-foot right-of-way, which is Pinellas County standards. We can only dedicate the part that we actually have frontage on and own.
So no is the answer to the question. You guys aren't gonna-
Not all the way up
Yeah,
to Klosterman, no, we have no control over that. We will dedicate 10 feet of right-of-way for property that we control.
Any other questions for Robert? Okay, thank you.
Thank you.
And you still have about 8 minutes, Robert, 8 minutes, 40 seconds, if you need it later. Yes, if you need anything. Yeah. And I have 3 others for it. Carrie Kelly, is Carrie here? Did you want to speak? You have 3 minutes if you'd like to speak, Carrie. Hi, welcome.
I was told just to sign that as part of the, I'm the environmental consultant for this project. So
okay.
I just signed it in case I had to speak.
Okay.
They recommended that for me.
Okay, thank you, Carrie.
Thank you.
And then Angela Matthews? Okay. And Matt, I got Matt already, the attorney. Okay, so,
He's there.
yeah,
Right
did he have anything else? Matt, did you want to speak?
Not at this time.
Okay. We have several cards in opposition. Robert Aliano. Rebecca Hunt is waiving her speaking, at least that's what the card says. So George Pekin would be next after Robert Aliano, and then Lauren Rubenstein. Robert? Yeah. You have 3 minutes, Robert. Your name and address, please.
My name is Robert Aliano, address 6627 Springflower Drive in Newport Richey. I'm against the idea of basically because it is there's no substantial roadway from Klosterman, which would, in my idea, would affect the any emergency vehicles that need to get in and out of there. I don't see it as being safe.
Okay. Okay. Anything else?
No, that's it,
Okay.
sir.
Thank you, Robert.
Okay, thank you.
George Pekin, and then Lauren Rubenstein. I can't hear you, sir. Somebody's going to have to.
I'd like to speak after the attorney.
Is this Lauren? Okay, come on up, Lauren. Oh, you're representing 4 people, so you have 10 minutes.
Thank you. Good evening, Commissioners. Lauren Rubenstein here on behalf of the Suncoast Primate Sanctuary Foundation Incorporated. I'm with Denhart and Rubenstein. My address is 2700 First Avenue North in St. Petersburg, and I have been sworn. You all should have received a copy of my letter of objection that was filed on behalf of my client last week with the county, and obviously limit it to 10 minutes. I'm going to do a quick and high-level review of some of the objections, but I think that based on the questions and clarifications that staff has already provided, I think everybody has a good understanding of what many of the concerns are with this proposed development. 3 major concerns come down to traffic, compatibility with the neighborhood, and compatibility with the surrounding land uses. Traffic concerns, we have engaged traffic engineer George Deacon. He's here. He'll provide a brief presentation. But as you all have seen, alternate US 19, level of service F, it's awful out there. It's a traffic nightmare, especially when you get to rush hour. And being that that will provide one of the main access points to this new proposed subdivision, it obviously produces significant concerns. One thing that hasn't been talked about at all is when you come off of US Alternate 19 there, you actually cross the Pinellas Trail. So adding that many trips and that many cars to what right now is basically a 4-way stop with bicycles and pedestrians and runners going across there is something that certainly needs to be addressed. And then you bring all that traffic in through that neighborhood that you've heard described tonight. I hope a lot of you have had the opportunity to go out there. It's really kind of a hidden gem in Pinellas County. I would describe it as rural. I didn't really expect it when I went out there. And there's larger lots. It's zoned, all of those homes in there are zoned RA, RR, or R3. RA has a minimum lot size of 2 acres. RR's minimum lot size is 16,000 square feet. And then you get to R3, which is still a 6,000 square foot minimum lot size under your code. What they're requesting is a rezoning to an R5, which is a minimum lot size of 3,000 square feet. Obviously, that's 50% of what an R3 would be, and it's an RA lot at 2 acres is about 29 times larger. And that's what the current zoning on the majority of the acreage that they're looking to redevelopment is. And when you look at that, I think that's really the key factor when we're looking at compatibility and what the proposed density is. Their proposed density, and they highlight the future land use map change, it's only changing it from 2.5 to 5 units per acre. But you can't build 47 units out there with the current land use because of the current zoning. You can only build 12, I believe the staff relayed to you. So when you look at 12 single-family homes being developed, it's not as major of an impact. That neighborhood, the viability of it, the feel, the character of it continues. When we look at the surrounding land uses, there's also the issue of the primate sanctuary that is directly to the west of it. It is buffered by the trail, which is about 120 feet, give or take, around that area. But when you're looking at a density of a subdivision of 78 townhomes, the noise, the traffic, the lighting that comes with that, it's impossible to tell you exactly what that effect on those primates would be, but there's significant concerns. There's concern for the primate health. There's concern of what behavior they might exhibit should this density present itself. And as commissioners, you're looking at, is it compatible with the surrounding land uses? Is it compatible with the neighborhood? And you're required to look at that under your comprehensive plan. Specific policy 1.23 deals with the future land use map being compatible with the natural environment and the land uses in the surrounding areas. And we'd submit that the proposed density, as well as with the increased traffic concerns, the reduced setbacks that they would have in that area, is certainly incompatible. and it would be inconsistent with that policy of your comp plan. Same with policy 1.2.4. You've recognized specifically in your comprehensive plan that successful neighborhoods are central to the quality of life in Pinellas County. Redevelopment and urban infill development should be compatible with and support the integrity and viability of existing neighborhoods. And when you look at that existing neighborhood that's out there that you drive through, because let's be honest, that's what matters here. Innis Brook that backs up to it and is really the golf course surrounding it, you're not driving through Innis Brook to get to this proposed new development. You're not crossing alternate US 19 and going through the condos to access this new development. The only way you get there is through this neighborhood that consists of those 34 units that currently is not anywhere near the density that's being proposed at this site. The traffic engineer is here. He has run the traffic trip generation numbers. One of the major issues that he identified that I think just brings to light that there's going to be more impact than maybe anyone would really like to acknowledge on the applicant side is the traffic engineer's numbers. He agreed with the trip generation numbers that were provided by the applicant when it looks at the 78 proposed townhomes. When you look at the 71-story villas, it's a little bit different. They use the same local land use code for those trip generation numbers. Well, and he'll go into this a little more, but there's trip generation numbers with the Land Use Code 2020, which deals with multifamily housing of basically 4 units per building. And the one-story villas that they're proposing are only 2 units per building. So there's not a land use code that's specific to that. The next closest one is detached single-family housing. So the traffic engineer will explain he believes a more accurate number would be a compromise rate of those 2 land use codes, which does trigger more than the 50 trips during peak hours that would require a transportation management plan. Now, I heard from staff that they may require that down the road with site plan, but I think it's important to realize that it is a significant amount of trips that would be generated here. And the daily trips, gosh, I think it's 549 they've said. Well, I feel for the individuals that live on these substandard roads that are suddenly going to have 549 more vehicles passing by their house each day. In short, it's not compatible. It's not consistent with your comprehensive plan under policy 1.2.3, 1.2.4, as well as policy 4.2.3, which specifically looks at the transportation system and requires that on any decisions for future land use maps or the zoning atlas, that the county review potential impacts on the transportation system by considering the following. And one of those is the capacity of the surrounding existing and planned transportation network to accommodate any projected additional demand. And I'd submit that based on the testimony you've heard here tonight so far, your own common sense and the testimony that will be provided by Mr. Deacon, that certainly it's not consistent with that policy in your comprehensive plan. I'm here for any questions. If the board is inclined to grant a rezoning and a land use change on this property, I'd encourage that you utilize that conditional overlay that would allow you to make some additional conditions. Look at some increased buffers for the area that does functionally abut the Suncoast Primate Sanctuary. Look for additional setbacks, perhaps lower density than what they're looking for. The jump from 12 to 78 is incredible. If you could look at something that might be more compatible with the neighborhood, I'd urge you to do that. One last point is I did hear the applicant speak to him reaching out to my client. According to my client, they were not contacted, so I'm not sure who he spoke with at the primate sanctuary or who he emailed those documents to, but there never has been a meeting. The president of the board was approached by the representative of D.R. Horton after the LPA meeting, and my understanding of that conversation was not that there be no development, but don't build 80 units behind the primate sanctuary. Be a good neighbor and keep the land use the same, which, of course, the land use being proposed is more than double when you're talking about residential suburban to residential low. It goes from 2.5 to 5 units per acre. But again, with the current zoning on that property, it's much, much, much more limited than that. Thank you for your time.
Thank you. George? No. Huh? Yeah, you're going to take your 3 minutes here, right?
Correct.
Okay, thank you.
Right. Good evening, I'm George Deacon. I'm a registered professional engineer in the state of Florida. I've been practicing traffic engineering for over 40 years. I started at an early age, so I don't look that. To clarify one question that came up earlier, the distance from the project along Valley Road over to alternate 19, along Valley Road, it's a little less than 300 feet, and it crosses the Pinellas Trail, so it's very close to alternate 19. And likewise, if you go up Pleasant Avenue and then Roberts Road up to Klosterman, it's a right in, right out only. There's a raised median. I prepared a traffic, I was retained by Dunhart and Rubenstein to conduct a review of the trip generation study that was done by Palm Traffic. And I submitted a signed and sealed report of my review, and that should be in your records already. In doing that review, I did find an error in the trip generation analysis for the 70 villas. The villas are 2 units, 2 attached units in one building. The applicant had used the land use category for townhouse, multifamily townhouse, and that actually, when you look at the detailed description for what that entails, that's 4 or more dwelling units per building. And I did a review of the ITE trip generation for residential, and as a general rule, the more dwelling units per building that you have, the less the trip generation per dwelling unit. So I tried to find what's the appropriate trip generation for the villas, and I came up with a compromise average value that's in my report. And when you use that, that rate, appropriate rate for the villas, you end up with more than 40 trips in a PM peak hour, which triggers the requirement for a traffic management plan. And additionally, since it's adjacent to a critical corridor, the US alternate 19, it requires that the transportation management plan be reviewed by the Florida Department of Transportation. Again, the applicant's study for townhouses concluded that there were only 43 trips, but that was an error.
Okay.
That concludes my presentation.
Thank you. Did anybody have any questions for George while he's here? Okay, thank you. Okay, appreciate it. Brianna Cobb, and then Debbie Cobb. Brianna Cobb, Debbie Cobb, and then Tyson Sutton, and then Patricia Lola. Are you Brianna and Debbie?
Yes.
Okay, hi.
Hello. Hi, my name is Brianna Taub. I live in Palm Harbor.
Yeah, speak right into that microphone so we can hear you.
Sorry about
It's okay.
Hi, my name is Brianna Taub. I live in Palm Harbor, Florida. I am representing my grandfather, Joe Detto. He is 89 years old, and he wanted me to come and let you know that we both are opposing the 22 acres, tearing down the trees, and the zoning of R5. Thank you for your time, but please think about the future for everyone and not just the mighty dollar. So we are voting now.
Thank you.
Thanks.
Debbie, did you want to speak?
Yes. My name is Debbie Cobb. I'm 62 years old. I've lived in Palm Harbor. I graduated from Tarpon High. I'm very proud of my community. So the reason why I'm here tonight is because the sanctuary's been there 75 years. I have 7 properties in that vicinity right there. There's one thing I want to let you know. I have never been contacted by the Hortons. I also will let you know that you were right when you said that about the road at the end. The cul-de-sac, my mother actually gave that and worked with the Lawlesses back then. It is a dead-end street there. The other road is a dead-end street. The things that I'm concerned about are, I had a friend die because there is no roundabout on Klosterman because you cannot get emergency vehicles in, but only one way in and one way out. That shouldn't happen to anyone's family. My biggest concerns are the data that you've been given is very inaccurate. Before you move forward, I'm pleading with you to please do a proper study because you have a trail, you have alternate 19, you have, when I called FDOT, it is a failing road, it's an F. We know what an F is, and I'm living there. And it took 30 minutes for my daughters to get across the trail, to get over to the trail the other day. That shouldn't happen. Not in my neighborhood, not in your neighborhood. About the buffers, we all heard, don't worry about what you build around the sanctuary. Across the street, we've had 9 accidents that I've personally run to because I'm a medical person. Because there's no turn in for the development across from us. Can I ask each and every one of you that are voting on my community, how many of you have driven into that neighborhood? Could you let me know? 1, 2, 3, 4, 5. So you all know that those are 2 dead-end roads. You know they're not wide enough. And when he says dedicate the road, he means take land away from my friends that are in my backyard, that I'm here tonight to fight for them. The people that are in those homes, they didn't tell you they were built in the 30s and 40s. They've been there forever. And now they're going to have a development move in and going to change their lives forever. And you guys get to make a decision about that. And I want to thank you if you have come out. I also want to invite you to come over to the Suncoast Primate Sanctuary. We're just featured on Fox Business Network on Strange Inheritance. If you don't know, we have a 400-pound male orangutan there. We have a 76-year-old chimpanzee. One day, we were impacted by people taking trees down on the trail, and we called someone, and they made a difference that day. That person knows who they are, and I want to thank them. Thank you again for our time, and I most again graciously would like to invite you out to the Suncoast Primate Sanctuary.
Thank you.
Have a blessed day.
Thank you, Debbie. Tyson Sutton and then Patricia Lolis? Hello? Hi there.
I just believe that there shouldn't be destruction to the property that's right behind the Pinellas Trail when so many people use the Pinellas Trail every day.
And you're Tyson?
Yeah.
Okay, I just want to make sure I got you right. Okay, go ahead. I'm sorry, didn't mean to interrupt you.
I just believe that there shouldn't be destruction to the property right behind the Pinellas Trail when so many people use it every day. It will affect a lot of people.
Okay. Thank you, Tyson. Patricia? Lawless?
Lawless.
Sorry.
Patricia Lawless. I live at 4708 Pleasant Ave in Palm Harbor. I have concerns. Mostly everything's been said tonight, but I just wanted to repeat about the traffic. We are a very old neighborhood, mostly built in the 40s. These townhomes are going to overpower us. The street improvements, I don't think they're going to have enough right-of-way to do what they're saying because of the properties I own. They talked about dedicating. Don't really think I'm going to be giving any land away. And it was brought up at the end of the cul-de-sac. There is a filed document where we have a I don't know if it was dedicated or given to us or what the exact wording is, but it is a judgment that we have, I guess, for the dead-end cul-de-sac is. It's to the left in front of our property. And I just think it's too much building for the little neighborhood.
Okay, thank you. I don't have any others. Kat, did you have anybody online?
I did not.
Okay. Okay, how much time did the applicant have? You have about 8 minutes or so, 8+, if you would to come forward and make any closing comments.
Yes, Robert Pergolizzi for the record again. Regarding no substantial roadway access to Klosterman Road, we understand that those are substandard roads. There's not much we can do about that. We will be paying impact fees to the county that could be used for improvements, potential pavement widening within the existing right-of-way. Again, we can only dedicate right-of-way where we own the abutting property. Regarding traffic, and Mr. Yates will get into rebutting Mr. Deacon's assertions. As far as the trail crossing, Valley Road has stop signs at the trail crossing. The traffic stops for people on the trail. The current zoning of RA limits it to 12 units. RA is it's an anomaly in the area. There's not much RA left in the county. Most of it is being developed. The countywide plan allows up to 10 units per acre, and we're asking for 5 units per acre, half of the countywide plan maximum. Regarding the effect on the Suncoast Primate Sanctuary, we believe we're going to have less noise than the primate sanctuary. And D.R. Horton is going to be providing disclosures, full disclosures, to any prospective home buyers that they're buying a home near the Suncoast Primate Sanctuary. And I believe that the 120-foot wide Pinellas Trail provides a huge buffer between the Suncoast Primate Sanctuary and our project. The villas, the 70 villas that are proposed, those are only 2-bedroom units. And D.R. Horton tells me that those are marketed to 55 and over. Not deed restricted, but they are marketed to 55 and older, so you will get a fair amount of retirees living there, which have less traffic impact. I will now ask Mr. Yates to discuss the transportation trip generation dispute.
Good evening, Michael Yates with Palm Traffic, and I have been sworn. Just wanted to go into a little bit of what Mr. Deacon commented on the trip generation for the site. What we used in the analysis we believe is correct. So we all use the ITE trip generation manual for estimating trip generation. And the prior edition was called the 9th edition, and that had a lot more categories for, whether they're attached, detached, how many units are attached. And so the old land use code was Land Use Code 230, which was very specific in the sense that it outlined that it was 2 attached units, and it was, very specific. When they went to the 10th edition, they got rid of all the multifamily townhome classifications, and they just did one land use category, which was 220. And while Mr. Deacon is correct in the sense that it does say located within the same building with at least 3 other dwelling units. So they, in the language of the description, they used 3. They got rid of the 2 that used to be there. However, in the additional data right under the definition, it says specifically in prior editions of the trip generation manual, the low-rise multifamily housing sites were further divided into rental and condominium categories. An investigation of the trip data found no clear differences in trip making patterns between the rental and condominium sites within the ITE database. As more data are compiled for future editions, this land use classification can be reinvestigated. So basically what ITE is saying is that they combined all the categories that used to exist into this new 220. So they got rid of the old 230, which would have been the duplex. It is now part of 220. And so I still believe the 220 that we use in the analysis is correct for a duplex villa type development. I'm happy to answer any questions, but we do believe what we used in the analysis is correct. per ITE's definitions.
Thank you. Any questions? Okay. Go ahead, Robert.
Just in summary, if we are required to do a transportation management plan per section 150-48, that is something that is reviewed by your staff at the site plan, and we'd be happy to do one if requested to do it. With that, I just reiterate that your staff had recommended approval, and the LPA had recommended approval 5-1. We feel that our development is compatible. We feel that we have adequate buffers. We're increasing the amount of preservation, providing upland buffers around the wetlands, and providing drainage retention to further serve as buffers. So we request your approval to transmit this to DEO and set a second hearing for June. Thank you.
Thank you. Any questions here? Okay, thank you. Okay, what's the will of the, any comments, any discussion? Well, I'm going to just talk a little bit because I'm a little concerned about the scope of the project, given the area, given the community that it goes through, given the fact that accessing this property on I believe I'm correct, there's no middle lane on 19 there, so if you're traveling south to get in there, you're stopping traffic to get in, then you're hitting a trail to get into the project. Going north to Klosterman, again, you're turning out to the right. If you want to go to the left, you've got to go up, make a U-turn. If you're traveling west on Klosterman, you're going to have to do a U-turn, cross the trail, or right at the trail. So there's a lot of area issues with the intensity of that. I mean, when you think about that neighborhood there with about, I think they said 30-some units, versus what we're going to be putting into that area, it just feels to me like the scope of that project is just too large. Again, just my concerns with that project, and maybe if you could just come, somebody from planning come back up. I just need to ask you a real quick question on. I've heard 12 units, 47 units, 80 units, and then I heard just now that, well, we could put double that, so 160 units, but we're not. So talk to me a little bit about the units that are allowed on that property, again, starting from where we are now to what ultimately could be done that they're not even proposing to do. Just
Yes. So currently, how it sits now, with the current land use and zoning, they could get up to 12 units.
Okay.
That would be 1 unit on the property that's zoned R3, and then 11 units on the property zoned RA. With the current land use, the residential, suburban, and preservation land use, if rezoning was changed to some, R3 or something, they could potentially get up to 47 units per the current RS land use. And if a land use and zoning amendment was granted without a conditional overlay, they could potentially get up to 82 units would be the maximum. With their proposed conditional overlay, their maximum is 78.
okay.
If any higher density than that, you'd be looking at a different land use category.
No, I just heard the comment that we're doing half of what we could do, so I just want to make sure I heard
Well,
that.
the countywide plan, which allows up to 10 units an acre, which is RLM,
I got you.
we're allowed to be more restrictive than
Gotcha.
the countywide.
Okay. All right, thank you.
You're welcome.
Robert, did you have something? Yeah.
One thing to add.
Yeah.
If during the site plan review, a traffic analysis determines that a left turn lane on alternate 19 is needed to turn left into Valley Road, we would certainly be constructing that and obtaining the required FDOT permit to do that improvement within the state right-of-way. I just wanted to make that clear.
Okay, thank you. Thank you.
Thank you.
Yes, Commissioner Seal.
So to that end, in my years of knowing FDOT, did you go approach them and see if they would even allow that?
We have not spoken to FDOT yet, but obviously this is the very first process. But FDOT typically likes when you put turn lanes in where left turn lanes don't exist right now, particularly on two-lane undivided roadways. So we would certainly approach FDOT. You have to.
I could speak to that. I do a lot of DOT permitting, so yeah, there is the ability to put the turn lane, as you know, to the north. It's already widened out to 3 lanes, and then it widens out even more when you get into the intersection of Gloucesterman with the additional turn lanes. And also to the south, it has also been widened out to a 3-lane section. So it is just this section in front of Valley that is still a 2-lane, so there is sufficient room to widen the road and put in a turn lane at that location.
Okay.
If it was deemed required.
Simply put, we have an accordion here.
And we haven't met with DOT. We're not contiguous to DOT, so it's not part of a typical permitting when you're not contiguous.
Okay. Any other comments or questions? Yes, Commissioner Flowers.
Thank you, Mr. Chair. I'm looking at some of the language that was in the petition from the residents. A couple of things. One was asking the developer to do a detailed traffic study. Traffic study was done. I really didn't see traffic mitigation. I am grateful for the things that you are suggesting at this point, but I guess that's why we have so many people here even speaking, because that information was not gleaned earlier. But the second part, which was a buffer between, or to better shield the development from the Suncoast Primate facility. Someone did speak about a 300-foot separation, I guess, from where your project would be to the Primate Center. Did you make any overtures or suggestions regarding a buffer between your project and the Primate Center?
I personally did not.
Well, I just mean project in general. I'm sorry, not you specific.
What we are proposing is the Pinellas Trail serves as a 120-foot buffer between the Primate Sanctuary property line and our western property line. Furthermore, we will have a building setback of at least 10 feet from the property line to any building. So that is the extent of the buffer that we are proposing with the conditional overlay. I know Mr. Whaley can speak more to any discussions he's had with the Suncoast Primate Sanctuary people.
Okay, because I guess I can't read into what they mean by a buffer, but I think they would mean something more than just the trail itself, because if you're talking about noise or, things that may startle the primates or whatever, a trail would not be considered a buffer, even though it's a physical barrier. It's not anything that would break sound or deter sound. Mr.
It would also include fencing, at least a 6-foot high PVC fence on our western property line adjacent to the trail, and then landscaping between the rear fence and the rear of the buildings.
Okay.
I was never given that number that you're speaking of. That's the first number that I've heard that from anyone. And again, I just looked back in my email archives while we were discussing, and March the 4th was when I emailed that to the email that I was given by the receptionist at the Suncoast Primate Sanctuary that day on the 4th. And I asked to speak with the director, and she said she was going to speak with the director, and came back and said the director has said she would like for you to email her copies of everything that you are planning to do. So if any of the commissioners would like, I'm happy to share that with them. And again, when we talked with the folks after the LPA hearing, we're saying, hey, let's sit down and maybe there's a way we can work together. But that was not in their vocabulary at that time. We have a history of working with surrounding neighbors in all of our communities. But I can't come up with these suggestions by myself. If you don't have a partner to work with, then there's no partnership.
And when you say they, you're talking about the persons at the primate center?
Yes, ma'am.
Okay, all right.
So, I mean, we've made the overtures to try and see what compromises we can make, what things we could do with our landscaping, maybe the berming we can do. There's all sorts of, things you can do to get creative to limit impacts on neighboring developments. But, if you don't know what your neighbors are looking for, I can come up with solutions and ideas all day long, but how do I know whether they would work or a possibility if you don't have any communication from, your neighbors? We want to be a good neighbor, and we still do. That's never been the issue.
Thank you. Any other questions before they leave? Okay, thank you. I think we're good.
Okay.
Okay, so what is the will of the commission? I'm obviously waiting for some kind of response. There's obviously still a lot of questions and issues. We're not jumping to approve or turn it down. And I'm not trying to be, a great compromiser here, but, again, this many units seems like a whole bunch, and 12 maybe a little on the light side. And so I'm not hearing comfort with the proposal. And so I think people are understanding development and the ability to do something, but certainly not. Again, I'll stop. I won't speak for everybody. Commissioner Long, go ahead.
Well, thank you, Mr. Chair. I was just going to ask for clarification that my understanding is, given that we move this forward this evening, it goes up to the state, correct? But then doesn't it come back to us?
It does. What your staff recommendation for you to vote on tonight is two things: an approval of the zoning as proposed, including the conditional overlay, which has the limitation to the 71-story or 78 two-story. So that's one action. Your resolution that adopts that zoning specifically makes it contingent upon the eventual approval of the land use. So the second action you would be taking tonight is to transmit the land use action to the state to receive comments back, and then that action would come back for you for a final hearing, at which time you would take final action on the land use, of course, the zoning being contingent on the land use.
However, if this is not something we're going to support, if it came back from the state, we really should be taking a stance at this time, rather than,
Agreed.
Waiting for in my opinion, waiting for the comments back from the state. I tend to concur with Commissioner Eggers. I'm not sure that I agree with the intensity of this. I would have preferred if they had the roadway solved as far as the left turn lane and some other details in this before we would approve it, because I do agree that at this point, a right turn only onto Alt 19 is going to be the only reasonable, safe alternative for traffic unless you constructed a turn lane. And we don't have any guarantees that that could be done.
May I make a suggestion?
Mm-hmm.
So tonight is a transmittal hearing to transmit the land use plan amendment to DEO and to Forward Pinellas. The rezoning and the conditional overlay are contingent upon the land use. The rezoning means nothing without the land use, correct? So it would have to come back, I believe it would be June 22nd for a second hearing. Between now and then, I would have Mr. Yates do a detailed traffic analysis of this project and determine the need or not need for a left turn lane or any intersection improvements at alternate US 19 and Valley Road. And that would be submitted to the county well in advance of the second hearing, if we could move this forward tonight.
But you're not proposing to change any of the site planning or number of units that you're asking?
At this point in time, I'm not, I'll need to talk with my friends at Horton
Okay.
regarding that before we go any further.
Commissioner Long and then Commissioner Gerard.
So, Robert, I've heard you present to us quite a few times, and
Yes.
I find it necessary to really listen to you closely. So, in listening to you closely, I'm pretty sure that I heard you say again and again, it seemed to me anyway, that you are aware of several of the things that we might have found objectionable, which I think we've kind of waxed all around this evening. And you were very quick to say, well, in the event that were the case, I'm sure we'd be amenable to X, Y, or Z. So I liked your suggestion, and I'd be happy to move in that direction as long as you can gather with your folks and figure out what you really are prepared to do to make it a little more palatable next time we meet. Because several of us that are sitting here tonight are also on Forward Pinellas. Right?
Right.
Yeah.
But
So,
that's a tier 1 at the Forward Pinellas, though, a tier 1 land use amendment.
well, we haven't gotten there yet, so
Right.
I don't really want to answer that until I know exactly what it is we're talking about.
Well, I'm happy to talk with the folks at Horton. I'll get with them right now. Are you looking for a specific answer right now? I mean,
No.
we will commit to do a detailed traffic analysis of our proposal. If that involves reducing the number of units, we'll discuss that as well and come back to the county for a second reading on June 22nd if we can move forward tonight to
Yes,
transmit.
and I would recommend,
Okay. Hold on one sec. Can you hold that? Because Commissioner Gerard wants to.
Yeah,
Commissioner Gerard.
thank you, Mr. Chair. It's been a long day, Robert.
It
Sorry.
has.
So, yeah, I would like to see you go back and talk about the traffic issue, but also I would like to see the people who are opposed to this sit down with you guys and tell you what it is you have a problem with. I mean, and what kind of mitigation efforts they may need to do to make you minimally happy.
We'd love that too.
Well, and I don't like the idea that anybody has to refuse to meet with you. Because this is the way we deal with things a lot. Get together with the community and come back and tell us what you guys decided, because, we don't like to piss everybody off at once.
We will do that. You have our commitment, we will do that.
I appreciate it.
Okay?
Well, and I would appreciate it if you all would do that too, particularly you from the sanctuary who have been so activist about this.
And who knows, you might find some common ground. And so I agree with you, Commissioner Gerard.
But I just wanted to who, I'm sorry. Okay, hold 1 second, please. Let us have some conversation here, and before we make any decisions, we'll, thank you, Robert. I think we're good.
Okay,
But don't get too far, but I think we're good.
I'll be right here.
Okay. From my perspective, just so I'm clear, maybe staff can help me with this. If we're going to transmit this, and it's just really dealing with the land use, and in its absence, they're going to talk to the community, they're going to talk about transportation, and that all is a reflection on potentially the density too, because I'm not prepared to for me, that density issue, that what they're proposing is just way out of line. So if that's on the table for discussion, and we don't have to make any because what I heard you say in the beginning was committing to that C5 in the overlay. I don't want to do that tonight.
You could always choose to and I want to hear what the planners have to say. You could always choose to transmit the ordinance to the state that contains the land use first hearing, that you would send it to the state and get comments. You could defer action on the zoning. And then, because you have to come back for that second hearing on the land use anyway.
Okay.
So you could choose to take no action on the zoning and simply transmit the land use. And I'd be interested to hear what my colleague here has to say.
Yes, that's what I was going to make the recommendation and ask Ms. White that if that was the action you could take is on the land use, because the conditional overlay that limits the density, that would limit the uses, buffering, that's all tied to the zoning. So if you wanted, you could, as Jewel said, defer action on the zoning resolution and just take action on the ordinance for the land use only.
And Michael, do you know what the date is, the June?
I'm not sure of the date. It all depends on the timing where it gets to the state, and
Okay.
if the state has comments, or we have to send comments back. Turnaround time is pretty quick from the state. So it all depends on the time we get comments back from them and scheduling for the meeting. So the June one would be the earliest.
And I just simply ask that because if you all were going to defer the zoning to a date certain, you wouldn't need to re-advertise. However, if the zoning was to come back to you in a somewhat different form, for instance, if the conditions involved in the overlay were to look different than what they do tonight, it would need to be re-advertised anyway.
Yeah. Commissioner Long, did you have something?
I was going to ask if I could make my motion before I forget what it is I want to say.
Commissioner Gerard, did you?
Yeah, thank you. I was going to suggest that we vote to transmit the land use portion of this discussion as we have been talking about, and that we defer the zoning tonight until we have more clarity on how we're going to move forward. Did I say that right?
On the traffic as well as.
All of that.
Whatever
And the
conditions we
density.
might.
Whatever conditions are developed, because neighborhood has part of it, traffic has part of it,
Right.
access has part of it,
And I just wanted to say, apologize if I was being rude before, but I'm really tired. I'm inclined to allow them to do something on this land. So the reason I'm saying y'all need to get together is something is probably going to happen there. And if you want to have something to say about it, or some form of negotiation about that, then that's up to you guys.
I don't disagree.
Okay.
Okay.
Okay, hold on.
My turn.
Okay.
That's all I wanted to say about that.
Okay.
I want to make sure that you're going to be willing to sit down with them, because there will be something there.
And before I go any further here, the gentleman wanted to just say, just 1 minute, okay? Come forward, because we're really past that part of the meeting.
I understand. Thank you very much for giving me the time. Representation's been made about conversations that included me. I deferred my time originally so that we wouldn't have to rehash anything. I'm the president of the Suncoast Primate Sanctuary. My name is Dale Jackway. I'm a resident of Pinellas County. My specific conversation with D.R. Horton representative was that he came up to me and asked me, is there a way that we can be good neighbors? And we talked about a couple different things, and what I said was, yes, a good neighbor wouldn't put 80 units there. I am not against anyone developing their property. I'm all about the free development of your property. I understand how this works. But what I was saying to him, too, was that I cannot talk to you because we have an attorney in the LPA meeting who wrote a letter, said you need to contact him. We then subsequently got another attorney who just wrote another letter to you that just presented for you, and she has never been contacted. As an individual who represents this corporation, I'm not an activist, but I will tell you that if you want to put 80 homes next to 400-pound animals that are on the very edge of the trail,
I hear
We're
you.
gonna have
Thank-
issues.
I appreciate your clarifying. Okay, so I think the message is we weren't comfortable with the 75 to 80, and we know that 12 is probably on, so you guys we're just saying that there's going to be some development there north of 12 and certainly south of 80, and a lot of work to do, a lot of work to be done. And again, I don't, I know that's a quasi-judicial process, but nonetheless, I just wanted, you heard that from a number of commissioners. We have a motion to transmit the land use with a lot of things, work to be done, and a second.
Question?
Yes.
So what I'm hearing is that if we had bifurcated the land use and the zoning from the very beginning,
I was, no, yeah, no, I'm with you. I'm with you. All right, so we have a motion and a second. All in favor, say aye. Aye. Any opposed? Motion carries 6-0.
Mr. Chair, just for a point of clarification, who was the second on that? I apologize. Thank you.
Okay. All right, there we go. That's number 38. Now we're on to item 39. Go ahead, Kat.
Thank you, Mr. Chair. Agenda item number 39 is case number LDR-21-01. This is the second of two public hearings. It's a proposed ordinance providing for the amendment of chapters 138 related to zoning and chapter 154 related to site development, right-of-way improvements, subdivisions, and platting of the Pinellas County Land Development Code and the adoption of the Transportation Design Manual. The public hearing was properly advertised and an affidavit of publication has been received for filing. No correspondence has been received. The matter is properly before the board to be heard.
Thank you.
This is the second of the public hearings regarding the minor amendments to the Land Development Code.
Okay. Are there any questions? Does anybody need, okay, we got a motion from Commissioner Flowers, second from Commissioner Seal. Nobody wants a presentation? I'm kidding. I'm kidding. All in favor, say aye. Any opposed? Motion carries 5-0. Item 40.
Agenda item number 40 is a proposed resolution making a finding of necessity that blighted conditions exist within the Pinellas Park Community Redevelopment Expansion Area and approving amendments to the Pinellas Park Redevelopment Plan. The public hearing was properly advertised. An affidavit of publication has been received for filing. No correspondence has been received, and the matter is properly before the board to be heard.
And there's comment that this action will correct minor Scrivener's errors identified in the legal description. Just, it's in here, addressed to formally take action on the city's finding of necessity. So are there any questions? Move a motion from Commissioner Seal. Oh, second from Commissioner Gerard. Any final comments, questions? All in favor say aye. Aye. Any opposed? Motion carries 5. Hold on. Right, everybody's going, ready to go. It passes 5-0. Any final comments? None? The meeting's adjourned.